नमस्कार। आयुष दर्पण डिजिटल ऐप के प्लेटफॉर्म पर आपका स्वागत है। ये छोटा प्रमोशनल वीडियो आज हमने उन यूज़र्स के लिए बनाया है जो ये जानना चाहते हैं कि आयुष दर्पण ऐप का इस्तेमाल किस तरह से किया जाए। इसके लिए आपको सबसे पहले अपने फ़ोन में प्ले स्टोर में जाना है। प्ले स्टोर में जाकर सर्च बार में आप टाइप करें आयुष दर्पण डिजिटल और सर्च करें। सर्च करने पर आपको ऐप की लिस्ट में आयुष दर्पण डिजिटल ऐप मिलेगा। आप इसे डाउनलोड कर लें। चूँकि मेरे फ़ोन में ये ऐप पहले से डाउनलोडेड है, इसलिए मैं इसे ओपन करती हूँ। ऐप ओपन होने पर आपको लॉगिन सेटअप मिलता है, जहाँ पर आपको लॉगिन करना होता है। आप अपना फ़ोन नंबर डालकर यहाँ पर लॉगिन कर सकते हैं। लॉगिन करने पर यहाँ पर OTP प्राप्त होता है और आपका वेरिफिकेशन होता है। लॉगिन के समय पर आपको वहाँ पर ऑप्शन मिलता है कि आप एज अ पेरेंट लॉगिन करना चाहते हैं या एज अ स्टूडेंट। तो वहाँ पर ये ध्यान रखें कि आपको एज अ स्टूडेंट लॉगिन करना है। साथ ही अगर आप आईफोन या iOS यूज़र हैं तो आप सबसे पहले प्ले स्टोर में जाकर माई इंस्टीट्यूशन ऐप डाउनलोड करें और उसके बाद आपको ऑर्गेनाइजेशन कोड मिलता है आयुष दर्पण डिजिटल का TYNVU, ऑल लेटर्स आर इन कैपिटल। आप ये कोड एंटर करके और उसके बाद फिर आयुष दर्पण डिजिटल ऐप तक आप एक्सेस कर सकते हैं।
नमामि धन्वन्तरिमादिदेवं सुरासुरैः वन्दितपादपद्मं लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
नमस्कार सभी गुरुओं को मेरा कोटि कोटि नमस्कार। आज के इस लेडी सर्जन्स कॉन्फ्रेंस चैप्टर 2 में मैं आप सभी का तहे दिल से स्वागत करती हूँ, आप सभी को नमन करती हूँ। I welcome all the dignitaries on the very coveted platform of Ayush Darpan Digital Forum, and in collaboration with Shalatantra Department, Mahatma Gandhi Ayurved Medical College, Hospital and Research Center, deemed to be University Savangi Vardha. We welcome you all on this dignified platform of Lady Surgeons Conference Chapter 2. The theme is contribution of female surgeons to Ayurveda surgery through the uniqueness of their surgeries. On this forum, we have already conducted chapter 1 last year, that is on the very International Women's Day celebrations 2021. In that chapter, we had 16 reputed speakers from all over India, and it was a great event which we had already conducted last year. Dr. Vashne sir was chairman of that particular event. Dr. Sangeeta Salvi madam was one of the dignified speakers of our event, and it was highly appreciated event last year. With the very encouraging enthusiastic response from all our gurus and Ayurveda fraternity, I am very much delighted to say that I have dared to hold the chapter 2 of the Female Ayurveda Conference, Female Ayurveda Surgeons Conference here on this forum of Ayush Darpan, and this year in collaboration with Mahatma Gandhi Ayurveda College, Wardha. So once again, I am very much happy, I'm very much delighted to celebrate International Women's Day 2022 with the dignified gurus of the cadre of Dr. Subhash Chandra Vashne sir, Dr. D.N. Pandey sir, Dr. Shrikant Kashikar sir. Sir, welcome. I welcome all of you. Welcome Dr. Professor Sunita Suman ma'am. Welcome all the dignified speakers. Welcome Dr. Suman Sharma ma'am from NI Jaipur, Dr. Sunita Suman ma'am from BHU, IMS BHU. Am I audible? Am I audible? Am I audible? Please, anybody let me know. Sangeeta ma'am, am I audible? Okay, okay. So yes, actually I was trying to confirm because Vashne sir ji ka message hai ki no sounds, that's why I was worried little bit, but now it's okay. So I welcome you all dignitaries, all the dignified speakers and my audience to this International Women's Day celebration 2022 on the Ayush Darpan web portal forum and in collaboration with Mahatma Gandhi Ayurveda College. And with this, we'll be moving towards our virtual inauguration ceremony. So officially, I request Dr. Subhash Chandra Vashne sir to declare the inauguration of the program virtually. Sir ji, you are not audible, sir. I think there is some audio issue, sir, over there. So I request Dr. Naveen Joshi, sir, to address us with the organizing president's remark.
मैडम फर्स्ट यू बेक ऑल टू द को-होस्ट, एज आप होस्ट है ना तो आप ही अनम्यूट कर सकती हैं सबको।
जी जी जी,
मैं सबको को-होस्ट बना देता हूं तो अच्छा रहेगा जी।
हाँ, वो सबसे बेस्ट होगा सर जी।
मैं सबको को-होस्ट बना देता हूं, मैंने सोचा आप कर देंगे, चलिए मैं बना देता हूं।
सर एक्चुअली आई वाज इन,
और मैं सबको को-होस्ट बना रहा हूं, तो फिर आप जिनको भी चाहें उनको को-होस्ट बना सकती हैं, वो अनम्यूट करके वो वाइब रहेगा जी। अब सर देखिए वाशने सर अब अनम्यूट हो गए हैं।
अभी बोलिए वाशने सर जी, अभी आप आपके रिमार्क्स दीजिए प्लीज।
सर का ऑडियो कनेक्ट नहीं हुआ है शायद, मुझे लगता है।
हाँ जी सर, ऐसा लग रहा है। वाशने सर
आप बोलिए, कुछ बोलिए सर, आप बोलिए।
सर अपने को अनम्यूट कर लें अपनी साइड से, तब होगा। मैडम ने अनम्यूट कर दिया है। प्रोफेसर वाशने सर,
सर आप एक बार मीटिंग को लीव करके एक दोबारा कनेक्ट हो जाएं तो आपका ऑडियो कनेक्ट हो जाएगा। आपका शायद ऑडियो कनेक्ट नहीं हुआ है, आपका वीडियो कनेक्ट हो गया है, आपका ऑडियो कनेक्ट नहीं हुआ है जी।
मैं कॉल कर देती हूँ सर को। नवीन जी, तब तक आप आपका एड्रेस दीजिए।
जी धन्यवाद, आप सभी का बहुत बहुत स्वागत है ये शल्य तंत्र के इस कार्यक्रम में, जिसमें महिला दिवस पर ये कार्यक्रम आयोजित हुआ है। मैं डॉक्टर नवीन जोशी आप सभी का बहुत बहुत स्वागत करता हूं आयुष दर्पण के इस मंच पे। अभी ये YouTube पे ये प्रोग्राम लाइव है, आप इसको मैंने आपके व्हाट्सएप ग्रुप में शेयर कर दिया है। आप इसको, जो लोग यहाँ नहीं जुड़ पा रहे हैं वो YouTube से भी ज्वाइन कर सकते हैं। बाद में ये Facebook पर भी प्रोग्राम आएगा। पिछले साल डॉक्टर शीतल असुतकर मैडम ने ये काफी अच्छा प्रोग्राम चलाया था, और सर सुभाष चंद्र वासने जी सर के निर्देशन में एक बहुत लगातार एक श्रृंखला चली थी शल्य तंत्र की। वो मैं बताना चाहता हूँ कि इसी श्रृंखला से प्रेरित होकर के हमारे विश्वविद्यालय के वाइस चांसलर सर प्रोफेसर सुनील जोशी सर ने एक शल्य तंत्र के विशेषज्ञों की एक इंसाइक्लोपीडिया को बनाने का भी निर्णय लिया, जो आज फाइनल स्टेज में है और वो पब्लिश हो जाएगी। मुझे उम्मीद है कि आप सभी लोगों ने, जो शल्य तंत्र के यहाँ पे विशेषज्ञ हैं, उन्होंने अपना रिज्यूम वहाँ भेजा होगा, और वंडर पब्लिकेशन है। मैं सर आपको अनम्यूट कर रहा हूँ। सर अब आपका ऑडियो कनेक्ट हो गया है जी।
ओके, थैंक यू सर, थैंक यू
जी सर। अब मैं वार्ष्णेय सर, हमारे जो परम गुरु वार्ष्णेय सर, सुभाष चंद्र वार्ष्णेय सर को आमंत्रित करती हूँ।
आप अब जिसको भी अनम्यूट करना हो उसको को होस्ट बना दीजिएगा बस।
हाँ जी, मैं आपको आमंत्रित करती हूँ सर, आपके चेयरपर्सन रिमार्क के लिए। आज के सेशन का इनॉग्रेशन आप वर्चुअली ऑफिशियली अनाउंस कीजिएगा सर।
ओके। तो या देवी सर्वभूतेषु शक्ति रूपेण संस्था नमस्तस्ते 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 नमो नमः। आपने ये इंटरनेशनल वुमेन्स डे के ऊपर ये वुमेन्स जैसा लेडी सर्जन का जो आयोजन किया है, वास्तव में बहुत ही वंदनीय है और बहुत ही सराहनीय है। तो इस अवसर पर पहले तो मैं डॉक्टर श्री नवीन जी जोशी जी, डॉक्टर DN पांडे सर, संगीता सालवी मैडम, सुमन शर्मा और मैडम शीतल आसकर, आपको भी सबको धन्यवाद देता हूं कि आप जो है इस आयोजन को कर रहे हैं आज। और ये जो आयोजन है, वास्तव में जो वर्ल्ड इंडिया इंटरनेशनल जो वुमेन्स डे है, ये क्यों मनाया जाता है आप सबको पता ही है कि स्त्री शक्ति को जागृत करने के लिए, जेंडर इक्विटी के लिए और प्रॉस्पेरिटी के लिए, और सब बराबर है ऐसा उस जो है प्रदर्शन करने के लिए पूरे संसार में यह प्रयोग चल रहा है। और वास्तव में स्त्री शक्ति हमारे यहाँ तो शुरू से ही आदि शक्ति के बिना कोई काम होता ही नहीं है। भगवान शिव भी शव के समान है, यदि शक्ति ना हो तो निश्चित ही आपका यह आयोजन सफल होगा। इस अवसर पर मैं मैडम नीलाक्षी, जया शीतल, पश्मीना जोशी मैडम, अमृता मिश्रा, माधुरी बनारसे, प्रज्ञा मैडम, निर्मला मैडम, विनीता त्यागी मैडम और मीना मैडम, इन सबको, और रीना जायसवाल आल्सो, दुष्मा, इतने पार्टिसिपेंट है, सबको बेस्ट विशेष करता हूं। और आप जो है बिना देरी के एक आयोजन सफल रहे, इसी भगवान धन्वंतरी से प्रार्थना करता हूं। सबको बेस्ट ऑफ लक देता हूं और पुनः मैं आप सबको एक बार पुनः बधाई देता हूं कि आप यहाँ पर जुड़े। धन्यवाद मैडम।
बहुत बहुत धन्यवाद सर, बहुत बहुत धन्यवाद। आपके गाइडेंस में ही हमने पिछले साल ये जो प्रोग्राम है ये बहुत ही सक्सेसफुली कंडक्ट किया था। तो इस साल भी हमने इसी कारण ये सेकंड चैप्टर लेने का एक धाड़स किया है, एक धीरज किया है कि ये हम सेकंड चैप्टर भी उतनी ही सक्सेसफुली कंडक्ट करना है। इसी श्रृंखला में मैं आमंत्रित करना चाहूंगी प्रोफेसर डॉक्टर DN पांडे सर को कि सर आप अपने 2 शब्द कहिए।
नमस्कार आप सभी को, गुड मॉर्निंग, अस्सलाम वालेकुम, सत श्री अकाल। आज के इस दिन पे ऑर्गेनाइजिंग प्रेसिडेंट डॉक्टर नवीन जोशी जी, ऑर्गेनाइजिंग सेक्रेटरी डॉक्टर शीतल आसुतकर जी, ऑर्गेनाइजिंग चेयरमैन प्रोफेसर S.C. वासनी जी, एंड गेस्ट ऑफ ऑनर प्रोफेसर श्रीकांत काशीकर जी, संगीता सालवी जी, सुनीता सुमन, विनायता पाटिल, कामिनी धीमान, and other guest speakers and delegates. Really, I am delighted to be a part of this International Women Day. भारत में तो हमेशा नारी को पूजा जाता रहा है, लेकिन इंटरनेशनली भी उसको रिकॉग्नाइज किया गया है, बहुत बड़ी बात है। और इसलिए और इसका महत्व बढ़ जाता है कि पूरा विश्व इसको मना रहा है। आज के दिन आप लोगों ने जो ये प्रोग्राम सेट किया, उसकी शुरुआत इंटरनेशनल वुमेन डे इज ए ग्लोबल हॉलीडे सेलिब्रेटेड एनुअली ऑन मार्च 8 कल होगा, और इन कंटिन्यूएशन ये 2 दिन का प्रोग्राम अवश्य सक्सेसफुल होगा। The theme for the International Women Day 2022 was announced by UN Women in December, Gender Equality Today for a Sustainable Tomorrow. ये थीम है इस साल की, एंड हिस्ट्री है इंटरनेशनल वुमेन्स डे के, that this is also known as IWD for short grew out of labor movement to become a recognized annual event by the United Nations. The seed of it were planted in 1908, and when 15,000 women marched through New York City demanding shorter working hours, better pay and the right to vote. Right to vote भी नहीं था उस समय जब एक शुरू किया गया, तो आज तो बहुत सारी परिस्थितियां बदल गई हैं। The colors is also chosen. The colors of International Women's Day is purple, green, white. And this is the symbol, purple symbol of International Women's Day. Purple, often associated with royalty, signifies justice and dignity. The color of nature, that is green, and white represent purity. So this is also to be included. The International Women's Day logo is a looping arrowed circle with the female gender symbol at the inset, and a flower is also selected as mimosa flower is considered as its symbol. This is the history. Now, first of all, I would like to salute you all, the lady surgeons of Ayurveda, at this pious movement. I pay homage to late Professor P.V. Tiwari, who was really started, and all the ladies who are on the platform, due to her inspiration and her dedication and devotion. She was the first lady who started surgery at Banaras Hindu University. Really, she is mother of Prasuti Tantristi Rog, and even labor room. She started first time labor room in Banaras Hindu University, and thus she is the mother of Prasuti Tantra, Istri Rog, and Komarvit also. She is no more, but she will inspire all the ladies in future also. So with her memory and to homage to Professor late P.V. Tiwari, I would like to say that you all are strength of Ayurveda. You all the ladies surgeon are really strength of Ayurveda, and deserve a big hands. We should respect you all because you. मैं ये सोच सकता हूँ, मैडम तिवारी बताती थी जब उन्होंने सर्जरी स्टार्ट किया बनारस हिंदू यूनिवर्सिटी में, बीइंग ए लेडी पुरुषों के बीच में, तो उनको क्या क्या परेशानियां, क्या क्या चुनौतियां स्वीकार करनी पड़ी, वो शेयर करती थी। कैसे उनको क्या क्या चीजें, नारे, स्लोगन्स बनारस हिंदू यूनिवर्सिटी जैसे के कैंपस में उनको बर्दाश्त करना पड़ा, और आयुर्वेद में सर्जरी को इस्टेब्लिश करना पड़ा। तो आप बीइंग ए लेडी, रियली यू आर great, and you are really working very hard in comparison to we men. Then I would like to say something about the present scenario. You all are eligible to practice surgery today, but what happened, Sangya Harani discontinued, and due to discontinuation of this important subject, if you are giving a knife, but you are not allowed to practice any analgesic drug, it is impossible to practice surgery. The surgery is allowed, but anesthesia was discontinued before this permission. So this is a very big gap. This is, and I appeal to all you that you are मातृ शक्ति. आपको मातृ शक्ति कहा जाता है. इस प्लेटफॉर्म को मैं इसलिए इस्तेमाल करना चाहता हूं कि आपका एक प्रयास संज्ञाहरण के लिए होना चाहिए, मिलजुल करके, by motivation to the Ayush and by your writing letters to the Ayush ministry and to pressurize to start to restore संज्ञाहरण. बिकॉज जैसे शिव और शक्ति एक हैं, वैसे ही सर्जरी और एनेस्थीसिया, इसके दोनों को अलग नहीं किया जा सकता है. संज्ञाहरण के बिना कोई भी सर्जरी प्रैक्टिस नहीं की जा सकती है. अगर की जाती हो दैट इज क्वैकरी. और कुछ न कुछ एलोपैथिक मेडिसिन हर ब्रांचेज इस्तेमाल करती हैं. उसके लिए हमें लीगल अलाउड होना चाहिए गवर्नमेंट से. ऐसा नहीं कि हम क्वैक कहे जाएं. आज के दिन अगर हम एनेस्थीसिया लोकल भी देते हैं, चाहे वो सर्जन या, तो वो दे आर लाइक क्वैक मॉडर्न मेडिसिन के लैंग्वेज में. और वे हमें कभी भी नहीं चाहते कि सर्जरी करने पाए. इसलिए इस तरह से दिया भी गया है गजट, लेकिन लुका छिपी करके. तो हम अंधेरे में बिल्ली की तरह आंख बंद करके दूध नहीं पी सकते हैं. स्पष्ट गाइडलाइंस होनी चाहिए. स्पष्ट होना चाहिए कि आप इतना कर सकते हो, इतना नहीं कर सकते हो. आज के दिन इस मातृशक्ति को मैं आह्वान करता हूं कि आप अपनी आवाज उठाइए, बोलिए और आप भी इसमें शामिल होइए. अंत में सर्व मंगल मांगल्ये शिवे सर्वार्थ साधिके शरण्ये त्र्यंबके गौरी नारायणी नमोस्तुते. आप सभी का अभिवादन. धन्यवाद मुझे इस प्लेटफॉर्म पे ये अवसर देने के लिए, अपने बीच में बोलने के लिए. बहुत बहुत धन्यवाद. स्पेशली शीतल जी का धन्यवाद.
Thank you so much, sir, for your so kind words, so high words for all of our Ayurveda female surgeons. बहुत बहुत धन्यवाद सर. आपने बहुत सही तरीके से सर कहा है कि पर्पल, ग्रीन एंड व्हाइट, दीज आर द कलर्स ऑफ मदर नेचर. और स्त्री यह मातृत्व की धनी है, मातृत्व की द्योतक है, प्रतीक है. तो ये स्ट्रगल्स जो हमें फेस करने की बात सर आपने कही, जो लेट जो हमारी ऑनरेबल प्रेमवती तिवारी जी ने भी फेस किए होंगे, बट ये सर जो स्ट्रगल्स है हम सब भूल जाते हैं जब आप जैसे सुभाष चंद्र वाजपेयी सर जैसे, काशीकर सर जैसे सपोर्टिव हमें मेल कलीग्स और सीनियर्स हमें मिल जाते हैं. सो इट्स रियली अ गुड फॉर्चून ऑफ ऑल ऑफ अस दैट यू पीपल आर इन सपोर्ट ऑफ ऑल ऑफ अस. और रही बात सर अभी मिशन संज्ञाहरण रिस्टोरेशन की, तो आई हैव डिस्कस्ड इट विद ऑल माय कलीग्स एंड सीनियर्स एंड ऑल आर इन फेवर ऑफ द मिशन रिस्टोरेशन संज्ञाहरण सर. सो बहुत बहुत धन्यवाद आपको सर. सभी के स्पीचेस में कुछ ना कुछ सुनने को मिलेगा. बहुत बहुत धन्यवाद हमसे जुड़ने के लिए सर. और इसी श्रृंखला में मैं महात्मा गांधी आयुर्वेद कॉलेज की, हमारी जो कॉलेज हॉस्पिटल एंड रिसर्च सेंटर की जो डीन है डॉक्टर वैशाली कुचेवार मैम, उनको आमंत्रित करना चाहती हूँ कि वो यहाँ पर हमारे इनॉग्रल सेशन में 2 शब्द कहें. डॉक्टर वैशाली मैम.
धन्यवाद शीतल. डॉक्टर शीतल, गुड मॉर्निंग टू ऑल ऑफ यू एंड नमस्ते. स्पेसिफिकली हम सबके गुरु रिस्पेक्टेड डॉक्टर वार्ष्णेय सर and director of Ayush Darpan Foundation Trust, Dr. Naveen Joshi, and all the dignitaries present over here. Actually, I am very happy that this shrinkhala is made specifically for Lady Surgeon Conference. Actually, it is a totally new theme because we before that we were not thinking about the specific conference for lady surgeons. So I congratulate all of you that and specifically Dr. Sheetal Asudkar madam for conducting such a nice conference on lady surgeon. So I hope that this conference will be useful for all of us. And once again, I congratulate. Thank you. Thank you very much.
Thank you very much, Vaishali ma'am, for your kind words and for the official inauguration of the Lady Surgeons Conference 2022. Thank you so much. I'm so delighted that I'm getting so many compliments for the organization of this unique event of Lady Ayurveda Surgeons Conference. But this was actually a thought which always haunted my mind whenever I used to visit conferences and seminars all over on the national level or over the international level. I used to think there are so many lady surgeons, why not a conference which can which can accommodate the lady surgeons from all the fraternities of Shalya, Shalakya, Prasuti Tantra, Stri Rog, Sangyahar and all, because the proportion of female Ayurveda surgeons visiting those conferences was almost around 20 to 25% only, not only related to Ayurveda surgery, but all the surgeries. It was low, but now that we have come to the conclusion that already the percentage of surgeons who are practicing or who are the authorized surgeon, it's low. So whatever the percentage it is, like 25 to 30% ladies are there amongst the fraternity of Ayurveda surgery. But then when we come to actually count the female surgeons, it is a huge count, huge amount you can see, because we have 24 speakers today in our conference for in this chapter particularly. So this is not a less figure at all, and we should, it's actually encouraging to have exclusive conference for female Ayurveda surgeons. So everybody is happy to be contributing, to be participating, to be attending this conference this year with the Adya Gurus of your cadre, sir, with all of us. So thank you so much. And now I would, moving forward, along with the inaugural remarks, we will be paying tributes to Dr. Honorable late Dr. Premvati Tiwari ma'am. So I request all the dignitaries to say a few words about Dr. Premvati Tiwari ma'am in her tribute. We are holding this inauguration along with this. So I call upon Dr. Suman Sharma ma'am from NI Jaipur to say a few words in this inaugural ceremony.
Thank you, madam. Namaskar and good morning to all. Respected Dr. Vashne sir, chairman of this event, guest of honor Dr. D.N. Pandey sir, organizing secretary Dr. Sheetal Asudkar madam, Professor Surita Suman ma'am, Dr. Sangeeta Shelby ma'am, and all the dignitaries and esteemed speaker and participants. First of all, my greetings on the celebration of International Women's Day in this mega way. And also heartfelt thanks to organizers, especially Dr. Sheetal ma'am, for giving me the opportunity to be a part of this mega event. It is a unique opportunity for all female surgeons of different streams of Ayurveda to express their work and innovations in the field of surgery. Really, this is a wonderful moment for all of us. And this is also a time to remember our great surgeon, scientist, clinician, and academician, Madam Professor P.V. Tiwari ji. She was a great legend, thinker, and a best human being. Our whole fraternity is proud of her because she has produced generations of students and commanded the subject throughout. Her unfortunate demise has brought a biggest loss for all of us. I pay heartfelt tribute to the great soul. Today we are celebrating International Women's Day. All we know that contribution of women make this world so interesting, lovely, and lively. We cannot imagine a family, society, and a nation without the contribution of women. But many times and occasions in the history as well at present time, the bias against the women is witnessed, and they have to face the discrimination, abuse, suppression, and so many other things. We imagine to create such a world where gender difference should be respected. Equity and equality should be there, and no woman should face any kind of challenging situation owing to the gender difference. In the field of Ayurveda and Ayurvedic surgical discipline, women are making significant contribution. They have shown full enthusiasm and aggressively working in their field. Today, in this event, many participations will be presented by the female surgeons from different specialties. This deliberation will definitely mesmerize us and will very informative and productive. I greet and salute the organizers and especially Dr. Sheetal Asutkar for his tireless effort for organizing this type of event, and especially on International Women's Day with the unique theme linked with Ayurvedic lady surgeons. I wish a great success. Wish you all the best. Thank you. Thank you so much.
Thank you so much, ma'am. बहुत बहुत धन्यवाद. Actually, this is the event which gives you immense pleasure. This is just a one word description of the event, I can say. This gives you immense, एक दिल से आपको सुकून मिलता है, ऐसी सिचुएशन है. तो और आप सब लोगों को एक साथ यहाँ पर देख के तो वैसे भी सर और मैम यहाँ पर 4 चांद लग गए हैं आज के इवेंट को. तो होपफुली ये इवेंट तो वैसे भी एक सक्सेसफुल इवेंट रहेगा, ये मैं आशा के साथ कह सकती हूँ. थैंक यू सो मच मैम. और इसी के साथ मैं आमंत्रित करना चाहूंगी डॉक्टर काशीकर सर को, डॉक्टर श्रीकांत काशीकर सर, to say a few words about the inaugural session.
Hello, good morning all. It gives me great pleasure to see Vashniya sir, Chairman, Pandey sir, Suman ma'am. Over the year, now it's almost 30 years that I have been practicing, and I have seen a female surgeon now becoming a surge. Initially, when I started practice, there were hardly few women around, but now I see Sangeeta Sarvi madam also, Suman madam also, and the best thing is that I see my colleagues as a presenter and students also. So it's a great honor to be associated with all of you. And thanks to Asutkar madam and Navin Joshi sir, that there has been a platform to vent out all the knowledge by the female surgeons. They are doing equally well. And I hope in few years to come, they will surpass the surgeons also. Regarding anesthesia part, that's I think needs to be looked into, and definitely we have taken up this topic with the higher authorities, and Pandey sir, in short time I hope you will be happy. So let's wait for the best. जो देर आता है दुरुस्त आता है, because we waited for surgery GR also, but ultimately we were able to do that. Same is with gynec GR also and anesthesia also. So देर आए दुरुस्त है, आ जाएगा, कोई प्रॉब्लम है नहीं वैसे. और अभी with favorable NCISM and Ayush, I think we are looking at a very bright future. Regarding the skill set of female surgeons, I have no doubt they are doing much better than many of the male counterparts, and it's really fun. And in fact, I have seen Dr. Sangeeta operating, and it has been a great pleasure to see her operate. I have seen her from her initial days, and now I see her as a full-fledged ENT surgeon, and that's a great, something you always appreciate when you see skill. It's never, or talent. It's never hidden. It is always, it blooms, and this blooming is for everyone to see. Only you need to have eyes for it. And I'm sure all of the ladies who are going to present their experience will benefit all the lady surgeons, budding and aspiring female surgeons. And all my best wishes to the upcoming event today and tomorrow. And I'll be following it very closely. And all the very best to you. And I give my sincere condolences to Mrs. Premati Tiwari ma'am. I met her once only in BHU. I did not have much of an acquaintance with her, but still I heard a lot about her, and I hope that she will be an inspirational beacon to all the surgeons to come. Thank you very much.
Thank you very much, sir. Thank you for your welcome remarks to all the budding surgeons and all the established lady Ayurveda surgeons. Sir, you are an inspiration to all of us, and you will always be an inspiration to us, sir. Thank you so much. Now I would like, in this sequel, I would like to call upon Professor Dr. Sunita Suman ma'am, the head of the department, Prasuti Tantra and Striro, Department IMS BHU. So, ma'am, I request you to say a few words in this inaugural session.
थैंक यू। सबसे पहले तो मैं रिस्पेक्टेड सुभाष वार्ष्णेय सर को और प्रोफेसर डीएन पांडे सर को तथा ऑर्गेनाइजिंग कमेटी के सभी मेंबर्स, शीतल मैडम, सालवी मैडम, सुमन शर्मा मैडम, श्रीकांत सर, सभी को मैं धन्यवाद करना चाहूँगी कि मुझे ये प्लेटफॉर्म देने के लिए, एक सशक्त लेडी सर्जन्स का जो है वो प्लेटफॉर्म देने के लिए। और यहाँ पर सबसे पहले जो है मैं एक ट्रिब्यूट जरूर करना चाहूँगी, क्योंकि हमारे फील्ड की सबसे सशक्त अगर कोई लेडी थी तो वो थी प्रोफेसर पीवी तिवारी मैडम, जिन्होंने हमारे यहाँ पर सबसे पहले बीएचयू में ही, अदर स्टेट में ना होके यहाँ पर सबसे पहले था वाराणसी में कि बीएचयू में एक लेबर रूम को एस्टेब्लिश किया, उसके बाद सर्जरी स्टार्ट की। बहुत सारी प्रॉब्लम्स आई, लेकिन उस सर्जरी को उन्होंने मेंटेन किया और उसके साथ साथ जो है वो सर्जिकल वर्क जो था, जो हमारे आचार्यों ने कहा है, उसको मेंटेन करने के साथ साथ जितनी भी हमारी सुपरन्यूएटेड जो पर्सनैलिटीज हैं इस टाइम पर, जो प्रोफेसर एम द्विवेदी मैडम हैं, प्रोफेसर नीलम, प्रोफेसर मुक्ता सिन्हा, उन्होंने उसको आगे बढ़ाया। और ये टाइम जो है ये हम लोगों पर अब बहुत बड़ी रिस्पॉन्सिबिलिटी है कि हम इसको आगे बढ़ाएं। और जो मुझे लगता है कि सबसे बड़ी जो श्रद्धांजलि होगी वो मैडम के लिए वो वही है कि जो एस्टेब्लिश करके गई हैं वो हम उसको उसी तरह से बरकरार रखें, मेंटेन रखें। इस चीज को ध्यान में रखते हुए यहाँ पर हम लोग बहुत कुछ काम कर रहे हैं, लेकिन हमारे साथ में जो हमारी बहुत ही एक स्ट्रॉन्ग टीम्स हैं, जो सशक्त टीम है, वो संज्ञाहरण की है, कुमार वृत्ति की है। जैसा कि अभी सर ने कहा कि संज्ञाहरण का, मुझे एक चीज जरूर फील होती है कि इस प्लेटफॉर्म से हम उनके लिए भी ये कहें, क्योंकि हमारे डिपार्टमेंट को इतने सालों से संज्ञाहरण डिपार्टमेंट ही चला रहा है। और देखा जाए तो संज्ञाहरण हम बाहर से हायर कर सकते हैं एनेस्थेटिस्ट को, लेकिन एक मॉडर्न मेडिसिन के एनेस्थेटिस्ट और अपनी स्ट्रीम के एनेस्थेटिस्ट में बहुत डिफरेंस होता है। मुझे लगता है कि हमारे यहाँ सब आयुर्वेदिक जो जितने भी हमारे कर्म हैं वो तो हो ही रहे हैं, उसके साथ साथ यदि हम डिजर्व करते हैं तो क्यों ना करें जो हमारे शास्त्रों में बताया गया है। तो संज्ञाहरण को भी एक बहुत अच्छा प्लेटफॉर्म देने की जरूरत है, उसको रिकॉग्नाइज कराने की जरूरत है, क्योंकि हम लोग जितना फ्रीली होके अपनी स्ट्रीम के साथ काम कर लेते हैं शायद ही कोई कर पाए। तो इसलिए क्योंकि एक टीम वर्क है और उस टीम को हमें बरकरार रखना है, तो मैं संज्ञाहरण के लिए और अपने प्रसूति के लिए भी इस प्लेटफॉर्म से जरूर ये जितने भी यहाँ पर सीनियर्स हमारे जुड़े हैं, बहुत रिस्पेक्टेड सीनियर्स जुड़े हुए हैं, तो उनसे ये गुजारिश करूंगी कि हमारी इन चीज़ों को आगे बढ़ाया जाए। और मैडम को एक सच्ची श्रद्धांजलि देती हूँ। थैंक यू शीतल मैडम, ये प्लेटफॉर्म देने के लिए मुझे।
Thank you so much, ma'am. I'm so happy that you are sharing this platform with us, ma'am. ये जरूर एक सशक्त प्लेटफॉर्म बन गया है। अभी हम सब एक साथ यहाँ पर मौजूद है और हमारे सबके चहेते डॉक्टर वार्ष्णेय सर हमारे साथ है, तो उसके कारण नो डाउट दिस इज वन ऑफ द स्ट्रॉन्गेस्ट प्लेटफॉर्म फॉर ऑल द लेडी आयुर्वेदा सर्जन्स। थैंक यू सो मच। और इसी श्रृंखला में मैं आमंत्रित करना चाहूंगी डॉक्टर संगीता साळवी मैम को। मैम, प्लीज से a few words in this inaugural session. Please spread the pulse of wisdom from your bucket.
Good morning, ma'am. Can you hear me?
Yes, ma'am.
Yeah.
You are audible.
To all of you, sir, काशीकर sir, पांडे sir, जिनको मैंने बहुत दिन के बाद देखा है, but we know that they are giving a good fight for anesthesiology. So good morning, all of you. And before I could say something, I think we all should congratulate Sheetal madam for organizing such a wonderful event. I mean, we also could not do it what she is doing. So it's a great job, ma'am, and we are all with you. So thank you very much for giving this big platform. My tribute to Tiwari madam, though I have not met her, I have met her once or twice in the CCM syllabus meetings, and I have heard her. The confidence with what she used to, take the meeting ahead was credible. I mean, I learned so many things within 2 days that she was really too good. She was so confident and she dominated everything because she knew she was speaking right. So this is all what we have to learn from her. She has developed so many surgeons till today. So as Suman madam has said, we have to give her a Shraddhanjali by preparing ourselves as good surgeons, so that she's watching us. That's what I believe. So she must be looking at all of us, and she must be very happy that we are all contributing to the surgery part of Ayurveda. So thank you, ma'am, and best of luck to all the presenters, to all the people who are going to give their presentations. I would just speak a few things for the budding surgeons. Never give up. We are having challenges, we are having so many obstacles, but hard work and integrity in what you're going to do should be your aim, because if you give up, we will not maybe get a chance. And I know I have worked with Kashikar sir, and the amount of support they have given the female surgeons to come ahead. So we are having a lot of support. We have to take advantage of that. We have to go ahead and prepare ourselves so that we can be an example to the budding surgeons. So wish you all the best. I know we are running out of time. Wish you all the best, Sheetal madam, and best luck to Pandey sir. Anesthesiology will start. We are all there with you, and definitely we are going to come with you and fight for that anesthesiology department to start again, because it is this department without which no surgeon can operate. And we are very happy that we had this department, but due to some bad luck, we have lost it. So we are going to gain it again. So thank you very much. And we are there with you, Pandey sir, regarding the anesthesiology fight. So thank you, madam. Wish you all the best for the next 2 coming days.
Thank you. Thank you so much, ma'am. Thanks again. This is what is the budding surgeons require: the energy, the zeal, the push, the struggle, whatever we have faced, they must be knowing it. And I think in the coming 2 days, with all the presentations, these budding surgeons, these budding physicians, they must be coming close to the struggles, to the achievements, whatever we have shared, we have been sharing with each other. So thank you so much, ma'am, for your kind words. And with this, I think the inaugural session is over, I can say. And with this, I move ahead in the program. So being the organizing secretary of this mega event, that is Lady Ayurveda Surgeons Conference, and that too particularly on the auspicious occasion of International Women's Day 2022, I can say it gives me immense pleasure to call all the lady surgeons from the Ayurveda fraternity all over India. And I'm very happy to share here that some of the very, very senior ladies also have approached me, like Dr. Sunita Suman ma'am, and she has already contributed on various events on Ayush Darpan. But she said that, madam, in this Ayush Darpan's mega event of Lady Surgeons Conference, there must be a representation to IMSBHU. And I said, I am so sorry, ma'am, because last year Dr. Rashmi Gupta was with us, and she had given a dynamic presentation on laparoscopic surgeries and her share of surgeries in the surgery department in BHU. And now this year we are having Dr. Sunita Suman ma'am here from IMSBHU. She will be presenting her share of surgeries, Shastra Karma, whatever she is doing in her department, in the Prasuti Tantra and Stri Rog department. Similarly, we are having various speakers from Shalakya Tantra, then Prasuti Tantra Stri Rog, Shalya Tantra, and Sangyaharan department. So this galaxy of speakers includes speakers from 4 departments, and we are almost having 24 speakers. So we have attributed a specific time. All the presentations will be time bound, I assure all of you, and we will be having an academic feast as such in these 2 coming days. So under the guidance of seniors like you, we will be enjoying this event. So give me a few seconds and I'll be presenting on my part of this conference. This organizing secretaries, from the organizing secretaries desk, I will be presenting my share on my journey through Ayurveda surgery. Just give me a few seconds.
प्रेजेंटेशन के बाद चली जाना, फिर मैं बंद करा दूँ, किसी को बोल के जाना, ठीक है, बंद करने के लिए। आपको पूरा प्रोग्राम मैं सोच रही हूँ फोन पे लगा के चली जाऊँगी और उसकी ड्रेसिंग कर लूँगी, सेकेंड नहीं कल करेंगे, लेकिन कल तो हम लोग जाएंगे ना, उधर जाएंगे डायरेक्ट। चलो कोई आ जाए।
So once again, I pay my namaskar to all the respected surgeons, respected gurus present over here, respected colleagues and friends. So I welcome you all on the auspicious occasion of International Women's Day in the National Web Conference which is held by the lady Ayurveda surgeons. And the theme of this conference is contribution of lady surgeons to uniqueness of Ayurveda surgery. So I welcome you all here. So at present, this is my working institute, Mahatma Gandhi Ayurveda College, Hospital and Research Center. This is the constituent college of Datta Meghe Institute of Medical Sciences, deemed to be University, Savangi Vardha. These are the members of my team, my Shalyatantra department team. I have 4 members. One professor, Dr. Kiran Khandare, Dr. Reena Jaiswal, associate professor, Dr. Pooja Srivastav, and Dr. Suraj Rathod. 2 lecturers I am having. This is my brief achievement record that I will be skipping, and this is the brief account of surgeries which I am very much fortunate to be part of the team, and we are performing. So this is the latest case of umbilical hernia patient which we have performed over here. Mesh plasty we have done. This was a recurrent case of umbilical hernia, and it has been successfully operated at Mahatma Gandhi Ayurveda Hospital. This is pics of 4 hysterectomy patients. So we have a very good team, and you can see the PG department working OT, and happy faces of my team after surgery. So I am having 6 PG students in one batch. This is another slide showing the PG teaching, hands-on PG teaching, which we do over here. So it gives you some pleasure, rather immense pleasure you can say, when you are able to transfer these things to your students. So these are the PG students. Then this is one of the latest case, 3-year baby. She was brought with a deep wound. Suturing was done. Then this is another case of a chronic wound over the heel, which was debrided under local anesthesia, and later on the histopath proved it to be a squamous cell carcinoma. So this is the previous institute where I used to work at Shri Ayurveda College. The major account of surgeries we used to perform over there. I'm very much happy to be part of the team. Then this is another case. You can see the operated case of hydrocele. This is a case of inguinal hernia, which I was the part of the team again, I can say. This is a pilonidal case, sinus case, which was operated. You can see here the tract which was extracted and the plasty done. This was a heavy obese patient which was operated upon. बहुत दिनों तक इसका dressing and all चलता रहा, but then eventually the patient was cured. This is another case of pilonidal sinus. You can see the tough top here. Then again PG teaching. It makes me happy when I'm operating with my PG students. So you can see partial hysterectomy case है, क्षार सूत्र insertion किया है. This is the routine conventional practice what we Ayurveda surgeons are doing it from years together. Now you can see probing and क्षार सूत्र insertion in a small little fistula. Multiple tracts and partial hysterectomy case. PG teaching, JR3s. It makes a good team when you operate in a good atmosphere. You can transmit the need of a good team to your students also. This is a lateral sphincterotomy case. In a case of chronic fissure in ano, lateral sphincterotomy was done. This is a partial hysterectomy with Kshara Sutra, PG protocol this was. It was a very good protocol actually. The student was very happy to have so many cases. Then LIFT in a fistula case, it was done. This was a trial group. Then again PG teaching, the JR3 is standing beside, the JR2 is operating under my guidance. So actually this is the practice I want to inculcate in the students so that they will be getting hands-on and they will be understanding the importance of good team and sincerity in the practices. So again, this is a case of huge fistula extending from the perianal region to the gluteal muscles. So huge case, and the patient was admitted for months together. Almost the patient was admitted for 2 months in the hospital with regular dressings and all. Hysterectomy in submucous fistula, UG teaching. Some UG students are very much enthusiastic to attend your surgery, so we used to allow them. Then this is an abscess, perianal abscess, issue-rectal abscess rather, which was operated. This is a neurofibroma case which was excised under local anesthesia. In the gluteal region it was. And this is hemorrhagectomy, which is a routine procedure in every Ayurveda hospital, almost working Ayurveda hospital rather, I must say. This is the Kshar Pratisaran case. This was again a postgraduate protocol. You can see the purplish discoloration of the hemorrhoid mass. So again, this is a fistula probing and Kshara Sutra. There are so many cases of these things we operated. Then phimosis surgery in a pediatric patient, you can see. Now this is another case of umbilical hernia. The huge ovarian mass, ovarian cystectomy was done. I was part of the surgical team. This is another case of huge ovarian cystectomy, and this is a laparoscopic cystectomy, a very good case which was performed under laparoscopic excision was done. Then general surgeries, there was a good amount of general surgeries, and there is a good amount of share now also we are having. So this is a pylorus tumor, MRM, fibroadenoma. So we are fortunate enough, our PGs are fortunate enough that they were getting so many cases and they are getting so many cases. So this is a thyroid multinodular cystic goiter. This was actually a case of ENT department, but we being enthusiastic surgeons, we attended the OT under the guidance of Dr. B.K. Sharma Changani sir. This case was done by him, and this was a very good case actually. Then there are some miscellaneous cases. You can see the con which converted into huge abscess, then perianal abscess below the scrotum was drained, and another case of fistula. So this is amount of surgeries which I wanted to represent over here, and there are huge amount of parasurgical procedures also. You can see we are performing the Agni Karma clinic. Then this is a Raktamokshan clinic. We have almost 3 to 4 patients of Raktamokshan minimum per day. You can see the application of leech in a patient of inflamed sentinel tag and thrombosed hemorrhoids, prolapsed hemorrhoids, and then this is case of diabetic foot, cellulitis, arthritis, where leech therapy is performed in a gross scale. This is actinomycosis case in a patient of uncontrolled DM where Raktamokshan was done. Later on, VAG debridement was done and VAG dressing was given, and the patient was very much ready for skin grafting. So leech therapy in diabetic foot, a postgraduate protocol is going on this particular topic. So this is huge amount of Raktamokshan prior to the Sandhan Karma procedure. So you can see this is an exclusive case of foot ulcer which was debrided, leech therapy was done, and later on skin grafting was done. This is another case of diabetic foot where leech therapy was done, then VAG dressing was given under broad antibiotics coverage, broad spectrum antibiotic coverage, because the patient was a known case of diabetes and uncontrolled diabetes was there. Later on, with all the care, the skin grafting was done and the amputation was saved. So I'm very happy to share these things here. This is a case of venous ulcer, a recurrent case at Government Medical College, graft failure, which I approached our Ayurveda hospital, and this grafting was done later on. So this was again a case of necrotizing fasciitis in a case of diabetic patient, uncontrolled diabetes. Leech therapy was done. Time principle of management, wound management was adopted, and then grafting was done. So these are the amount of parasurgical procedures I do. We as a team do. This is a laser surgery workshop at my previous institute, and I'm very happy to represent my Lady Ayurveda fraternity in the bunch of surgeons, my colleagues. You can see over here, I was very much delighted to attend this workshop. Then there are certain academic achievements. This is a Ayurveda Advisory Board membership at Hungary. Then I have certain best papers at the BHU, at International Web Conference at Wardha. Then I was rapporteur chairperson in certain very, very highly appreciated events. Then I was CME coordinator at Vidarbha Prantiya Ayurved Mahasammelan at Sri Ayurved College. Later on, I was a workshop coordinator where my guru, Dr. Varshne sir, was one of the resource persons. And you can see our director, our respected director, Dr. Kohli sir, was one of the guests in the workshop, Dr. Uday Kulkarni and others. So this was a great workshop we had held over there. Then National Live Surgery Workshop on Proctology in NEMA Conference 2018. So Dr. Yunus Solanki was one of the guest speakers over there. So it was a happy moment to share the stage with Dr. Yunus Solanki sir. And then there was certain happy moments which make you always happy when you are invited as a guest speaker at World Ayush Expo, or rather places like 8th WAC World Ayurveda Conference at Ahmedabad. I was there. Then MUHS Spandan was one of the event, which was a mass event, which was a grand event at Nagpur, and we were the host committee members over there. This was again a very happy moment for me. This is a dream moment when you get your highest, one of the highest degrees of your academic career. So this is again one of the happy moments I want to share over here. And then there are certain these webinars, CMEs and conferences, which was I was a very happy part of this. And thanks to Dr. Naveen Joshi ji, who have always encouraged me. He has always praised me with the number of appreciations and number of awards he has coveted on me. He has rendered me. So these are certain web conferences like Raktamokshan, PCOD mega event, then Agni Karma mega event, and many others amongst the series of events. Then camps, Dr. Kothekar ma'am was one of the inaugurator of our camp. I was very happy to share this moment with Honorable Dr. Kothekar ma'am. Then this is a NSS camp at Imambada TB Hospital Isolation Ward, which was a grand event again. Blood donation camps. These are the peripheral camps which we have been visiting over here at Wardha as outreach activity we are doing. Then there are some good practices we must be trying to incorporate in the department. So this is one of the birthdays of our OT staff, and she was so happy to that we were celebrating her birthday in the department. So these are some good practices, certain good practices which again help you to maintain the harmony in the department. And these are certain cultural events that you must be celebrating. As a doctor, you are having some part of it in you, your personality always. So these are certain movements which again are the part of your profile, you can say. Thank you so much. While crossing this road, while going through this journey, there are so many budding surgeons, so many students that accompany you, and they say that, ma'am, you are our inspiration. So it makes you so happy, or it makes me really to think about it, to give a second thought always. Really, am I an inspiration to my students, or should I be an inspiration to my students? So I would answer this in that way, that I would always try to work hard, and always I would try to guide my students to walk on a humble path, on an honest path, with a pure heart and with hard work and dedication to towards your profession, towards your patients, towards your society, and it will always make you happy from within. So thank you so much for giving me this opportunity to present my work on this very August forum of Ayush Darpan Foundation in collaboration with Mahatma Gandhi Ayurveda College Hospital and Research Center. And thank you so much. Thanks very much to all of you for listening patiently, and for watching patiently to my presentation. So thank you. And with this, I would like to call upon Dr. Sunita Suman ma'am for your keynote address for today's session. Thank you, ma'am.
Thank you.
Dr. Sunita Suman ma'am.
Yes, ma'am. Thank you.
At Institute of Medical Sciences, Banaras Hindu University, Prasuti Tantra and Stri Rog Department. So over to you, ma'am. Hello. Screen share.
Yes, ma'am. Yes, thank you, madam.
मैम आप स्क्रीन शेयर कर लीजिएगा.
Yeah, ma'am. I am doing. मैम स्क्रीन शेयर हो रहा है?
हाँ जी मैम, योर स्क्रीन इज विजिबल मैम, प्लीज गो अहेड.
थैंक यू प्रोफेसर शीतल मैडम, थैंक यू ऑर्गेनाइजर्स, थैंक यू प्रोफेसर नवीन जोशी सर, और सभी को गुड मॉर्निंग. मेरा टुडेज टॉपिक इज द शल्यकर्म इन प्रसूति तंत्र एंड स्त्री रोग, जो कि हमारी आयुर्वेद में कुछ ऐसे दिए भी हैं, जो कर्म दिए हैं, शस्त्र कर्म दिए हैं, यंत्र कर्म दिए हैं, जिनको आज मैं डिस्कस करने जा रही हूँ. एक्चुअली यहाँ पर बहुत सीनियर सर्जन्स और सभी लोग बैठे हुए हैं और बहुत काम किए हुए हैं. ये मेरा जो टॉपिक है वो मुझे इंक्रीज करना है उन लोगों को जो अभी बिगनर्स हैं, और जो हम मेरे स्टूडेंट्स और बहुत जगह की जो हैं वो भी मेरे ही हुए खैर स्टूडेंट्स सभी जुड़े हुए हैं. तो हम लोग क्या कर सकते हैं, हम किसी मॉडर्न पैथी को भी या किसी पैथी को डिनाई नहीं कर सकते हैं, क्योंकि उसके भी एडवांटेजेस हैं. और मुझे लगता है कि यदि हम सर्जरीज कर रहे हैं तो हम मॉडर्न मेडिसिन की भी हमें नीड है और उसको भी साथ लेके चलना है. तो यहाँ पर जो मैं प्रेजेंट करने जा रही हूँ कि हमें क्या क्या की जरूरत पड़ती है प्री ऑपरेटिव और पोस्ट ऑपरेटिव, एक थियोरेटिकल के साथ साथ थोड़ा सा मेरा ये क्लिनिकल और प्रैक्टिकल अप्रोच है. और जितने भी इसमें थोड़े बहुत जो काम किया है वो फोटोग्राफ्स हैं, तो वो शायद मेरे और मेरे कलीग्स के और हमारे डिपार्टमेंट के ही हैं मोस्टली। तो आज जो डिस्कस करने जा रही हूँ एक सिंपल सा टॉपिक है, सभी जानते हैं, बस एक रिवाइज करने की जरूरत है। इस प्लेटफॉर्म पे मुझे लगा कि प्रसूति वालों को भी अपनी बात रखनी चाहिए। तो दिस नाउ कम टू द टॉपिक, शल्य कर्म इन प्रसूति तंत्र एंड स्त्री रोग। First of all, I would like to give the tribute to the legend of Ayurveda, late Professor P.V. Tiwari Madam, who has established the labor room and OT in the Prasuti OT in the Department of Prasuti Tantra, BHU. So, एक श्रद्धांजलि है मैडम को, और उन्हीं का नाम लेके, अपने गुरुओं का नाम लेके अगर हम लोग आगे चलते हैं तो मुझे लगता है कि बहुत बहुत प्रोग्रेस करते हैं। तो सबसे पहले मैडम को, और वार्ष्णेय सर हैं, डीएन पांडे सर हैं, यहाँ पर जो है हमारी सर्जिकल जो टीम है शल्य तंत्र की, उन सबके साथ में भी कभी अगर कोई हमें जरूरत पड़ती है तो हम लोग जो है उनको हायर करते हैं, और खुद ही हम लोग अपने वो जो है प्रोसेस करते हैं फिर आगे। सबसे पहले वुमेन्स हेल्थ जो है वो कंसर्न्स करते किस चीज पे, यदि राइट ट्रीटमेंट ऑन राइट टाइम ना दिया जाए तो क्या है कि उसकी हेल्थ के लिए हार्मफुल होता है। तो इसके लिए यदि हम देखें तो आचार्य सुश्रुत ने जो है सभी जानते हैं कि आप लोग सब जानते हैं कि बहुत से कंसेप्ट बताए सर्जरी के, और प्रैक्टिकल एप्लीकेशंस जो हैं वो डिफरेंट थेरेपेटिक पर्पसेस के लिए बताए हैं, जैसे कि अष्टविध शस्त्र कर्म और दशविध जो है वो शस्त्र कर्म बताया गया। तो इसमें जो है हमारा जो दशविध शस्त्र कर्म है, जैसे कि जो हमारा है कि अपकर्षण है, कर्षण है, तो इस तरह से दारण है, ऋजुकरण है। तो जो दशविध शस्त्र कर्म है हमारे की पीड़न है, यहाँ पर स्थान अपवर्तन है, तो जो है इनके थ्रू जो है हम मूढ़ गर्भ को या ऑब्स्ट्रक्टेड लेबर को भी हम कर सकते हैं, डायग्नोज कर सकते हैं, देन जो है ट्रीट कर सकते हैं। The शल्य चिकित्सा is not only done by the sharp instrument but blunt instruments also are used for many medical purposes. तो नॉर्मल सी बात है कि कोई भी अगर शल्य चिकित्सा कर रहे हैं, सर्जरी कर रहे हैं, तो यहाँ पर मैं अगर प्रसूति की बात आती है तो बहुत सारे ऐसे प्रोसीजर्स हैं जिसमें शार्प इंस्ट्रूमेंट्स के साथ साथ ब्लंट इंस्ट्रूमेंट्स की जरूरत होती है। मेरे को यहाँ पर ये रखना है कि बस ये करना है कि यदि हम अपने आयुर्वेद को लेकर चलते हैं मॉडर्न के साथ, तो मुझे भी लगता है कि इस प्लेटफॉर्म पर आकर हम जो है पीछे अपने को बैकवर्ड कर लें कि नहीं, हम लोग जो है ठीक है, हमें यहाँ पर सबसे मेन है कि हमें यहाँ पर रखना है कि हम कैसे इसको आगे ले जाएं। बहुत हैं, जैसे भारती मैडम हैं, सुजाता कदम मैडम हैं, उन्होंने एक जो है इस पर एक जो है प्रपोजल भी जो है वो सबमिट किया हुआ है आयुष मंत्रालय के थ्रू जाकर, और उसमें NICM के लिए कि हमारा जो है ये जो है अप्रूव हो जाए। देन डिफरेंट सर्जिकल मेथड्स आर यूजिंग टू क्योर डिफरेंट टाइप्स ऑफ डिसऑर्डर्स इंक्लूडिंग ऑप्स एंड गायनिकोलॉजिकल प्रॉब्लम्स। जो सर्जरीज हैं इन प्रसूति तंत्र मेनली जो हम लोग यहाँ पर कर रहे हैं BHU में, तो प्रसूति में ऑप्स में जो हम कर रहे हैं डायलिटेशन एंड इवैक्यूएशन, वर्जन, ऑपरेटिव वैजाइनल डिलीवरीज लाइक एपिजॉटमी तो सभी लोग करते हैं। अगर आप डिलीवरी करा रहे हैं तो वहाँ करना ही है, जिसको वैद्यकृत व्रण हम कह सकते हैं, शुद्ध व्रण कह सकते हैं, क्योंकि एपिजॉटमी क्या है, एक जो है डेलिब्रेटेड जो है वो इंसिजन है, तो अगर डेलिब्रेटरी कर रहे हैं तो वैद्यकृत व्रण हो गया। देन फोर्सेप्स डिलीवरीज, वेंटोस डिलीवरी जिसमें कि अपकर्षण, आहरण एंड सीवन कर्म इन लैसरेशंस, कॉल्पोप्लास्टी, जो भी हमारी अगर लैसरेशंस हो रहे हैं, पेरिनियल टीयर हो रहे हैं, देन उस पेरिनियोप्लास्टी, सिजेरियन सेक्शन उधर पाटना बाय द भेदन कर्मा, सिजेरियन हिस्टेरेक्टमी अगर कहीं पर जरूरत है कि वहां पर कोई ब्लीडर्स हैं और नहीं आपकी ब्लीडिंग जो है PPH में, सीवियर PPH में, तो ऐसी कंडीशंस में जो है सिजेरियन हिस्टेरेक्टमी भी हम लोग कर रहे हैं। देन ट्यूबल लाइगेशन है, लेसरेशन ऑन हिमेटोमा, कोई भी अगर वहां पर क्या है कि पेरिनियल टीयर होता है, हिमेटोमा बन जाता है डिलीवरी के टाइम पे, तो वो सब रिपेयर जो है वो प्रसूति तंत्र ऑप्स में हम लोग कर रहे हैं। देन सर्जरीज इन स्त्री रोगा, जो कि हम डायलिटेशन एंड जो है वो क्यूराटास, एब्डोमिनल हिस्टेरेक्टमी एंड वेजाइनल हिस्टेरेक्टमी, गर्भाशय निर्हरण विच्छेदना कर्म, एंड सिस्टेक्टमी and dilatation of the samvrta yoni using parasurgical approaches, योनियार्श एंड स्तन रोगा और स्तन जो विद्रति है। एक्चुअली यहाँ पर जो है मैंने टर्म्स जो है अपनी आयुर्वेदिक टर्म्स भी रखी हैं, और जितना भी हम बीएचयू में हैं मुझे लगता है कि हमें अपनी आयुर्वेदिक टर्म्स को जरूर यूज करना चाहिए। अगर हम अपनी आयुर्वेदिक टर्म्स कर रहे हैं तो हम यहाँ पर एस्टेब्लिश अच्छे से कर सकते हैं और हम अपनी बातों को अच्छे से एक्सप्लेन कर सकते हैं कोरिलेट करते हुए। तो आयुर्वेदिक टर्म्स जैसे कि अभी हमारे यहाँ पर केस नोट भी लिखे जाते हैं तो फर्स्ट हम आयुर्वेदिक टर्म्स करते हैं, देन ब्रैकेट में मॉडर्न टर्म्स करते हैं जो हमारे अगर ओटी नोट है उनमें भी। तो ये मैं सभी को कहना चाहूंगी कि हमें अपनी चीजों को नहीं छोड़ना है अगर हम सर्जरी कर रहे हैं तो। देन ये लास्ट 5 इयर्स का रिकॉर्ड है, इसमें 2 साल जो है वो कोविड भी रहा और उसमें जो था कि जो सर्जरीज हैं डिपार्टमेंट ऑफ प्रसूति तंत्र बीएचयू में जो की गई नंबर ऑफ सर्जरीज हैं वो 2821 जो मेजर एंड माइनर बोथ इंक्लूडेड, और जिसमें अभी जैसे कि मैंने अभी एक्सप्लेन किया था कि उसमें हमारे जो है सिजेरियन सेक्शंस हैं, एब्डोमिनल हिस्ट है, वजाइनल हिस्टेरेक्टमी है मेजर सर्जरीज में, और माइनर में डायलिटेशन एंड क्यूराटाज है, बायलेटरल ट्यूबल लाइगेशन है, रिमूवल ऑफ सर्वाइकल एडेजेंस है, सर्वाइकल पंच बायोप्सी, एंडोमेट्रियल सिस्टेक्टमी, पॉलीपेक्टमी एंड एपिजॉटमी ड्यूरिंग द एसवीडीज। देन अब आते हैं कि कोई भी, अभी मैंने कहा यहाँ पर स्टूडेंट्स भी जुड़े होंगे और बिगिनर्स भी हैं, हमें किन किन चीज़ों का ध्यान रखना चाहिए। अगर हम ये सब अपना जो भी हमारा क्राइटेरिया है उसको फॉलो कर रहे हैं तो आई थिंक कि जो हमारा आउटकम है वो बेटर होगा। Surgery to be performed only after the proper counseling and well-informed written consent with all risk of procedure. ये मॉडर्न के अकॉर्डिंग है, लेकिन अगर अभी मैं अगर आयुर्वेद पे आगे आऊंगी तो जब हम देखते हैं तो पूरा वही जिस तरह से जो क्राइटेरिया बताया गया है सर्जन्स के लिए और सर्जरी के लिए, वो अभी पूरा क्लियर जो है हमारा आयुर्वेद पहले ही कर चुका है। Then proper history, complete examination required, complete investigations, confirmed diagnosis, decision for surgery after explanation of all risk to the close attendants. ये सारे points अगर हम यहाँ देखते हैं तो who can perform the surgery according to the Ayurveda? Modern science के according to modern science, obstetrician and the gynecologist have skills to manage complex or high risk pregnancies and births, can perform interventions, cesareans, and skills to handle the disorders and operation of reproductive organs. I think कि कोई difference नहीं है अगर हम अपने आयुर्वेद के अकॉर्डिंग देखते हैं कि ये कई बार मैंने जब लेक्चर्स बहुत सारे लिए कि मूल गर्भ है और उसमें भी मैंने कई बार बताया होगा कि ये सारे पॉइंट्स बताए हैं, क्योंकि अगर देखा जाए तो जो क्वालिटीज हैं ऑफ डॉक्टर की जैसा कि मॉडर्न में बताया गया उसी तरह से यहाँ पर भी हैं कि शुड भी, बल्कि बहुत सी क्वालिटीज एक्स्ट्रा हैं। तो उन्होंने शुड बी एक्सपीरियंस्ड ऑफ कंडक्टिंग सो मेनी लेबर्स और द प्रोसीड्योर्स और अनल्पमति शुड हैंडल द सच केसेस। मीन्स कि अनल्पमति की सर्जरी में ये नहीं है कि आप थियोरेटिकल जो लिखा है वही करना है, क्योंकि कई बार आपको पूरा नॉलेज होना चाहिए, करना उसी तरह से है, बट कई बार ऐसी कंडीशंस आती हैं कि स्व विवेक से भी काम लेना होता है, जैसे कि आचार्य सुश्रुत ने कहा है। तो और फिर आगे अगर हम देखते हैं जो क्वालिटीज ऑफ सर्जन्स में है कि जिसने बहुत सारे असिस्ट कराए हों केसेस वही होने चाहिए, या एक्सपीरियंस होना चाहिए शल्यकर्म करने का, या फिर क्या है कि वो फेमस होना चाहिए कंडक्शन ऑफ डिफिकल्ट सर्जरी, और कमांड ओवर द नॉलेज ऑफ इंस्ट्रूमेंट्स एंड बुक्स, ये सब प्रैक्टिकल, क्लिनिकल, थ्योरेटिकल होना चाहिए। तो ही शुड बी वाइज, बोल्ड, कैपेबल एंड अनकॉन्शियस, शुड नॉट बी अनकॉन्शियस। तो देखा जाए तो जितने भी हमारे जो क्वालिटीज ऑफ सर्जन्स हैं, अगर वो कहते हैं कि जो हमारे शास्त्रों में कहा गया है कि उसने शल्यकर्म असिस्ट कराए हों, तो मॉडर्न में भी तो वही है कि 25 जो है एमटीपीज की हों, डिलीवरीज की हों, वही स्किल्ड है। तो देखा जाए तो बिल्कुल भी डिफरेंस नहीं है, और हमारे आचार्य पहले ही इसको डिस्क्राइब कर चुके हैं। Then 3 phases of surgery, as you know: Trivid Karma, then Purva Karma, pre-operative preparations, Pradhan Karma and Paschat Karma. आई थिंक कि जो भी हमारा सपोर्टिंग स्टाफ है या असिस्टेंट्स हैं, उनको नॉलेज होनी चाहिए ईच एंड एवरी स्टेप ऑफ द पूर्व कर्म, प्रधान कर्म एंड पश्चात कर्म बिफोर परफॉर्मिंग द सर्जिकल इंटरवेंशंस. नाउ प्री ऑपरेटिव प्रिपरेशंस, इट शुड बी डन 2 weeks बिफोर द ऑपरेशंस, क्योंकि हमारे पास में जितना भी टाइम रहता है, अगर हम सर्जरी करने जा रहे हैं तो एक हमारे पास में प्रॉपर असेसमेंट होना चाहिए पेशेंट का, जो भी कॉम्प्लिकेशंस हैं हम उनको अवॉइड कर सकें. जैसे कि जनरल इंटेरोगेशन है, सामान्य प्रश्न पूछकर है, या स्पेशल इंटेरोगेशन है, विशेष प्रश्न पूछकर है, कि जो है प्रश्न परीक्षा करके है, प्रेजेंट इलनेस उसकी क्या है, पर्सनल हिस्ट्री क्या है, फैमिली हिस्ट्री, पोस्ट मेडिकल ड्रग हिस्ट्री, और जो अपने को जो एडिशनल रिस्क हैं कि HIV जो वायरल मार्कर्स हैं वो जरूर हम लोग करा लें. देन कंप्लीट फिजिकल एग्जामिनेशन है, कि इंस्पेक्शन है, पैल्पेशन है, जिसमें कि दर्शन है, स्पर्शन है, तारण है, श्रवण है, तो ये सारे एग्जामिनेशन करने चाहिए. रूटीन इन्वेस्टिगेशंस जरूर एडवाइस पेशेंट्स को करनी चाहिए, कि उसके अकॉर्डिंग ही हम जो है कॉम्प्लिकेशंस को मैनेज कर पाएंगे. In vaginal operation, unhealthy cervix, presence of different types of discharges हैं यदि, तो वहाँ पर जो इन्वेस्टिगेशंस हैं बिल्कुल भी, क्योंकि हम मॉडर्न टूल्स एंड टेक्निक्स यूज कर सकते हैं, बिल्कुल भी इसमें हेजिटेट नहीं करना है कि आपको इन्वेस्टिगेशंस नहीं कराने हैं. तो सभी इन्वेस्टिगेशंस जो भी रिक्वायर्ड हैं, जो भी नीडेड हैं, अकॉर्डिंग टू पेशेंट्स, अकॉर्डिंग टू डिसऑर्डर्स, अकॉर्डिंग टू डिसीज, everyone can do. Vaginal swab for culture and sensitivity test, pap smear, cervical punch biopsy, and protection of the staff of OT, screening of the viral markers. Admissions, patient should be admitted 1 to 2 days prior to the operation. इसमें क्या है कि हमें जो प्री एनेस्थेटिक चेकअप है या अदर जो प्री ऑपरेटिव प्रोसीजर्स हैं वो इजी हो जाता है, और जो हमारी जो प्रधान कर्म के टाइम पर जो मेन प्रोसीजर है या पोस्ट जो ऑपरेटिव पेशेंट्स हैं उसमें हम कॉम्प्लिकेशंस को प्रिवेंट कर सकते हैं. री-इवैल्यूएशन ऑफ द केस एंड एग्जामिनेशन बाय एनेस्थेटिस्ट शुड बी डन, एंड रिस्पेक्टिव इंटरडिसिप्लिनरी एडवाइजेस टू बी टेकन एज वेल रिक्वायर्ड. कभी भी आपको यहाँ पर भी हेजिटेट नहीं करना है. यदि आपके पास में बहुत सारी जो है वो इंटरडिसिप्लिनरी अगर एडवाइस लेने की जरूरत है, तो वहां पर हेजिटेट नहीं करना चाहिए, क्योंकि पूरी वो लेकर तभी सर्जरी हमें आगे करनी चाहिए. And arrangement of high density unit and intensive care unit should be done. Emergency conditions and post-operative periods and type of anesthesia according to patient, her disease should be discussed with the patient and her attendants. Counseling and consent. Counseling and consent जो आचार्यों ने बताया, बहुत अच्छा बताया कि देखा जाए तो ये पूरा अगर हम फॉलो कर रहे हैं तो आई मीन्स कि मेडिको लीगल केसेस से भी हम लोग बच सकते हैं. तो मेडिको लीगल केसेस को भी ध्यान में रखते हुए जो पूरी काउंसलिंग है वो प्रॉपर काउंसलिंग होनी चाहिए, प्रॉपर कंसेंट लेनी चाहिए. जैसे कि तस्मात् अधिपति अप्रच्छ परंच्य आस्था उपक्रमे, तस्माद् ईश्वरम अपृच्छ परम च यत्नामस्थ्य तद्वित सहित उपक्रमे ध्रुवम मरणम उपक्रमे संशयः अक्रिया या ध्रुवम मरणम उपक्रमे संशय. यहाँ पर यदि हम देखते हैं तो जैसे कि पूरे जितने भी हमारे कॉम्प्लिकेशंस हैं वो अटेंडेंट्स को और जो पेशेंट है यदि वो एडल्ट है तो उसको पूरा क्लियर कर देना चाहिए कि क्या कॉम्प्लिकेशंस हो सकते हैं प्रोसीजर के टाइम पे या पोस्ट ऑपरेटिव जो है, क्या कॉम्प्लिकेशंस हो सकते हैं, किस तरह का जो है हम प्रोसीजर करने जा रहे हैं. तो ये सारे उनको पूरी अच्छे से और वेल इन्फॉर्म्ड कंसेंट जो है वो लेनी चाहिए. और साथ में आचार्यों ने कहा कि ईश्वर को याद करना चाहिए. ईश्वर को याद क्यों करना है? बिफोर एनी सर्जरी कंसेंट ऑफ गार्जियन शुड बी ऑब्टेन, प्री ऑपरेटिव काउंसलिंग एंड वेल इन्फॉर्म्ड कंसेंट should be, consent form must be signed by the patient, her guardian, and verified by the physician. All the risk about the operative procedures and anesthetic drugs should be explained. I have said any doubt or success of operative procedure should be explained. बिफोर सर्जरी अभी मैंने कहा कि रिमेम्बर द गॉड एंड प्रेयर फॉर सक्सेसिंग द ऑपरेशन, तो इसका मतलब ये नहीं है कि हम गॉड को याद कर रहे हैं तो वो आकर हमारा केस संभाल लेंगे, बट ये है कि एक कूल माइंड होके जो है वो जरूर करना चाहिए। आचार्यों का यहाँ पर यही कहना है कि आप कूल माइंड हो, ताकि आप जिसको भी आप चाहते हैं, अपने गुरु को याद कर सकते हैं, उस जगह पर गॉड को याद कर सकते हैं। कूल माइंडेड जो है हमेशा जो है ऑपरेटिव प्रोसीजर्स करें। एंड प्री ऑपरेटिव में अगर देखा जाए तो लाइट डाइजेस्टिव डाइट शुड बी गिवन इन द प्रीवियस इवनिंग एंड नील ओरली 8 to 12 hours sterilization of equipments in prerequisite to perform the surgery। ये एंड जो हम यहाँ पर प्रिपरेशंस करते हैं प्री ऑपरेटिव, मुझे लग रहा है कि जितना भी है यहाँ पर हम लोगों ने सेवलॉन, स्प्रिट, बीटाडीन, कई बार तो हमारे स्टूडेंट्स कहते हैं मैडम आज वो यूज करेंगे आपकी स्प्रिट बीटाडीन, तो कई बार ऐसा होता है कि जैसे भूल चुके हैं, क्योंकि हम लोग जितना भी है बहुत सारी ऐसी ड्रग्स हैं हमारी जो एंटीबायोटिक, एंटी माइक्रोबियल, एंटीसेप्टिक इफेक्ट्स रखती हैं और प्रूव्ड हैं। और यहाँ पर भी हम देख रहे हैं कि इतने केसेस हम लोग हैंडल कर रहे हैं और सबको हम यूज कर रहे हैं और कोई कॉम्प्लिकेशन नहीं मिलता, बल्कि जब हम देखते हैं तो स्कार भी जो है वहाँ पर कोई मार्क तक नहीं दिख रहा है या बहुत जल्दी हीलिंग हो रही है पेशेंट्स की। तो जैसे कि प्रिपरेशन ऑफ पार्ट्स एक्सटर्नल जेनिटेलिया एंड एब्डोमेन जो है वो हम पूरी आयुर्वेदिक डिकॉक्शन से करते हैं। देन मेडिकेटेड बाथ विद अवेलेबल आयुर्वेदिक ड्रग्स जैसे कि नीम क्वाथ, हरिद्रा क्वाथ, दशमूल क्वाथ एंड निर्गुंडी क्वाथ से पहले यहाँ पर हम लोग उनको एक बात दिलवाते हैं। इसीलिए 1 to 2 days प्रायर जो है एडमिशन के लिए मैंने कहा कि करते हैं, तो उनको 2 दिन तक हम जो है मेडिकेटेड बात करने के लिए जो है नीम, हरिद्रा, दशमूल क्वाथ और निर्गुंडी क्वाथ से कहते हैं। देन जो स्टमक शुड बी एम्प्टीड इन इमरजेंसी केसेस में है कि स्टमक ट्यूब से करें, आप किसी से भी करें, बट वी आर गिविंग द क्लींजिंग बस्ती। आई थिंक एनीमा कभी जरूरत होती है तो देते हैं, ये नहीं है कि बिल्कुल भी हमें एकदम से स्टॉप करना है कुछ भी, बट वी आर गिविंग द बस्ती विद मेडिकेटेड डिकॉक्शंस एंड बला तिल ऑयल we are giving, and sedatives should not be given or mild sedatives, but अगर वहां पर माइल्ड सेडेटिव्स की जरूरत है तो जटामांसी चूर्ण एंड मेध्यवटी कैन बी गिवन ड्यूरिंग द प्रायर टू द ऑपरेशंस। देन अरेंजमेंट ऑफ एनेस्थेटिक्स, संज्ञा हरण विशेषज्ञ एंड बाल रोग विशेषज्ञ शुड बी टाइमली। इफ केस ऑफ द ऑप्स देन पीडियाट्रिशियन, मतलब बाल रोग विशेषज्ञ का होना टाइमली जरूरी है। देन हिस्ट्री इन्वेस्टिगेशन एंड प्रेजेंट स्टेटस ऑफ द पेशेंट शुड बी एक्सप्लेन टू द एनेस्थेटिस्ट एंड प्रोफाइलेक्टिक एंटीबायोटिक शुड बी गिवन if there is a need, and these are the instruments, sterilized instruments and surgical sutures and drugs in ROT. Then pradhan karma, main procedures, it's a team of the anesthesia and it's a anesthetist, machines, ventilator. तो जब भी आप प्रोसीजर करने जा रहे हैं तो आपको ये भी फॉर्म पूरा करना है कि आपकी ओटी में सभी चीजें जो है वो अवेलेबल हों, वर्किंग हों और आपकी टीम पूरी जो है वो स्किल्ड हो। देन प्रधान कर, इट्स मेन प्रोसीजर जो हम इसमें मैंने उधर पाटन का रखा है, सिजेरियन सेक्शन का है कि हम क्लीनिंग कर रहे हैं, डिकॉक्शन से ही हम लोग क्लीनिंग करते हैं। देन 3-4 टाइम्स जो है डिकॉक्शंस यूज करते हैं। देन उसके बाद जो है ये है इंसिजन, छेदन कर्म उधर पाटन है। देन डिलीवरी ऑफ द बेबी एंड द प्लेसेंटा। Now I am doing the Sivana Karma, Suchri of the uterus. Then post-operative care. जो भी हम लोग सैंपल निकाल रहे हैं या हम निकालते हैं तो गायनेकोलॉजिकल प्रोसेसेस का हो या ऑब्स्ट्रक्टिव का हो कि आप वहाँ पर लाइगेशन कर रहे हैं या किसी तरह का ऑब्स्ट्रक्टिव में कई बार क्या है कि आपको सिस्ट मिल जाते हैं बहुत बड़े बड़े, वो भी आप रिमूव कर रहे हैं। तो ऐसी कंडीशंस में जो भी है वो हिस्टोपैथोलॉजिकल एग्जामिनेशन के लिए, या यूट्रस आपने किया है कि आपने हिस्टेक्टमी की है या फिर आपने कोई बायोप्सी की है या पॉलिप है तो या इनकम्प्लीट अबॉर्शंस था या किसी भी तरह का अबॉर्शन इंफेक्शन है, वहां पर मोल हो सकता है, तो उसके लिए जितने भी हमारे सैंपल्स जो भी हम निकालते हैं उसको हिस्टोपैथोलॉजिकल एग्जामिनेशन के लिए जरूर भेजना चाहिए। और क्रिटिकल कंडीशंस जैसे कि मिसकैरेज हैं या वो हैं, ये जरूरी नहीं है कि आप इसको डिस्चार्ज के टाइम पर ही बताएंगे पेशेंट को या अटेंडेंट को। रेगुलर फॉलोअप में रहने के लिए आप जब बाहर निकलते हैं ओटी से तो ये जरूर आप क्या कॉम्प्लिकेशंस हो सकते हैं, किस तरह से कॉम्प्लिकेशन से बचा जा सकता है, जैसे कि मिसकैरेजेस की कंडीशन है जो कि आफ्टर लॉन्ग टाइम ऑफ कंसेप्शन है, अबॉर्शन है या सिजेरियन सेक्शन है, जो ग्रेट पोस्ट सर्जिकल केयर है जिसमें, तो किस तरह से कॉम्प्लिकेशन से बचा जा सकता है वो आप उसको जरूर एक्सप्लेन करें। एंड इम्पॉर्टेंट पोस्ट ऑपरेटिव पीरियड इज 48 to 72 hours in which first 24 hours most critical because of immediate surgical complication. These are the aim and objectives of the post-operative care and immediate post-operative care. सर्जरी कर रहे हैं और ये कि फर्स्ट 24 आवर्स और 48 आवर्स तो हमें जो है वो मॉडर्न मेडिसिन की भी जरूरत पड़ेगी। देन अगर आपको जरूरत है तो वहां पर पड़ेगी ही, तो वहां पर डोंट बी हेजिटेट to use. After receiving the patient from the operation theaters, patient gently placed on the bed in left lateral position. Why left lateral position? क्योंकि अगर उसको हम जो है स्पाइन पोजिशंस में रखते हैं तो क्या होगा कि ऐसी कंडीशंस में जो है वो एस्पिरेशन के चांसेस हो सकते हैं। यदि कॉन्शियसनेस ऑफ द पेशेंट शुड बी चेक्ड एंड वाइटल साइंस, ब्लड प्रेशर, रेस्पिरेटरी रेट, पल्स रेट, टेम्परेचर, ब्लड लॉस एंड ऑन द वुंड ड्रेसिंग से कई बार देखा है हम लोगों ने कि ये सब चीजें छोटी छोटी है लेकिन बहुत ध्यान रखने की है कि कई बार जो है वो वुंड ड्रेसिंग से या डिलीवरी हुई एपी जो है वो स्टिच कर दी या पेरिटोन जो है हमने जो है हमारा पेरिनियल टीयर है उसको हमने जो है वो रिपेयर कर दिया, बट वहाँ पर छोटी छोटी वेसल्स हैं जो कि स्लिप कर जाती हैं और कई बार जो है हीमेटोमा फॉर्मेशन हो जाती है या जो वल्वा है, पैड है, वहाँ पर ब्लीडिंग हो रही है किसी भी तरह की या वुंड से ड्रेसिंग हो रही है, तो ऐसी वुंड ड्रेसिंग से जो अगर ब्लड लॉस हो रहा है तो ये जो है केयरफुली जो है हम ऑब्जर्व करें। और डिहाइड्रेशन अगर देखना है, टंग आई अमाउंट एंड कलर ऑफ यूरिन, कई बार क्या है कि हम लोग प्रॉपर फ्लूइड नहीं देते हैं, इसीलिए कहा गया कि प्री ऑपरेटिव में प्रॉपर फ्लूइड उसे एडवाइज करना चाहिए। नील ओरली हम लोग कर देते हैं और बहुत देर तक कई बार ओटी हमें अवेलेबल नहीं होती है या किसी तरह से कोई प्रॉब्लम्स होती हैं तो पेशेंट डिहाइड्रेटेड हो जाता है और वो फिर कंप्रोमाइज पेशेंट हो जाता है, कंप्रोमाइजिंग कंडीशन। देन यूरिन आउटपुट, स्किन कलर, मेंटेनेंस ऑफ auscultation of chest, heart sound, abdominal examination should be done. Observational है usually for hourly in first 24 hours, monitoring the vital signs at every 1 hour for first 4 hours to hourly, then fluid replacement and blood transfusion if needed is given during and soon after. These are the pain control, pain relief के लिए आप deep breathing और oxygenation and NSAID should be given. And bladder and vaginal care, usually bladder is drained by the insertion of Foley's catheter continuously for prevention of distension and urine retention, reduction of pain. But जो ये है कि यदि आप vaginal packing है, कई बार हम लोग hysterectomy में भी करते हैं, अगर हम vaginal packing करने जा रहे हैं, वॉल्ट को कर रहे हैं, तो वहाँ पर अगर हम यूज कर रहे हैं या फिर जो है हम एपी वुंड को कर रहे हैं या कोई भी हमें वेजाइनल पैकिंग करनी है, तो वहाँ पर क्या है कि उसको रिमूव तो कर दें, लेकिन पैकिंग कैन बी डन विद द दूरवास वायरस। क्या करेगा कि वहाँ पर जो वेसल्स हैं जो है एक रक्त स्तंभन का कार्य करेगा, देन जो है वो स्टिप्टिक का काम करेगा, स्फटिका चूर्ण है उसमें आप जो है एक टैम्पून आप जो है उससे पैक कर सकते हैं, एक बिग टैम्पून लेके अकॉर्डिंगली जो है। देन पंचवल्कर और त्रिफलाक्वासी जो है वो भी आप टैम्पून जो है वो अप्लाई कर सकते हैं कि आपको कोई भी ब्लीडर्स नहीं है, कि वहाँ पर जो है वो थोड़ा सा एंटी इन्फ्लामेटरी का काम करे, एंटीबायोटिक और एंटीसेप्टिक का काम करे। देन इन एपिजोटमी वुंड और एनी काइंड ऑफ इन्फेक्शंस, योनि जो भी हमारे किसी भी तरह के जो वेजाइनल इन्फेक्शंस हैं या फिर जैसे कि योनियाश की हम कर रहे हैं, योनिकंद की कर रहे हैं अगर सर्जरी, तो वहाँ पर योनि धूपन कैन बी डन। These are the alarming signs in the post-operative periods. ब्लड प्रेशर है लेस देन, अगर 90/60 mmHg हो रहा है या फिर ऊपर जा रहा है 160 हाइपरटेंसिव और या हाइपोटेंसिव में जा रही है पेशेंट, देन पल्स लेस देन 60 पर मिनट है और टेम्परेचर मोर देन 38 डिग्री सेंटीग्रेड है, तो ये सारे अलार्मिंग साइन है। यूरिन आउटपुट का बहुत ध्यान रखना है। देन एंटीबायोटिक्स में हम लोग जो यूज कर रहे हैं 24 आवर्स यदि जरूरत है तो दे रहे हैं, अदरवाइज हम लोग जो यूज करते हैं वो ओरल दे रहे हैं 24 आवर्स के बाद में। जो POD 1 है, अभी मैंने जो यहाँ पर मैं डिस्क्राइब करूंगी वो POD 1 के अकॉर्डिंग POD 7 तक जो है वो एक ट्रीटमेंट पैटर्न क्या है हमारे यहाँ का, तो वो अभी करूंगी। देन त्रिफला क्वाथ है, चूर्ण है, अजवाइन वाटर है, चूर्ण दशमूल क्वाथ वी कैन गिव एनीवन। देन नीम घनवटी, ग्लोएसोरस, तो ये सब वी आर यूजिंग। और सब में एंटी इंफ्लामेटरी अगर आप देखेंगे एंटीबायोटिक प्रॉपर्टीज हैं। एम्बुलेशन टू इंक्रीज द पेशेंट फॉर अर्ली एम्बुलेशन। देन POD 1 में क्या आहार विहार और औषध हम लोग देते हैं। देन एडिक्वेट
डिस्टर्ब करूंगी, सॉरी मैम प्लीज थोड़ा सा हरी अप कीजिएगा।
ओके मैम। देन एडिक्वेट ओरल सिप्स है, लिक्विड डाइट्स है। देन पंचकोल चूर्ण, दशमूल कषाय, तृण पंचमूल है। उधर पटबंधना कैन बी एडवाइज्ड इन एब्डोमिनल सर्जरी। उससे क्या होगा कि अगर आप दे रहे हैं तो जो है आपका जो वात है उसको शमन करेगा। ये POD 2 का है। देन POD 3 में जैसे कि कोपेलो हिंगवादी वटी, वी आर गिविंग हिंगवास्टक है। These are the POD 4 to 6 and POD 7. एंड डिस्चार्ज के टाइम पे जो है रेस्ट फॉर 3 to 4 weeks एंड क्वाइटर शुड बी अवॉइडेड फॉर 6 weeks। ये मेरे यहाँ के थोड़े से फोटोग्राफ्स हैं। ये एपिजॉटमी वुंड का है। प्रोसीजर ऑफ LSCS है, इसको मैं अभी आपको दिखा नहीं पाऊंगी, लेकिन एक अच्छा सा प्रोसीजर है, 14 मिनट्स का है, जो कि मेरा किया हुआ केस है। तो प्रोसीजर ऑफ LSCS है, इसकी वीडियो है। देन इसके बाद में others are then procedures of the DNC with my team. It's a video of DNC. Then A samples, abdominal hysterectomy. Now concluded, it should be concluded. So many problems related to the female genital organs can be managed properly by surgical and parasurgical approaches as described in Ayurvedic text with modified tools and techniques. Actually काम बहुत ज्यादा था, बट ये है कि जल्दी करना है खत्म, तो इसको अब मैं कंक्लूड करते हुए शीतल मैडम को और आप सभी को सुनने के लिए थैंक यू मैडम।
Thank you so much, ma'am. Thank you so much for giving the panoramic view of all the surgical procedures going on in your department. बहुत बहुत धन्यवाद मैम। ये हमारे बडिंग सर्जन्स के लिए एक बहुत ही इंस्पिरेशनल प्रेजेंटेशन रहा, और आपने हमारे रिक्वेस्ट को मान देते हुए में हमारे प्रोग्राम में आप एक हिस्सा बने, उसका अहम हिस्सा बने, उसके लिए भी बहुत बहुत धन्यवाद मैम। थैंक यू सो मच।
थैंक यू मैडम।
तो इसी कड़ी में अब हम आगे बढ़ते हुए स्पीकर प्रेजेंटेशंस की तरफ हम लोग बढ़ते हैं अभी। और सबसे पहली जो स्पीकर है वो डॉक्टर नीलाक्षी प्रधान मैडम है, हमारी आज की पहली स्पीकर। डॉक्टर नीलाक्षी प्रधान मैडम जो हमारे हड़पसर आयुर्वेद कॉलेज, जो एक बहुत ही रिनोन्ड इंस्टीट्यूट है, आयुर्वेदा इंस्टीट्यूट, सो उस कॉलेज में, हॉस्पिटल में मैम शालाक्य तंत्र विभाग में प्रोफेसर एंड हेड है। सो डॉक्टर नीलाक्षी प्रधान मैम को मैं आमंत्रित करना चाहूंगी उनके प्रेजेंटेशन के लिए।
Good morning and thank you so much, ma'am. Ma'am, I'm not able to share my presentation unless the previous one is being moved out.
Yes, ma'am. Please stop sharing, ma'am. Sunita, ma'am, please stop screen sharing. So till then, I would like to introduce my first speaker today. She needs no introduction at all. Dr. Mrs. Nilakshi Pradhan, MS PhD Shalakya Tantra from TAMV Pune, Professor and Head Department of Shalakya Tantra, Sumati Bhai Shah, Ayurved Mahavidyalaya, Hadapsar, Pune, Senate Member of Maharashtra University of Health Sciences, Board of Studies Member at DY Patil Ayurveda University, Pimpri, Pune, former Principal of Sumati Bhai Shah, Ayurved Mahavidyalaya, Hadapsar, Pune, 19 years teaching experience, recognized PG and PhD guide. She has so many achievements and so many credits to her due credit. She is the height of all of the above. I would like to highlight she has received Ayush Kamal Bhushan Puraskar and Gyan Vigyan Puraskar, and she has worked as a resource person in protocol writing of Shalakya Tantra conducted by TAS at Gandhinagar and Bengaluru, and she's resource person at so many Institute of Eminences, and she is one of the Shalakis, and budding Shalakis are waiting to hear you, ma'am. So over to you, Dr. Nilakshi Pradhan.
Thank you so much, madam, for this kind words. Am I audible?
Yes, yes. Please go ahead.
Namaskar to all the respected dignitaries, all the respected teachers, colleagues, and dear students. I'm really very much delighted to be a part of this August gathering, which is nothing but Lady Surgeons Conference, which has been held on occasion of World Women's Day. So definitely I hope this will, or this is a great try or great effort to strengthen our power, female power. At the beginning, I would like to thank the organizers, Dr. Joshi sir and Dr. Asutkar madam, who found me useful to share my experiences and views on this great platform. On this occasion, I express my sincere gratitude towards my guide, respected Dr. D.P. Puranik sir, without whose guidance I would have not been where I am today. So, and it is said that without Guru, your boat is wandering in a sea. So Guru is the one who gives you a proper direction. So yes, sir is the one. Before I begin with my presentation, I would like to mention one more thing, which was stated by a respected Pandey sir. It was about anesthesia. Now, due to GR, our condition is like, yeah, great that we fought for the GR, we fought for the right of surgery and we got it. But now our condition is like we are armed soldiers without safety gears, because we cannot perform surgeries without anesthesia, which we used to. So I really hope, I strongly hope that very soon, with efforts of each and everyone, we'll get that right back again. With this, I would like to begin with my presentation. Though I had few words about anesthesia, the topic which I am about to present does not need any kind of anesthesia. So please bear me for that. So we'll begin with the topic, importance of Vidya and Agni Karma in Shalakya Tantra. Am I audible?
Yes, you are audible, madam.
Okay, just give me a second. Yeah. So this comes under Anushastra Karma. Anushastra Karma is surgical procedure performed by non-surgical instrument, as everybody knows. I won't be giving definition, but Agni Karma is nothing but a medical procedure done using controlled heat. It cures the disease which are not managed with Bheshaja Karma, sometimes Shastra Karma or even Kshara Karma. And it is said that the diseases which are treated properly with Agni Karma has hardly have any chance of recurrence. Agni Karma should be done where pain does not stop even after Vidya Karma or even Rakta Mokshan. In the diseases of head or even eye diseases like Adhimantha, Agni Karma should be applied to Bhru, Lalata and Shankha points. Whereas in diseases of eyelid, it should be applied at the root of the eyelashes. After procedure of Agni Karma, the part should be anointed with honey and ghee, which is meant for pacification of Rakta Pitta vitiated by cauterization and also to relieve the pain. It has been divided, Dagda has been divided into many types according to its Akruti, according to its Sthana. So, Balaya is generally used in Antrashul and Kruchashul. Bindu Dagda is commonly used in all type of pain, while Vilekya is advised in Apachi and Pratisaran is done in Nadi Vrana and Bhagandar, etc. According to types, it can be divided into Tvaka Dagda and Mausa Dagda. And important thing is it is advisable even in Sira, Snayu, Sandhi and Asti. Here it is divided into two types like Snigdha and Bruksha. Snigdha can be given with the help of Madhu, Grita or Tela and generally used at Sira, Snayu, Sandhi and Asti. While Bruksha can be given with the help of Pippali, different type of Shalaka, Godanta, which is useful at Tvaka and Mausa. There are different tools which are used for Agni Karma, which are very beautifully explained in Sushruta. We can use Pippali, Ajashakruta, Godanti, etc. for skin related diseases, while we can use different type of Shalaka, which are made of different type of metals. Those are used for muscle related disorders, and honey, jaggery, oil, etc. can be used at Sira, Snayu and Astigata. These are the different tools as I have mentioned. Again in Sushruta, very aptly explain how should be the Suvarna Shalaka, what is the size and even what metals into which proportion is to be put and it is made. This is how the Agni Karma action takes place. It is transferred to the area of the pain through Shalaka, which helps to increase the circulation of the blood to the affected site, which rise in temperature to the area and which helps to increase the rate of the metabolic activity. The pain aggravated by Vata in Tvaka, Mausa, Sira, Snayu and Asti. Chronic wound, chronic wound having some hard elevated tissues, we can use it even to stop bleeding from cut vessels. These are the few contraindications. The individuals in which Pitta Prakop is there, or they are having ulcers, anemia, or alcoholics, or people with low immunity, it should not be done. Next, we'll move forward to Rakta Mokshana. It is effectively adopted as an emergency.
There is a request to make your presentation full screen.
Okay. Okay, madam, I'll do it.
Somebody has requested in the chat box, Dr. Kartik,
Okay.
I think.
Just give me a second. I'll do that.
Yes. Okay, ma'am.
Yeah, is it okay now? Fine.
Okay.
So okay, madam, thank you. So we'll move forward to Rakta Mokshan. It is effectively adopted as an emergency treatment based on the principles of Shodhana and can be done by various methods like Sira, Vedana, Vidya Karma, which I will be talking on, Prachana Karma, and even Jalokavacharan, etc. So what exactly Vidya Karma is? Acharya Sushruta has explained Sira-Ved site for various diseases in Sushrut Samhita, in which blood needs to be drained as per the disease of as per intensity of the disease, strength and age of the patient. So these are the different benefits of Vidya Karma. It enhances blood circulation to the affected part, stimulates the nerves and tissues, improves tissue metabolism, reduces the chances of developing an infection, temporarily stimulates local inflammatory responses, and promotes muscle relaxation and reduce joint stiffness. Vidya Karma operates on same working principle on which we have seen Dagdha was. This does not need any special skills as it is a very minor Anushalya Karma and can be performed at even OPD basis. Patient does not need hospitalization or OT for this specific treatment. It is a matter of pricking at specific with the points with disposable insulin needle to drain trace amount of the blood for faster upashama. It is a simple, safe and cost-effective procedure. It is minimally invasive, doesn't affect the routine of the patient. Patient comes to you, has walked into the OPD, you've seen the patient. If you need that Vidya Karma can help out there, you can go for Vidya Karma. You can very well perform in OPD itself without any kind of anesthetic drug, without the use of anesthesia. And it hardly have any side effect and does not require hospitalization, as already I've mentioned. And the relief is instant. That is the beauty of Vidya Karma. The prick of disposable needle immediately drains out vitiated doshas. Vata has laghu and chalagunas, hence it is released along with the doshas, giving instant relief from pain. Blood draining from the pricked areas can be classified as Kaphaja, Pittaja and Vataja. As everybody knows, Kaphaja shows Askandi Guna, which has prolonged clotting time. Pittaja is Chiras Ravi, which has prolonged bleeding time, while Vataja is Shigraga, which has where blood comes out with pressure. Sushruta has explained at that time, Sushruta has explained how deep should we go for this. If the Vidya point as per the disease is related to muscles, then Vidya Karma can be performed as Yavamatra. If the Vidya point is non-muscular region like till the bones, in that case, the depth should be Ardha Yavamatra. The depth of Vidya Karma can be Yavamatra when veins are not visible. Even now we are following the same principles, even today's era. Yeah, these are the few slides which are related with Shalakya Tantra, different sites of Vidya Karma, which are given in Sushruta. In diseases of tongue and teeth, veins at the base of the tongue, in between frenulum veins, on both the side, here and here, we can see. This is very useful. We have tried many times, especially in aphthous ulcers. Then in diseases of throat, veins over palate, it is useful in chronic pharyngitis. In earache and other ears, excuse me, post-auricular surface. In anosmia and other nasal disorders, vein at the tip of the nose. As recently we have witnessed COVID pandemic. So during COVID pandemic, we used to see many patients in our ENT OPD, those who were having anosmia. Even if we don't do anything for post-COVID anosmia, patient gains back his olfaction after some time. But what we have observed is this: after doing Vidya Karma to the patient, he regained it faster. In defects of vision or suppuration of eyes like conjunctivitis and other ocular diseases, veins near nose, head and outer corner of the eye. This is nothing but Bhrupucha. Now how to perform? We have to perform it with a very precise instrument and not scalp vein, as it is very wider. Insulin needle is the most appropriate instrument. I guess already I've mentioned this. As we can use it on the tip of the nose, Upanasika, or even Karana Pashat. Purva Karma is very simple. What we follow in OT, like clean and ventilated area, aerated room, it has to be performed where there is sufficient light. Then we have to use sterile gloves, mask and surgical cap. Clean the required area with spirit and position, sitting position or even lying down position is okay. In Pradhana Karma, we should be perpendicular to the with the point. Disposable needle should be hollow and not filled with the blood. Keep the needle pricked for 5 to 6 seconds. If patient has fear for needle, it can be done very swiftly or removed very swiftly. Then vitiated blood flows. Vitiated blood flows freely due to low coagulancy and is drained out until fresh blood automatically coagulates. Usually the blood loss or blood flow is about 0.2 to 0.5 ml, this much small. For follow-up, number of Vidyakarma session depend upon degree of vitiated dosha, or an acute disease can be cured in 1 to 2 sessions, and in chronic conditions, it may require multiple number of sessions. Then if impure blood is not drained completely, repeat Vidyakarma on the same day or even the next day. If the degree of vitiated dosha is more, Vidyakarma with Snehan is to be performed after 15 days. In case of complications, post Vidyakarma should be treated like Shonita or Vatarakta. During Vidyakarma, to one of the patients in our OPD, we come across a different kind of, what you can say, complication. We just did Vidyakarma and patient automatically fainted down. She was, she had profuse sweating. Then she was actually in hypoglycemia. Then we have gotten all the investigations. We have given her a head low. We have called physicians out there. Then she got admitted. And while discussing this with the seniors and going through the granthas, we actually got to know whenever such thing happens, there is a very simple treatment for that. And that is nothing but you have to take prick on your Kshipra Marma, and that takes care of such complications. Mode of action: stimulation of the peripheral tactile receptors, depress the transmission of the pain signs from the area or from various body segments, which results from the type of local lateral inhibition. And due to this phenomenon, rubbing the skill, use of different liniments or acupressure, acupuncture, Vidyakarma and Agrikarma-like therapies are often helpful in relieving the pain. These are the few slides I'm showing where we used to do or we are using Vidyakarma. In Netrapatalagat Vyadhi, Pakshmagat Vyadhi, from Bhruprucha, that is depression of the lateral end of the eyebrow. In Vartmagat Vyadhi, Bhruprucha and Apanga, this slide is showing Apanga over here. In Shuklagat Vyadhi, Bhrupucha, Apanga and Stapani. In Drishtigat Vyadhi, Upanasika. In Drishti Mande, when there is high refractive error, that is more than 3 diopters, Bhruprucha, then Apanga, then Stapani. While in mild refractive errors, Bhruprucha to Stapani. In Netrashul, Bhruprucha, Apanga, and Stapani. There are repetitions, but believe me, these are really very useful. In diabetic retinopathy, Bhruprucha, Apanga, Stapani, and Upanasika. In Karna Vyadhi, near Vidhura Marma, near hairline, and in Karnapali. This slide is showing, this is not Vidyakarma slide. This I have taken just to show Karnapali, where exactly the Karnapali point is. Then in Karna Badhirya, may it be sensory neural or deafness, the sites are the same, Shankha, Karnapali, and near Vidhura Marma. Thank you so much. Actually, it was really a very wide thing to be explained. I've tried my best to make it as crunch as I could, as we have time limits. Once again, I would like to thank Dr. Sheetal Asutkar Madam and all the organizers for giving this opportunity to me. Thank you so much.
Thank you so much, Madam, for a very precise presentation on parasurgical procedures in Shalakya Tantra. Thank you so much. So, for those who have joined this event a bit late or Maybe some were busy because this is a Monday. This is the start of the week. So some might be busy in their IPDs or OT procedures or OPDs, and they might be somewhat joining this mega event. So I welcome all those dignitaries in the mega event of Lady Ayurveda Surgeons Conference on the very coveted forum of Ayush Darpan Foundation. And the event is in collaboration with Mahatma Gandhi Ayurveda College, Hospital and Research Center, the constituent college of Deemed University, the Tamega Institute of Medical Sciences, Deemed to be University. And we are very happy to welcome you all in this chapter 2 of the Lady Surgeons Conference, Lady Ayurveda Surgeons Conference rather. And the theme is contribution of lady surgeons to Ayurveda surgery, to the uniqueness of Ayurveda surgery. So this gives me immense pleasure to have Dr. Varshney sir, Dr. Subhash Chandra Varshney sir, my guru, as chairperson of this event. Thank you so much, sir, for blessing us with your presence throughout the day, and day 2 also sir will be with us. Then again we have Dr. D.N. Pandey sir, Dr. Suman Sharma, NI Jaipur, Dr. Sunita Suman, IMS BHU. Then we have Dr. Sangeeta Salvi ma'am with us, Dr. Nilakshi Pradhan. Then we have Dr. Veena Patil ma'am, Professor Head PTSR Department, GAC Osmanabad. Then we have Dr. Shrikant Kashikar sir with us. So all the dignitaries we have with us, and we have 24 speakers with us, 24 lady Ayurveda surgeons, eminent speakers, eminent surgeons with us. They will be presenting to us their unique surgeries, their uniqueness of surgeries, parasurgical procedures through their marathon presentations that we will be having over here. And me, myself, Dr. Sheetal Asutkar, I welcome you all again on this dais, this forum. And we in the morning we had inaugural session, and in that session we had the virtual inauguration program along with the condolence ceremony to late Dr. Premvati Tiwari ji. And later on, after the inauguration, we had keynote address by Dr. Sunita Suman, and the first presentation by Dr. Nilakshi Pradhan is over right now. And moving ahead, we are having the series of second presentation in the series, Dr. Nirmala Savarkar. So I call upon Dr. Nirmala Savarkar for her presentation. Nirmala Savarkar is a PMS, MD, MS and PhD scholar at Government Ayurveda College, Nagpur. She is presently working at LN Ayurveda College, Bhopal. And she has many academic achievements and activities performed, like presentations in national and international conferences and seminars, and articles, many articles, publications, international and national level to her credit. And she is an eminent scholar, a sincere student. I remember her as during her PG days. And again now she is with us today. She is presently associate professor in the Department of Shalya Tantra, LN Ayurveda College, Bhopal. So Dr. Nirmala, I call upon you for your presentation. You unmute yourself now, Dr. Nirmala.
Yes. Now I'm able to unmute myself. Am I audible, ma'am?
Yes, you are audible.
Yes. Thanks for your blessings, ma'am, and your kind words. These words are just like a backbone for me. Very good morning to one and all present over here. It's really great to see you all stalwarts of Ayurvedic surgery at one platform. Really happy I am, rather privileged to be a part of this web conference. First of all, I would like to congratulate Dr. Sheetal Asutkar ma'am and Naveen Doshi sir, Ayush Darpan Foundation, and a sincere condolence to Dr. Premvati Tiwari ma'am. Shall I share my screen?
Yes, please go ahead. Yes. Dr. Nirmala will be presenting on fundamentals of Sushruta in emergency care.
Yes, it is visible. Is it visible now?
You will have to share your presentation.
I have shared this, ma'am. My screen is sharing there.
Not visible.
It's just a minute, ma'am. Is it now?
No, it's not visible. Okay.
Is it now, ma'am?
Yes, yes, yes. It is
okay,
visible.
ma'am.
Please start.
Yes, yes, yes.
Please make it fast.
Yes, yes, ma'am. Yes. Actually, Sushruth proposed his very famous advice that any knowledge system in isolation cannot progress. There should be a continuous crosstalk and application of mutual thoughts for healthy community. And for this purpose, we all are here.
There is some disturbance in your presentation. I am able to see.
Yes.
There is a patch, blank patch in between the slide. Actually, whether it is a PPT or a Word file, whatever it is. PDF.
I have converted it. It is to the PDF file, and
yes, now it's okay. Now it's okay.
Oh, okay, okay, ma'am. Okay. So, for this purpose, we all are here, and my topic of presentation is Fundamental of Emergencies in Ayurveda, a perspective from Sushruth Samhita. Today, I may not be talking on emergency care, but I'm certainly going to share some perspective on fundamentals of emergency care. This presentation is meant for educational purpose, as there are undergraduate students are also joined to this webinar. So begin with, I would like to share this beautiful quote. He who conquers an emergency is the conqueror of all diseases. Let me begin with what is mean by are there any references in Ayurveda about emergency? आयुर्वेदा में आईसीयू केयर और इमरजेंसी केयर हो सकती है क्या ये ड्रीम और सपना हम देख सकते हैं? इन सवालों के जवाब के पहले वी हैव टू सी कि आयुर्वेद इस इमरजेंसी या इमरजेंसी कंसेप्ट को कैसे देखता है. Firstly, if we look towards this word or elaborate this term, then the condition in which our life is in danger or harm is nothing but the emergency condition. And according to Ayurveda, life is due to Atma or Pran. And जब किसी कारणवश हमारे प्राण संकट में आ जाए, इस स्थिति को हम इमरजेंसी और क्रिटिकल कंडीशन कह सकते हैं. अब प्राण तो हम हर किसी को पता है, बीइंग एन आयुर्वेदिक fraternity, and we all are very blessed with this pran condition, means this courtesy or liberty is not present in the modern pathy. We will not go in detail with this term due to time shortage, but any situation or condition, rather symptom which brings the life in trouble, we can call it as an emergency or prana sankat. So moving towards the next slide, does Ayurveda have any emergency condition? This is the foremost question comes in the mind of common people. क्या हमने कभी सोचा है कि why this condition or this thought arise in the common mind of common people? Are Ayurveda medicines not competent to combat the emergency? Is our system is not designed to care the patients of medical emergency? And the answer is yes, a big yes. Any medical practice do have the emergency condition. It is a great rumor rather, Ayurveda doesn't deal emergency. On the other hand, Ayurveda text had lots of diseases and condition under the context of Attek Avastha. It is not only Ayurveda is not only a science of rehabilitation only. It is a science of life in sustaining healthy life, or when the patient or person is in trouble, an emergency is there. So अत्यधिक चिकित्सा और this condition is not new. Acharya Sushruta told in Adhyay 5, so Adhyay 5, Atipashu Nichit Vidhinam Bhisha Pradipkaravatam Tat Kuryat Pratikriya. आचार्य सुश्रुत कहते हैं कि जिस प्रकार अगर कोई मकान जल रहा हो तो हम उसके प्रतिकार के लिए जिस किसी भी उपाय से लाभ पहुंचे वह अपनाते हैं, चाहे पानी हो या कुछ भी। उसी प्रकार तीव्र रक्तस्राव आदि कारणों के द्वारा जीवित की हानि या प्राण का भय, प्राण का संकट उत्पन्न हो तो हमें हर संभव उपायों के द्वारा उसके प्राणों की रक्षा करनी चाहिए। तो दिस इज द डिजीज फॉर्म विच कैन नॉट वेट फॉर कॉल. दिस इज एन अनप्लान्ड मेडिकल इमरजेंसी और इलनेस. It poses an immediate risk to a person's life or long-term health that requires immediate assistance from another person. The literature of Darun and Ashukari diseases need to be elaborated with respect of current scenario. These sudden unforeseen crises, usually involving pain, bleeding, or any life-threatening symptom which are fatal, can be considered as emergency. And आयुर्वेद में से सूत्र रूप में अनगिनत सिद्धांत है। जरूरत है तो उन बस सिद्धांतों को समझने की। ऊपर के वर्णन में हमने जैसे देखा कि क्रिटिकल कंडीशन में या इमरजेंसी में बनाती है, प्राणों पर निर्माण होता है। भाव प्रकाश, आचार्य भाव प्रकाश में सद्य प्राणकर द्रव्य और सद्य प्राणहार द्रव्य, ऐसे 6 वस्तुओं का या षड वस्तुओं का वर्णन है। फॉर एग्जाम्पल शर्करा है, क्षीर भोजन एक्सेट्रा। अब इसको हम थोड़ा सा उदाहरण स्वरूप समझ लेते हैं। If in hypoglycemia, if symptoms like fainting, blurred vision, excessive sweating, mental confusion are there, then if you immediately administer glucose in increased concentration, and by doing this the patient will get to normal condition. अगर ऐसे कंडीशन में हम ग्लूकोज, एनी सॉर्ट ऑफ ग्लूकोज लाइक ग्लूकोज बिस्किट हो, ग्लूकोज पाउडर हो, अगर हम एडमिनिस्टर करते हैं तो बहुत बार पेशेंट उन कंडीशन से रिलीफ हो जाता है या नॉर्मल सिचुएशन में आ जाता है। कुछ बार ऐसे भी होता है कि उसको रिलीफ नहीं मिलता है, एंड दैट टाइम वी हैव टू रेफर दैट पर्टिकुलर पेशेंट टू अ हायर सेंटर। बट इफ सिम्पटम रिलीफ, देन कभी हमने सोचा है कि दैट दिस इंक्रीज्ड ग्लूकोज इज नथिंग बट द शर्करा, which is already told by our Acharya, our Ayurveda, and by using this shortcut get relief from the hypoglycemic condition likewise. तो यहाँ पे उसके प्राणों पर जो बनाई थी, उस प्राणों के संकट में, इस प्राण के संकट में हमने शर्करा का यूज किया, ग्लूकोज का यूज किया, and by this the patient retain his normal condition. Likewise पुराण कालों में भी लाइक महाभारत है, रामायण है, ऐसे कई रेफरेंसेस है जैसे जिनमें बहुत बार ऐसे कुछ औषधियां या कुछ ऐसे मेडिकेशन हमने यूज किए जिससे जो पर्टिकुलर व्यक्ति है उस मूर्छित अवस्था से रिटर्न आ गया। तो हनुमान जी ने जो संजीवनी बूटी लक्ष्मण जी को दी और लक्ष्मण जी मूर्छित अवस्था से पुनः जीवित हो उठे। तो ये इससे बड़ा उदाहरण मैं और कुछ नहीं दे सकती या बड़ा नहीं हो सकता कोई उदाहरण। एंड इज अ फादर ऑफ सर्जरी एंड हिज कंट्रीब्यूशन इज गिफ्ट टू एंटायर वर्ल्ड, एंड दैट इज व्हाई वेरियस रेफरेंसेस ऑफ इमरजेंसी केयर is taken from our Sushrut Samhita. Now there are n number of references scattered here and there in our classic. We just see few of them. Just have a look. In Shakha, that is Chinna Nisheshtah Shakha Dabha Tailena Buddhimana Sabadniyata Koshabandena Praptam Karyam Churopana. इसका मतलब ऐसे है कि in the management of Shakha Aghat, means limb पे कोई injury हुई है, Nisheshtah means when there is a limb injured completely, then burn it with a hot oil and apply a Koshabandhan, that is sheath bandaging. So this is nothing but the amputation. If it doesn't ampute that limb, then further necrosis will be there, and अगर हम उसको burning कर रहे हैं with the hot oil, then this is nothing but the Agni Karma. So by this we can prevent the life of that particular patient. Then in Raktasrav, some Raktastambhak upaya is told by Acharya Sushruta. Raktasrav means excessive hemorrhage, and how one can forget the major to arrest the excessive bleeding, like Sandhan, Skandan, Pachan, Dahan, etc. In case of again, if there is an internal hemorrhage due to Bhinna Koshta, भिन्न कोष्ठ, देन पिबेद अस्त्रोका, यानी जहाँ पे अगर परफोरेटेड इंटरनल ऑर्गन्स है तो उसके ट्रीटमेंट के लिए आचार्य सुश्रुत ने बोला है पिबेद अस्त्रोक, यानी रक्त का पान करने को बोला है. एंड दिस इज नथिंग बट द ब्लड ट्रांसफ्यूजन. दो रूट इज डिफरेंट here, but it highlights the importance of blood for life. Then next, in grass shalya is nothing but the acute choking with foreign body obstruction, and it may be successfully treated by skandhe mushthina abhihanyatah. It can be correlated with hemorrhage manure, back blows. It is very useful in where there is a foreign body in airway or in a food pipe. Yes, about fracture also. So wonderful knowledge existed about fracture and its treatment. Up to some extent, fracture is not an emergency, but in various conditions like agonizing pain, excessive bleeding, it gets into emergency. The Sushruta's techniques, principles in the management of fracture, anchan, pedan, sanship, can be correlated with fraction, manipulation, opposition, and mobilization remains same to the contemporary science, and which holds true nowadays also. And of course, the greatest achievement, that is reconstructive surgery in Nasa Karna Akshis Aghat. Again, it is not an emergency, but when patient comes with injury, then then repair of that injured part that result into the decreased function is again a kind of emergency treatment. Then next, in case of thrombosed hemorrhoid also, severe pain. First of all, hemorrhoids are not just like an emergency part, but when that hemorrhoid get into thrombosed situation of condition, and then severe pain, agony, restlessness turns this conservative condition into emergency. And then this rectamotion like leech therapy proves beneficial to reduce its symptom. In next, in perforated ulcer also, abdomen due to perforation, Ayush told about कि हमें वहाँ पे करना है चींटियों के द्वारा उस छेद को हमें बंद करना है. तो यहाँ पे हम सोच सकते हैं कि चींटिया इज नथिंग बट द बायोलॉजिकल, कि चींटियों के मुख को हमको सिर को वहाँ पे ही रखना है. तो एब्जॉर्बेबल एंड नॉन एब्जॉर्बेबल सूचर मटेरियल का हम जो सोचते हैं, दैट कंसेप्ट इज रियली एप्रिशिएबल हियर. Now, to conclude, the common notion about inefficiency of Ayurveda in tackling emergency is defined by the Ayush practitioner who are successfully running their clinics in the field. Many treatment modalities are there in Sushruta Samhita, and in our class 6, need of our is just to explore those old sutras in the modern light with current advances. It is our prime duty. In Ayurveda also, it suggests few routes of that act in emergency. For example, नस्य है, दस्ती है, धूमपान है, ऐसे कुछ हम ड्रग ट्रीटमेंट मोडालिटीज डेवलप करें जिससे हम इमरजेंसी ट्रीटमेंट अच्छे से कर पाए. We can also use some medicines like रसौषधि in sublingual route. It can be proved as an emergency medicine again. और यहाँ पे सबसे इम्पोर्टेंट है, वी हैव टू चेंज आवर व्यू. हमें दृष्टि बदलनी है, दृष्टिकोण को बदलना है. वी हैव टू चेंज आवर व्यू टुवर्ड्स आवर can develop some medicines which can be used by parenteral route also. And with this, I conclude the take-home message. This is our moral duty as an ancestor of Sushruta to flourish our science. और जो मान सम्मान जो कि आयुर्वेद शल्यकर्ता को मिलना चाहिए, उसके लिए हमें कोशिश करनी चाहिए. हमें अपने रोगी को जीने देना है. उसके लिए रोगी पूछता नहीं है डॉक्टर साहब यू आर यूजिंग आयुर्वेद और एलोपैथ इन इमरजेंसी, दैट दिस क्वेश्चन इज डजंट अराइज देयर कि विच पैथ यू आर यूजिंग. उसे तो बस उसकी लाइफ को सेव करना है. सो आयुर्वेद के पास हजारों सालों का तजुर्बा है, एंड उसके साथ साथ मॉडर्न के पास उनके टेक्नोलॉजीज है, न्यू टेक्नोलॉजीज है, मटेरियल्स है, इक्विपमेंट्स है. तो हम दोनों इसको साइमल्टेनियसली एक प्लेटफॉर्म पे काम कर सकते हैं और पेशेंट की जिंदगी बचा सकते हैं. So with this, I'm ending my presentation. I'll stop here. Thank you, organizing committee, for giving me this chance. Thank you very much.
Thank you very much, Dr. Nirmala, for a very precise, very nice presentation on the emergency care from Ayurveda. You have sincerely tried to give to our UG aspirants, our PG aspirants, and you have very elaborately you have explained the practical aspects of yoga. So thank you very much for being the meeting. And moving ahead, whatever things we are discussing today under the aegis of Ayurveda surgery, as rightly said by Dr. D.N. Pandey sir, mission Sangyaharan restoration is the need of the hour today. We need our bhai band, our bandhav, we need our friends, our fraternity, our colleagues, our brothers, sisters with us from Ayurveda fraternity, particularly Sangyaharan fraternity. उनके बिना हम कैसे काम कर सकते हैं? Right now we have to depend for the major aspect of anesthesia on the modern science. So we have to work hard. और सर ने बहुत ही अच्छा इनिशिएटिव लिया हुआ है. ही इज वर्किंग वेरी हार्ड फॉर द मिशन संज्ञाहरण रिस्टोरेशन, जो कि हमारा पोस्ट ग्रेजुएशन है वो बंद कर दिया गया है किसी कारणवश. तो हमें उसको रिस्टोरेशन करने में हम सर आपके पूरा हम आपके साथ हैं, और हमारे सारे कलीग्स इस मामले को यहाँ पर आज एक्सप्रेस करते हैं कि हमारी ईच एंड एवरी प्रोसीजर में, ऑलमोस्ट सर्जिकल प्रोसीजर्स में हमें किसी ना किसी तरह के एनेस्थेसिया की प्रोसीजर्स का सहारा लेना पड़ता है, मोस्ट ऑफ द प्रोसीजर्स में. सो we actually support the mission Sangyaharan restoration, what you have undertaken as a task. So once again, I call upon another speaker for today, another equally dynamic speaker for today, Dr. Kiran Mendekar. Dr. Kiran, she will be speaking on medical legal aspects in emergency in surgery. So she is again one of the very good, sincere students of mine, and she is presently working at PDEOS Ayurveda College and Hospital at Akurdi, Pune. So she is associate professor, presently working at the very recognized institute, who is the one of the oldest institutes having post graduation and PhD research also, and it's a renowned institute for oncology also. So Dr. Kiran, I invite you for your presentation today.
Yeah. Good morning, all the honorary surgeons who are present here for this great event on International Women's Day. Thank you so much, Dr. Sheetala Sutkar ma'am and Dr. Naveen Doshi sir for this opportunity. My sincere condolences to Dr. Premvati Tiwari ma'am. She was a very dynamic surgeon in the field of Ayurveda surgery, and I will pay the gratitude towards my guide, Dr. Shrikant Kashikar sir, who taught me the lessons of general surgery, plastic and reconstructive surgery, and also he taught me the many cases, how to deal with the medical legal aspects. I will proceed with my topic. Am I audible, everyone?
Yes, you are. Please go ahead.
Thank you, ma'am. So we know that recently we got the Gazette of India, who has allowed the Ayurveda surgeons 58 surgeries we can do imminently, and we can talk to our budding surgeons at the institute level also. For this achievement, many of the NCSM members have paid lots of efforts. Amongst them, Dr. Shrikant Kashikar sir, Dr. Sheetal ma'am, Dr. Jayan Devpujari sir, they have paid a great efforts for us and for our junior surgeons to conquer this main thing. So in this topic, we are going to see the medical legal aspects, which is the main, which is having a major impact on the society and on the surgery practice nowadays. So as we know, legal and ethical issues in the medical practice are increasing day by day over the century. What will be the reasons? So there are 4 reasons which are mainly responsible for making these issues. That is the number of involvements in the providing healthcare. See, day by day, there are more and more healthcare agencies, funding agencies, administrators, which are complicating some of the procedures. There are many clashes in the views, opinions, and which are being the priorities, which have the major ethical and legal dimensions. This is the major reason for developing a medical legal issues while performing an emergency care and while performing the surgery. Then the next major reason is the multicultural societies. So in an Indian community, we have the culture with multiple languages, multiple religions, multiple ethnicities, where we have to pay the respect of all the persons and their languages and religions. So might have there will be a communication gap or a lack of information, which is troubling and making more and more medical legal issues nowadays. The third one will be the people of a modern world. So most of the people, for education purpose or for other purpose, they migrate to the other countries. What they will do, they will seek an opinion of the surgeon or a physician from the India, and they will when they go outside, they will take an opinion from their surgeon, and there will be consequences or the clashes or the difference between the opinion of the surgeon, and which will make major legal issues amongst the patients. Now, and development of the new medical specialties and newer techniques. These whatever the techniques which have been introduced or specialties have been introduced in the society, they should have the standard operating procedures. So minimum standard operating procedures can make these issues minimum, which are nowadays making surgeons more and more exposed to the medical legal and the ethical issues. So to achieve the goal and to make the standards, to set the standards, there are some principles which have been told in the surgery, that is called as a surgical ethics. So in this slide you can see the survey report which has been published in 2019 in Times of India, which is focusing on the doctors and patients relationship. So the awareness has been increased in the patients day by day because of the internet, because of the journals, because of the articles, because of the communication, and because of the education. So we have to prepare whenever we face the patient or whenever we deal with the case of medical legal, either of the medical legal or the surgical or the medical emergency. So for these cases, we have to see as I said, that there will be a litigations. Two or more surgeons or the physicians can see one patient and they can make another decisions, the multiple decisions. If they don't fall at the same place, then patient will found something what we say untrustworthy to the patient, to the towards the doctors, and that can make a problem, or that can trouble the doctor by making a litigations. So for this, the surgical ethics has been introduced so far when the Hippocratic Oath has been settled. So these ethics, if the surgeon, if the fixes, and if he is bound to these ethics, and he will play the roles as per the ethics and the discipline has been told by the surgery, there will be no consequences in the future which can lead to the medical legal issues towards him. So the basic principles of surgical ethics will be the respect for patient autonomy. That is, you need to respect the patient's autonomy. You need to respect the psychological, physical conditions. You need to listen to him. You need to follow the confidentiality and avoiding deception. You should clear all its confusions, and you need to respect as the patient as a human being. You should pay the respect as towards his dignity. Beneficence means the second ethic is very important, which will fall very towards the benefit of the patient. Whatever will be the the disease has been occurred or diagnosed, whatever will be the investigation you have to go through, whatever will be the surgery to perform, whatever will be the complications are going to occur, the surgeon should be transparent and clearly suggest to the patient and the relatives regarding the outcome and the consequences. Non-malfeasance, that is our oath, that surgical competence. We should know the competency of ourselves. We should know the capability and caliber. We should perform the surgery with the complete discipline, with the maintaining professional development, and we have to follow the strict infection control measures, which is very important. And the fourth one will be the justice. So these are the principles, and this is the flow chart of the ethical issues in the surgery. Every ethical issues in the surgery are interrelated, if you can see on the slide. So they are interrelated, and they are good, or they are beneficial for the human beings and for the good surgical outcome in the society. So what are the medical legal issues? So we know in the surgery, various medical issues can occur while operating the patient. For example, surgery on the wrong site, during transfusions, making reactions, removal of the wrong organ, anesthetic mishaps, tight plaster costs, wrong side operatives. So there are various, the issues which can be faced medico-legally because of the unawareness and because of the irresponsible attitude of the surgeons or the paramedical staff. Medical negligence and act. Medical negligence is a mistake that resulted in causing a patient unintended harm. See, negligence is an unintended harm. And on the another hand, there is a word called as malpractice, where there is an intended harm to the patient. Okay, so medical negligence, somehow we are doing our duty, we are following our protocols, but that will be the unintended harm. But it should not be done by every surgeon. He should strictly follow the surgical ethics. There are some laws or acts which fall under the heading of medical negligence. That is the act of omission, failure to do something. That is, if the patient needs to resuscitate, and the doctor is not even giving a CPR, or a paramedical staff is not giving at least a CPR to the patient. So that will be the one example. The act of commission, doing something which is wrong, which the doctor should not do. Okay, that is giving a false medicine because of the synonymous name of the drug. So that will not tolerable. Professional negligence, it should not be done. Professional negligence is a lack of reasonable care given by a doctor to the patient, due to which the life health of the patient is endangered. You should not do it. Medical legal case is the case which is filed against the doctor because with the due communication of some medical field people, where the law is essential, where they found a law is essential. And assault will be the physical attack. So there is an Indian penal code which have been set the different sections against the malpractices in India. So these malpractices in India and medical negligence or medical issues can be reduced by doing a surgical audit, which is a quality control for medical practice. At least we should follow one protocol, one discipline, which will fall under the heading of surgical audit. Clinically involves systematically looking at procedures used for diagnosis, care, treatment, resources used for examination, investing the effect care data about the outcome of clinical activity, and will fulfill the requirements of ensuring that quality patient care is provided. So this will be the chain or a cycle that, for example, we are planning surgery to the patient. So we have to investigate, we have to first clinically examine the patient, diagnose the disease, examine or rule out the comorbidities associated with the patient, take a complete clinical history and a surgical history, then set standards, investigate the patient with the informed consent or admit patient with the informed consent, follow the surgical ethics, then set the standards, investigating with and proper fitness of the physician and anesthetic fitness, which will be documented over the medical record, then plan the patient for a surgery, and then all the post-operative care which will be written over the medical record of the patient. Okay, so what the audit will gives, audit will collect all the data of the patient medical record. It is a cycle of the collecting data. It will give the outcome. So it will give the outcome and allows the practice to pick up variations from expected at an early stage. So is there any loophole in the protocol, or is there any lacuna in setting standards, or setting the patient care? So that will be detected at early stage if we set the audit. So it will help to reduce the future damage to the patients and any legal problems, because you will have a legal documented papers with you, and all patient's history, surgical history, and his prognosis and outcome and consequences will be labeled over the documented paper. A habit of keeping medical records are best defense against allegations of negligence or medical malpractice, for example, in the court evidence. So we will proceed with the documentation of medical records. So we can see the medical records have a common one list, that is a current and previous medical problems, that is a complete surgical and medical history should be denoted, with the clinical findings, diagnostic tests will be suggested, with the expert opinions will be given, operative procedure, treatment protocol, progress reports, final diagnosis, discharge treatment summary and follow-up will be written, and should be the content of the medical record. Now we will see the components of medical record, that is OPD record, IPD record, medical certificate, MLC records, dying declaration deposition, and
you have to hurry up, beta.
So yes, ma'am. Am I audible?
You will have to hurry up.
Yes, ma'am. Yes. So importance of medical records are medical education, for research of incidents, prevention, treatment of diseases, for audit, for medical statistic, it forms a legal evidence in judicial proceedings, and LIC claims, workman's compensation, they play a big role. So discharge card, we know the discharge card should reflect the whole and soul treatment of the patient. OPD records and IPD records should be documented on the paper, and all the records should be scanned and filed in the departmental database. Overwriting and overwritten, erasing should not be done on the paper, and if it happens, there should be a signature of the doctor with the date and time. Consent in medical legal cases. In MLC, examination should be taken in written in all cases. Person below 12 years or unsound mind, consent of guardian will be taken. Consent is not required in medical emergencies, notifiable diseases like HIV, AIDS, leprosy, immigrants. Exception will be if the case has been brought by the police arresting for the charge of committing offense, new admissions in prisons, and any for the criminality, and members of the armed forces. Informed consent plays a major role and a very important aspect of the medical legal documentation. Even a minor operative procedure, or it should be never verbal. It should be under patient's own language, and always it should be expressive, and it should be signed by the patient with the left hand thumb impression. Denied consent should be recorded. So this is the reference of this surgical ethics, which has been very well explained by Acharya Sushruta in Vishikhanu Praveshiya Adhyay in Sutrasthan. While referring patient to the tertiary care center, we should always take a transferring consent, while with giving one copy of transferring notes and investigation report of the patient, and you should always make a note why for the reason of transferring the patient. Intimating police for medical legal case. See, these are the various cases where we have to intimate the police. In emergency treatment, the MLC to the police will be informed immediately, and bill number of the police attended will be noted. Surgical process or procedure and intervention. Informed consent for anesthesia and surgery is mandatory. Physical fitness opinion is mandatory. Post-operative instructions should be written on the document in a very clear way. Always take a high-risk consent with the patients of comorbid conditions existing. Post-operative care is the complete. Yes, ma'am.
Please compile.
Yes, ma'am. Yes. Give me only 2 minutes, ma'am. This is the Consumer Protection Act, which has been established in 1986, and now for the medical professionals, the act has been re-established in 1995. This is a very important aspect from my presentation. There is a consumer forum notice. In case if any of the doctor or the medical face a notice because of the medical issues or medical legal negligence, first of all, the doctor receives a notice from consumer forum. Maximum support and guidance should be provided. The notice, the date and type of the notice will be documented. Date of reply will be documented. Allegations which have been made again by the patient against the doctor should be re-examined and read carefully, and reply will be done towards the allegations with the consultation of associate and advocate. So copy of complaint, summary of events and reply of the allegations should be sent to the advocate. The advocate will reply in the 30 days, and extended date can be demanded for 15 days for the extension of the answer. The all expected literatures should be gathered, and they should be submitted to the court, which are on the preferable side in the favor of the practitioner, and update the progress of the case in the insurance company. Inform the insurance company through the agent and medical legal cell. Handling allegations of the patient. Don't ignore the allegations of the patient. Professional guidance is needed. Police complaint in case of the physical threat to the medico, and guidance from the seniors is always expected. So these are some references for my presentation I have gathered over here. And thank you so much for giving me this opportunity. Thank you, ma'am.
Thank you, Dr. Kiran, for a very nice presentation. It was actually too contentful presentation on the medical legal aspects of the surgery, Ayurveda surgery, and in general also. It is very important to know all the medical legal aspects of the practice. So thanks for a very contentful presentation, Dr. Kiran.
Thank you so much, ma'am.
Thank you very much. So now I request and call upon Dr. Jaishila Goni for her presentation, and I hand over the mic to Dr. Nirmala Savarkar for the session to be conducted from this particular presentation onwards. So Dr. Nirmala Savarkar, I hand over the mic to you.
Thank you, ma'am. Yes, am I audible now?
Yes, you are audible.
Thank you very much, ma'am. So I'll start now. Our next presentation is by Dr. Jaishila Goni, ma'am. Ma'am is a professor and head of the department PTSR at Parul Institute, Vadodara, Gujarat. Her topic of presentation is outline of research works conducted in different universities in India on Sangyaharan. Briefing through her introduction, ma'am has many feathers in her crown rather. She's having 23 years of teaching experience. She's a PG guide, PhD thesis evaluator. She has written many articles. She has a mobile app for leech therapy. She is a qualified diabetes educator from National Diabetes Educator in collaboration with IMA Bangalore. And so many things are to say, but due to short of time, I'll request Dr. Jaishila Goni ma'am to start her session. Over to you, ma'am. Yes,
Dr.
Dr.
Audible? Yes, ma'am. Please unmute yourself.
Yes, ma'am. You're audible.
Namaste. Good morning to all the respected dignitaries and organizers and co-speakers. It's a great opportunity for me to share my thoughts on the occasion of Female Surgeons Conference, especially on the day of International Women's Day. And with the blessings of Dr. D.N. Pandey sir, I also support the mission Sanyaharan Restoration. And today my presentation is also related to that. I am trying to convey the message of importance of Sanyaharan, especially to revive this department in Ayurveda. Can I share my PPT presentation?
Yes, ma'am, please share.
Are you able to see?
No, your presentation is not visible, ma'am. हाँ किरण हाँ तो
It is showing Microsoft OneDrive, Google Drive, Box, Photo, Document, where I can.
स्क्रीन ऑप्शन लीजिए.
Screen option is there, but when I'm going there, it is showing Microsoft OneDrive, Google Drive, Box, Photo, Document. It is showing.
Share screen. Your presentation. Take it on desktop. And go to desktop.
Instead of that, can I share it with you? If it is okay, I'll present later. Otherwise, because I'm not able to share it.
Okay, madam. Okay.
You're not able to share it.
Share with us, ma'am. You can share with.
I'll immediately share it.
Okay. Till then, we'll call next speaker, ma'am. You please be in the.
Sure.
Okay. So, Dr. Nirmala, you can call Dr. Amrita Mishram, madam. I think she is the next presenter. Or Pashmina Joshi. Is she in the meeting? Dr. Pashmina Joshi, madam? Dr. Pashmina Joshi, madam?
Dr. Pashmina Joshi, ma'am.
Yes, Dr. Pashmina Joshi is in the meeting. Dr. Pashmina Joshi, ma'am, please unmute yourself.
Hello, ma'am. I'm in the meeting. Hello.
Hello. Yes.
Yeah. I was not able to unmute because of the settings of the meeting.
Okay, ma'am. Now you can start, ma'am. Dr. Nirmala, please introduce.
Yes, ma'am. Yes, ma'am. Dr. Pashmina Joshi, ma'am. MS in Ayurveda Shalatantra. She is a reader at Shalatantra Department, ITRA, Jamnagar. She is a PhD scholar. She is having 18 years of teaching experience, 21 years of clinical experience, and she has her specialization in anorectal diseases and their surgical management. Madam is a vice president at Sushruta Proctology Association. So, ma'am, I would like to request you start her presentation. Over to you, ma'am.
I hope my presentation is visible to everyone.
Yes, ma'am. Yes, it is.
Okay.
It is clearly.
Okay, ma'am. A very good noon to everyone, all the dignitaries, especially respected Varshne sir, DN Pandey sir, who has been a torch bearer in understanding of Ayurveda in my life also personally, because he has been my co-guide for maybe a short while, but has been there. So DN Pandey sir and all the other Kashikar sir and Navin Joshi sir, Sheetal ma'am, everyone, all the dignitaries who are present right now, Nirmala ma'am and all. So, ma'am and sirs, all the dignitaries, very warm good afternoon, and good afternoon to all the other delegates and speakers who have joined the meeting today. Myself, Vaidya Pashmina Joshi, and today the subject on which I need to talk is constipation during pregnancy and its management. Introducing this subject now, introducing this subject now, that motherhood is the most beautiful time of a woman's life, we all know, but some conditions make it the most difficult time of the life. These are termed in Ayurveda as Garbhini Vyapat and Sutika Vyapat. There is some uncertainty among obstetricians, proctologists, and other concerned about the most effective management of anorectal complications that might affect the normal course of pregnancy. This is why I took up this subject for studying and then sharing whatever my experiences were with all of you. We are all well versed with various references from Kashyap Samhita and other Brihatrayi also regarding the complications and their management. So herewith I will be sharing what causative factor I found out to be the cause for difficulty in pregnancy. Also, I have collected references from other Ayurveda and modern books, and this is what I practice in my day-to-day OPDs and IPDs. So this is what my experience has been. Here you may see a beautiful red rose. That is how world looks at a pregnant lady. She is a full bloom rose or a flower. But if you just see behind the flower, you can see the thorns, the thistles of the rose, which are very prickly and they are very painful. So the rose does not come without the thistles and the prickles. Similarly is pregnancy. There are complications which are associated with pregnancy, and constipation is one of those problems that a woman faces in more or less. These are the references that I have collected from where I have collected and I apply. These are modern papers that I have gone through. Anorectal complications and influence of pregnancy in other diseases also. And these are the online papers which are, the links are given here that I have collected. The Nidan that are commonly present in patients are, as per Vibandha Nidan. See, human body is having common Nidan list, no? So the disease as Vibandha or constipation, the Nidan are also common, as in any human being it can be, like Vedvidarana, Ruksha Anna, Pishta Anna Sevana, Adhyashana, etc. All these Nidan, if the Garbhini is doing all this Nidan Sevan, constipation can occur. So our history should include all these nidana. Garbha itself is considered nidan for Arsha according to Acharya Charaka and Acharya Vagbhat. Both have considered Arsha as one of the nidan for Garbha as one of the nidan for Arsha. So will be constipation also. Naturally, Vata gets alleviated in the 4th and 5th month of pregnancy along with Dohridaya. So Kashyap Khilasthana in 10th chapter, he has said that Vata Vikruti will naturally occur in a pregnant woman. And Adhimamsa Vyadhi, Arsha, is common in 7th month. Again, this is reference from Kashyap Khilasthana. So Adhimamsa in 7th month will occur as Arsha. So Arsha is a holistic approach that may pain or leading to difficulty in defecation. All this should be considered as Arsha. Or symptomatology or Purva Rupa for Arsha, and Vibandha is also one of them. Garbhini Charya, if we see the Paricharya that has been advised to a Garbhini, these are references from various books, commonly from Kashyap Samhita, and it has been said that if starting from the very first month of pregnancy till the 3rd month, that means in the first trimester, palatable liquids or large amount of liquids should be given, which will be Madhur Rasa and Snigdha liquids should be given. And especially the diet should comprise of Dugdha, Grita and Navanita. Okay, these are all Anulomaka, and these all will prevent the problem of constipation, of course, because we all know even in day-to-day life we advise Dugdha to be given to all those high-risk patients. For pregnancy, if you cannot give any laxative, we can always give Dugdha. Also Mansa with or Mansa and Mansa Rasa with Amla Rasa and Lavan Rasa should be given. Amla and Ravan, both ras are considered to be Anulomaka. So, and Sransaka also. So for avoiding constipation, the Paricharya has been designed like that. That okay, there will be some Apana Vayu Vikriti, and we need to already and always take care of Apana Vayu Vikriti in case of Garbhini Paricharya to avoid any complication during pregnancy, in the development or during the partum also. So that is how the design is already present. You can see the reflection of it in the very design. In the 5th month, in the 3rd and the 4th month, Shashti and milk with Dati should be given. So if the Agni has been restored, then Shashti rice, again these rice are easy to digest, Dipana, Pachana, and milk is given for Anulomana. 5th month, Yavagu, Payasa. In 6th month, Grita with rice Yavagu and Gokshura should be given. And in the 7th month, Prithak Parani group of drugs should be given. So if you see along with the milk, so milk is carried forward till the end of the pregnancy, and it's a complete food and for nutrition also, and also it is a mild laxative. In the 8th and the 9th month, if we see, cleaning of retained feces is actually advised by the acharyas. You have to give, we'll see which drugs to be used. We will see further in the presentation what should be done according to Ayurveda. And Vatanulomana with Anuvasana Basti and Niruha Basti is prescribed. So constipation treatment not only by drugs but also alleviation of Vata by the anal route has been prescribed. Meat soup or mamsa rasa and snigdha ahara has to be given for shamana and shodhana of Vali. Harit Samhita, the Ayurvedic treatment has been given by Harita. A common treatment has been given. He said that in pregnancy, Haritaki Nagaram Gudena Va Trifala Kashaya and Shita Strinam Vinihanti Pane Vibandha Vidrati Cha. What you should give is the cold decoction of Trifala mixed with Haritaki, Nagara and Guda should be given to a patient that is a Garbhini which should be given for constipation and also for Vidriti. This is what is given by Harita in the last trimester. He is giving that after the seventh month in the last trimester, all these dravya should be given for alleviation of Vayu and Vidriti also. The Samanya Chikitsa, which has been given in Ayurveda, is in the perspective of Aushadha, Ahara and Vihara. All these should be Mridu, Madhura and Shishira Priya. Okay. So, Erandatai, Vishesha Chikitsa, which has been described and that we are also using, is Erandatai with milk, can be given from the starting of the third trimester. We can start and we can give Erandatai from the third trimester along with milk. Okay. Amla, Lavan and Niruha Basti can be started from 5th month. See, Acharya Sushrut has said it, the Basti should be started only after 7th month. But on the contrary, Acharya Kashyap, who was practicing the art of obstetrics, he has prescribed Lavana Rasa and Amla Rasa Niruha Basti from as early as the 5th month of pregnancy, and Anuvasan Basti with Madhur Rasa Dravya. From the 6th month, Anushastra Chikitsa has been prescribed by Acharya Kashyap, though Acharya Sushruta has said that it should be done only after the 7th month. The Basti, the Anushastra or the Shastra Chikitsa for treatment of any anorectal disease, but Kshara etc. can be used for cleansing of any hard stool or Ashmavad Ghanta if it is happening. So as early as 6th month, Acharya Kashyap has said, and we also find that Matra Basti or Anuvasan Basti of Yashti Madhu Taila, which we are commonly using in our OPD, has tremendously good result. Why particularly Yashti Madhu or Trifla, Kvata and Yashti Madhu Grita along with Madhu Sarpi and Saindav Lavana in Niruha Basti can be used. So Yashti Madhwadi or Yashti Madhu Taila or Yashti Madhu Gruta used for Snehana or Anuvasana Basti and Niruha Basti are found to be very effective in pregnancy induced constipation. So Pane Bhange cha Bastaucha Yashti Madhu is used. Why Yashti Madhu is used, we will see in slides that are further. We all know Glycyrrhiza glabra is steroidal drug. So yes, we all know that common elements of during pregnancy are constipation, hemorrhoid, fistula, nanocriptitis, pruritus, any. In every one in every 3 women, it is such a 30% of women suffer from constipation during pregnancy. What is the link between pregnancy and constipation? If you ask this question, the physiological and hormonal changes and some pre-existing conditions can contribute to constipation during pregnancy. They include like dietary factor, hormonal changes, lifestyle factors and other factors also. Insufficient fluid intake because of nausea, vomiting, these are the dietary factors. Vitamin supplements that are high in iron are also a causative factor for constipation. Now the hormone, variation in the levels of certain hormones as estrogen, naturally occurring hormone produced by the ovaries, and progesterone, a female hormone that prepares the uterus for pregnancy, and slowing down of gastrointestinal motility or the activity is the reason. Now how the progesterone is working. Now progesterone is secreted by the body so that the smooth muscles of the uterus, they start relaxing, they start hypertrophying, and they hyperplasing, and they increase in the size of the uterus. The wall becomes thin and the size of the uterus increases by the relaxation of these muscles. The contraction of the uterine muscles is inhibited by the progesterone. Now, as smooth muscles have similarity of origin, the smooth muscles of the uterus and smooth muscles of the large intestine or the especially the lateral, proximal 2/3 of the transverse colon, the descending colon, the sigmoid colon, and the rectum, because all these smooth muscles are developed as a part of the cloaca in the intrauterine life. They are the part of the hindgut. Okay, so as these developmental original, due to the original, the same muscles or similarity of the origin in the intrauterine life, and also the similarity of the innervation of these muscles, because all these muscles are supplied through the sacral plexus. These are supplied through the sacral plexus for the movement, for the mass peristalsis of either the uterine contraction, or the large intestinal muscles, mass peristalsis for defecation. So as they have similarity, the effect also becomes similar. Okay, so the progesterone not only affects the uterine muscle, it also affects the large intestinal muscles. Also, the small intestinal muscles become weak, or the gastrum muscles become weak, particularly because of the reversing of the gastrocolic reflex. So the relaxation of the muscles throughout GIT occurs, resulting in the slowing down of the digestion. The relaxing of the valves occurs, and the reflux is very common. This gives rise to the constipation. Decreased physical activity and stress, both these are cofactors for production of constipation. Other factors like mechanical obstruction, you can see what is the change that occurs in female abdomen. Okay, what are the changes that occur in female abdomen when there is full term pregnancy, when the uterus is gravid, all the intestines and everything is pushed, the shape changes, there is physical pressure and mechanical obstruction due to the during the pregnancy.
Sorry to disturb you, please compile.
Yes, ma'am. Just last 2 or 3 slides. Thank you for reminding. Other factors like painful hemorrhoids, pre-existing conditions like painful hemorrhoids, or patient is already taking drugs for blood pressure, antidepressant, pain relievers, antacids, or overusing laxatives. Okay, pre-conditions also, or drug abuse can contribute to constipation. To prevent constipation, these are the things which should be done to prevent constipation. Kegel's manure is very good. I am not going what allopathic drugs are used, but as I was telling, the explanation for the use of Yashti Madhu is that Yashti Madhu is also steroidal in origin, while as progesterone and estrogen are also steroidal in origin. So the effect of excessive progesterone or blockage of the nervous, the nervous rays, which the nervine waves which are going, the stimulation are, prohibited by the Yashti Madhu. Prohibited, the one that are prohibited by the progesterone will be activated by the Yashti Madhu. So this is how Pana Abhyanga Basti we should use Yashti Madhu as the drug of choice for laxation in female, and milk also gives you the oestrogen which is digested and assimilated, which will be effective laxative for the relieving of constipation. So cherishing the womanhood, happy Women's Day to everyone, and this is a very good initiative by the lady surgeons, the Varda College also, Mahatma Gandhi Institute, and especially the Sangyaharan department, which is the backbone of any surgical department and development of Ayurveda also. So Sangyaharan department, restoration of the Sangyaharan faculty in the CCIM or the new NCISM should be done, and we should promote collectively from all the each and every corner of India and each and every institute of Ayurveda, because the modern people are already, against the means Ayurveda getting to the front seat of medical system in the in India. So they are doing anything to prohibit us from practicing our fraternity, our science. So Sangya Haran is one of the main, the Adhar Stambha of any surgery. Without Sangya Haran, surgery is impossible. So we should all promote and we should all give our support, and not only support, but we should also with our all personal means also we should reach to the decision makers and policy makers and decision takers that Sangya Haran should be restored, and only then Ayurveda and Shalya Tantra or Shalakya Tantra or PTSR, all these departments which are dependent on Sangya Haran will be will flourish further. Otherwise, again, they will become stagnant. So thank you very much for giving me this opportunity. Thank you one and all.
Thank you very much, ma'am. Thanks for your valuable guidance as Garbhini Paricharya. This is very important and burning problem like constipation in pregnancy. Thank you. Thank you very much. Now, Jai Sheila Goni ma'am, are you here?
Yeah, I'm here.
Are you ready? Okay.
Yes.
Okay, ma'am. We will share
Sorry for
your
the
screen.
inconvenience.
Yes, ma'am. Yes. Okay. Now you can start your session,
Yeah.
ma'am.
Sure. Good morning to all the dignitaries, respected dignitaries, organizers, and co-speakers. I first of all congratulate Dr. Sheetal Madam, Dr. Naveen Joshi Sir for organizing this wonderful opportunity and wonderful session on the occasion of International Women's Day. And with the blessings of Dr. Pandey Sir, I have done a small research work, it's a survey research work, which will be very useful for all the surgeons, what I felt. And this is an opportunity in this platform to support the mission's Sangya Haran restoration. I am presenting this. Sangya Haran is is a part of Ayurveda earlier, and we used to do post-graduation, PhD, as well as some diploma courses also. So I have collected all the research areas and wherever they have done a research and all. And this is a small presentation. The aim of this presentation is to know the trend and the pattern of research in Ayurveda. Next. Research in Ayurveda, especially throughout India, this Sangya Haran, what all the researches have been done. And next, madam. Next slide.
Is Shivam.
Thank you. Yeah, next. Yeah. If you see the Sangya Haran research, primarily it has started in Department of Shalya Shalyakya under the dynamic leadership of late Dr. S.P. Pandey at Banaras Hindu University. 1st August 1989, CCM had started a new specialty, especially in Sangya Haran department as a PG course for 3 years at BHU, considering the importance of this subject in Shalya Tantra. And if you see that 16th August 2011, they have started a new PG diploma course also in BHU. And at the same time, in 2011, again, they have notified as a, exclusively as a department of Sangya Haran, and it got notified in Banaras Hindu University. Next. If you see the different colleges, there are different colleges which offer these courses. First, as all we know that Banaras Hindu University and Tilak Ayurveda Mahavidyalaya, LRB Patil Ayurvedic Medical College, that also they offered in Islampur, Maharashtra, and Yeshwant Ayurvedic Medical College. There also I have seen some research work. They have started this PG also. And Sri Anna Sahib Dange Ayurvedic Astha and late Kedari Redekar Ayurvedic Mahavidyalaya. These are the few institutions with the resources what I collected, and I may have missed also, I don't know, but still I tried my level best in contacting all the concerned persons, and I got this is the places and the institutions, and from 1975 to 2017 it was there. If you see, especially in Banaras Hindu University, a total of about 81 research theses submitted. I think we all should know that. We are aware of it, but we don't know that how many research theses have been submitted, how many postdoctoral research have been done. So I observed that 16 PhD postdoctoral research have been submitted, and next slide please. 54 postgraduate research work and 11 PG diploma thesis, what we can see. And there are many areas they have done this research. I have seen that media drug they have tried, and post-operative pain management, in that area they have done some research work. Palliative care also, a lot of the research have been done, and as well as the pain management. The next please, next slide please. Next slide please. See, so wonderfully, you can now, not next, the previous one. Yeah, see, I think this slide itself shows that how much work has been done in Banaras Hindu University. See, what I observed is I have collected all the thesis name, title. I have collected the person who has done that thesis, and under which guidance they have done, and which year also they have done. This is what I came through, and these are all the researchers which got submitted. Okay, so these are the 44 post-operative pain management I observed, management of pre-operative anxiety, 14 researchers, and indigenous drug as an adjuvant in anesthesia, 13 researchers, anesthesia in relation to Deha Prakriti, 10 researchers, as an adjuvant in carcinoma, 9, and as indigenous drug, I observed 9, and antiemetics in pre-operative management, 7. So these are all the few major I'm mentioning, but there are so many drugs are tried in that: Shigru, Ashwagandha, Medya Dravyas, and very surprisingly, I observed that even Marma Chikitsa also they have tried in this Sanyaharana, and Sandhivata they have tried, headache they have tried, post-dural procedural headache they have tried, and if you observe, these are all the next slide. These are all the few works what I observed in Banaras Hindu University, and because we are doing at our place all the things, but we are not aware what is happening in the other universities and other research centers, and especially in Sanyaharana, we wanted to revive it and we want to restore it. We should understand that how it is important, how it has contributed, and how extensively they have done the research, and still there is a lot of scope is there to do and implement in our science. And in KLE Society, BMK Ayurveda Mahavidyalaya Belgaum, I observed that a total of 8 research theses got submitted, especially in 2014 to 2018, and 4 research theses in post-operative pain management, 1 research thesis in management of pre-operative anxiety, 1 in area of obstruction, area of observation in post-dural puncture headache. So these are all the few research work what I observed in KLE. And if you go to the Tilak Ayurveda Mahavidyalaya, next please, Tilak Ayurveda Mahavidyalaya, there are total 12 research theses they have submitted. Next please. 12 research theses they have submitted. Yeah. During this 24, Tilak Ayurveda Mahavidyalaya, they submitted around 12 research theses. In that, 4 research theses post-operative pain management, 2 research theses in antiemetics, in pre-operative management, 2 research theses in management of pre-operative anxiety, and 1 research in area of hypotension due to spinal anesthesia, and 3 in as a pre-medicant in Sanyaharan. So in this way, Tilak Ayurveda Mahavidyalaya has contributed. Next, please. This is LRP Ayurveda Medical College and Research Center. Especially they have submitted in that the 12 research thesis I have observed in that 1 research thesis carried out in the area of post-operative management of nausea and vomiting, 4 researches in the area of post-operative pain management, and 6 researchers in the area of preoperative anxiety, and 1 in research of posterior procedural headache. Next, please. See, if you observe all these, one thing is very sure that they have tried their level best in identifying the scope of the research, and they have tried their level best in doing some solution for it. And if you see how this Shri Anna Sahib Dange Ayurveda Mahavidyalaya, there I found 15 research theses they have submitted in 2014 to 2017. And in that, 8 research theses in post-operative pain management, and 2 research theses in antiemetics, and 5 research theses in the management of operative anxiety. So especially this operative anxiety and this antiemetics as a post-operative pain management, a lot of researches has been done. Next, please. Okay, this is late Kedari Redekar College, wherein I found in between 2015 to 2017, total 8 research theses they have submitted, and in that 6 research theses they have done on post-operative pain management. So if you observe, most of the theses were in the area of research of post-operative pain management. Next, please. So conclusion, what I am trying to tell is, especially not only identifying the research areas, it also helps to use it. And this department is very essential for all the surgeons. And this presentation will definitely help the teacher as well as any researcher also to show some inclination and motivate and participate in this task of restoration of Sannyarana department in Ayurveda. And I think this is a great opportunity, what I got through Sheetal Madam, and to share my thoughts on this special day of International Women's Day. And I once again thank D.N. Pandey sir, Dr. Varshney sir, and Dr. Naveen Joshi sir for this opportunity. Thank you so much, Dr. Sheetal Madam. Thank you.
Thank you. Thank you very much, ma'am, for your overview of the researchers at various universities. This will definitely help in the selection of research projects to us coming students. Thank you very much, ma'am. Now, our next speaker is Dr. Amrita Mishram, ma'am. Madam is head of the department of PTSR at R.A. Poddar Government Ayurvedic College, Mumbai, Maharashtra. She's BMS and she's a gold medalist for highest marks throughout her BMS curriculum. She's a winner of Jivak Award, which she received at Thailand. She is winner of other prizes also, including Vaidya Hirurikar Prize. She is also awarded by Nagar Vaidya Sabha for being youngest Vaidya. She has presented many papers at national and international level. She is an Ayush trainer for maternal and child care health. She has delivered many guest lectures and chaired many sessions. She has conducted and participated in many health camps. She has awarded by fellowship from Philadelphia in medical education and research, and so on. Her topic of presentation for today is a practical insight into effective Ayurvedic management of gynecological and obstetrical disorder and evidence-based approach. So over to you, ma'am. I request you to start your presentation.
Yes.
Amrita Mishram, ma'am. Yes, ma'am. You're clearly audible. To share your screen.
Yeah.
Ma'am, you are co-host now. You can just share your screen.
Yeah, just a minute, ma'am.
Yes, yes.
Is my screen visible, ma'am?
Ma'am, your PPT is not visible.
Still not visible?
Yes, ma'am, it is not visible.
Just a minute. Just a minute. I think there is some issue. Is it visible now, ma'am?
No, ma'am.
Still not visible?
Yes.
Madam, actually, I've already started my screen sharing.
But ma'am, we are not able to see your screen, ma'am.
There is. I'm on the right side. There is a small thing which will tell you share your screen, because
Yeah,
sometimes you can see your screen, but the others cannot see. I've already started, ma'am, actually.
Yes, ma'am.
Is it visible now?
Yes, yes. We can see your mobile or your screen.
Okay.
Yes, now it will be able to.
Okay, ma'am.
Yes, yes. Yes.
Is it visible now?
Yes, we can see your files.
Okay. Started now?
Yes, 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 yes. Clear, ma'am. Perfect.
Yeah. Okay.
Yes.
Thank you so much. So sorry for the delay. I think it is a technical delay. At the outset, I would like to thank Ayush Darpan for giving me this opportunity to speak on this prestigious platform. And firstly, it is said that Guru Gobind do khade, kaake lago paye, balihari Guru aapne, Gobind dio dikhaye. So with these words, I would like to pay my humble gratitude towards my Guru, my mentor, Dr. Vashne sir, who has been a constant source of inspiration and guidance for me. And also Pandey sir, Sheetal madam, every one of you, thanking you from the bottom of my heart. So I think the theme of Women's Day, at the outset, firstly, I would like to wish each one of you a very happy Women's Day in advance, because it is tomorrow. And the theme for today is very apt with the theme of this year's Women's Day theme, which is gender equality today for a sustainable tomorrow. So I think this is very suitable for this year's theme. Coming to my topic, it's the practical insight into effective Ayurvedic management of gynecological and obstetric disorders. So firstly, we all know that Ayurveda is divided into Ashtanga, that is 8 parts, and Kaumara Bhritya is the one which is included amongst one of the 8 branches of Ayurveda. The basic reason why Ayurveda, why the Acharyas have mentioned Prasuti Tantra and Stri Rog in the pretext of Kaumara Bhritya is basically that even in the good old times, the emphasis at that point of time was on getting healthy progeny. And this, I think, prevails till today. We are all focusing on healthy apatya, Susanskrit apatya, Supraja. So this has become, I would say, apt even more in the present times. So that is why Prasuti Tantra Stri Rog is mentioned under Kaumar Bhritya. So with this, we can say that the basic objective of women health is to get a healthy progeny. That is primarily the reason that different headings under Prasuti Tantra and Stri Rog have been mentioned by Acharyas in the various age groups of women life. So as we all know that whatever treatment, whatever ailments are there in the women or even in any body, whether it is male or female, the basic objective of Ayurveda remains to prevent the diseases. And even after following all the dincharyas, ritucharyas and the procedures that I mentioned, if there is ailment, then comes into need of treatment. So this is the basis of my presentation, wherein it is said that swasthasya swastharakshanam and aturasya vikara parimoksha. So in this pretext, we are focusing on vyadhi parimoksha, but still the emphasis should always remain on swasthasya swastharakshanam. So there is a spelling mistake, it is tridosha. So all the treatment modalities available in Ayurveda, be it surgery, be it medicine, be it any form of therapy, revolves around these basic principles. So even in Prasuti Tantra Sri Rog, the treatment protocol that we follow is not other than the principles of Ayurveda. We are always sticking to the principles of Ayurveda, whether we are doing it medicinally or whether we are doing it according to surgery. So it is Samanya Vishesh Siddhant, Shatkriya Kal, Panchabhautik Siddhanta, and in context of Prakriti. When I say that there are different treatment modalities available and we as surgeons are focusing on Shalya Chikitsa today, I believe, and when I would say this, I think most of you would agree that what we as clinicians believe that as far as possible, we should aim at non-invasive mode of therapy. If this non-invasive mode doesn't work, then we shift to the invasive mode, that is the Shalya Chikitsa. So in this pretext, although we are practicing here in M.A. Poddar Hospital, we are doing all sorts of surgeries which are permissible to us in the form of cesarean sections with its complications, hysterectomies, be it vaginal, be it abdominal, for various reasons like uterine fibroids and DUBs and everything, and minor surgeries like cervical encerclages, polypectomy. We are doing all this, but the basic focus of us still remains prevention of surgeries, that is following non-invasive therapies. And I'm happy to share that we are very much successful in avoiding surgeries to a great extent. And this is what forms the basis of my presentation today. I'll be sharing some of our success stories, and I would be happy if my experiences would be helpful to you, and if you would be following these, and it will be beneficial to large number of patients. So that is the reason why I chose this topic, so as to share my work, so as to make it useful to more and more number of people. So the first case that I would be presenting is the case of polycystic ovarian disease. We all know that this has become a very, very relevant and highly spreading disease. So the reason we all know it is pertaining to the lifestyles, which leads to hormonal imbalances and many other things. So the complaints that patient comes to us is irregular menses and other signs, be it acanthosis nigrans, hirsutism, weight gain and everything. So these complaints patient comes to us, and in modern medicine, the treatment or the answer is in the form of some hormones, the lifestyle changes, and at the most they do ovarian drilling, which is also not 100% guaranteed, because even after ovarian drilling, there are chances of recurrence. So what we do in our setup is, obviously we go for a screening, Ayurvedic screening in the form of history taking, all the parikshan and prakriti parikshan, and then in this particular patient, we had to give withdrawal because it was a long-standing amenorrhea. So we gave a withdrawal to the patient and then shifted the patient to the Ayurvedic therapy in the form of Sahaja Tel Matra Basti for 8 days. With this therapy, we gave this therapy for 3 months along with some oral medicines that you can see. And the results were very encouraging, wherein we could see the length of the cycle was decreased, which was extending to around even 6 months. It was coming regularly, menses were regular, and the volume of the ovaries, which was more before the therapy, had become pretty reduced. You can see the sonography. These are the case papers of the patient, wherein you can see the therapy, what we had given, the Sahajar Tel Basti therapy, the regimen which was followed by 3 months, and then there was reduction in the ovarian volume in this patient. Second patient is the hemorrhagic ovarian cyst, which we see in day-to-day practices. And mostly these patients are subjected to surgeries many a times because there is always a risk of other complications which are rather more severe. So we have treated these patients. This is a patient which came to us having the complaints of loss of appetite, and she had gone for a sonography wherein she accidentally detected ovarian cyst, and then she had some other associated symptoms also, and it was a painful menses. But after that, we followed the Yoga Basti Kram in the form of Niruha Basti Kuruchi Nimba and Manjishtha Khadirkwad and Anuvasan Basti Sahachar Tel. with these oral therapies, and again the results were very encouraging. This is reduction in the size. This is again the same therapy that we had followed for 3 months. The third case is the simple ovarian cyst. Although this may not always require treatment, but if it presents with the symptoms of amenorrhea, irregular menses, and other things, then definitely we need to intervene. Hence, we intervened in this patient by giving Ayurvedic therapy in the form of Kanchanar Gugul, which was the main drug which we had used. And again, the results were very encouraging in the form of reduction in the size of the cyst. This is again a topic of thesis of one of our PG scholars also. So this is the sonography report, which reveals reduction in the size after therapy. Heavy menstrual bleeding in various causes we are dealing very successfully. Even it would be a large claim rather when I say that even the size of the fibroid is reduced, but the condition is that if the size of the fibroid is very small and it is that the patient comes to us and we treat the patient with heavy menstrual bleeding and other supportive therapy, yes, along with the endometrial thickness reduction and along with the results pertaining to the reduction in the heavy menstrual flow, there is marginal reduction in the size of the fibroid as well. Yes, it is true. You can treat the patient, and the therapy that we are giving, I cannot say that it was a large size fibroid and with the therapy it vanished. That it is not that way, but yes, the clinical sign symptoms have definitely reduced in most of the patients in this patient. So we could avoid hysterectomy in this patient. So heavy menstrual bleeding, the treatment that we had given to this patient was in the form of Khadir Churna and Tandulodak for 1 month. And the patient was giving a very regular follow-up. And this was given for 3 months. And again, the patient regained her normal menses and the normal menstrual flow was regained in this patient. Even we have been giving other drugs such as Lodra and Jaharmora combinations in the patients with heavy menstrual bleeding, and the endometrial thickness is remarkably reduced in such patients. So this is the case paper of the patient that I was talking. Yeah, this is a marked reduction in the endometrial thickness also. With the shortage of time, I'm limiting my cases. Otherwise, there are many other cases as well. Again, this is another case of heavy menstrual bleeding. And she had heavy menses for 3 to 4 months, polymenorrhea, abdominal pain, and other symptoms. You can see hyperacidity and headache also. Why I've mentioned these associated symptoms? Because with the therapy, these associated symptoms had also markedly reduced. So after therapy of Bhunimbadikwat, Kamdudharas, Khadir Churna with Tandulodak and Trivrut Tavleha, these symptoms had reduced and we could regularize the menses of the patient, and endometrial thickness, which was before, as you can see, 10 millimeter, had reduced to 6 millimeter. Heavy menstrual, this is the same patient. Now there was a new case wherein the patient was not lactating, but still she had complained of breast secretions. Even though she was a non-Paris woman, she was like having continuous secretions from the breast. So it was very uncomfortable and she came down to us and we treated her. I would like you to share this combination. It has worked wonders with us. Darvi, Jambu, Manjishtha, Amra Bija Majja, Amal Ki Churna. And this was 500 milligram with Shunthi Churna and lukewarm water along with Khadiradi Vati and Nyagrodadi Kwad. And with this therapy, even the patient had taken this therapy for 1 month, but she had started noticing the difference in 15 days itself. And at present, the patient has no breast secretions. Without using any other mode of therapy, we had successfully treated this patient. There are also cases of, this is asthenospermia, but before that, there are also cases of fibroadenoma, which we have treated using Kanchanar Gugur and local Dashanga Lep application and Lep Gori, which is readily available as local application. And we are getting very good results in primary stages of fibroadenoma. Asthenospermia, most of the cases of infertility having a semen analysis abnormal, we have treated successfully using Pushpadhanvaras, Narsingha Rasayan, and pranayam and other mind relaxing techniques. So the sperm motility, which was below normal range, had come to the normal range in this patient. This is the relevance and this is the context that I was talking of. asthenospermia, there were 2 cases. So thank you. Once again, I would like to thank each one of you for being patiently listening to my presentation. All those who have joined online, Facebook, and various other platforms. Again, a heartfelt thank you to Ayu Darpan, Sheetal Madam, Vashne Sir, Pandey Sir, and everyone. Thank you very much.
Thank you very much, ma'am. Hats off to your remarkable work, ma'am. Your skillful techniques and inspirational pioneer work are always best part to hear. I hope this valuable knowledge will definitely helpful to all the students and academicians. Thank you. Thank you very much, ma'am. Now, moving forward. We are having Dr. Pradnya Dakhore, ma'am. Pradnya, ma'am, are you here? Ma'am? Yes. Pradnya Dakhore, ma'am, she is Associate Professor at K.R. Pandav Ayurved College, Nagpur. She is having 15 years of teaching experience. She is currently doing her PhD in Shalyatantra at Meghe Institute, Wardha. She has written over 15 articles in national and international journals. She has participated in many national and international conferences. She has conducted and participated in many diagnostic and surgical camps. Now we will start her presentation. Yes, Shivam. Shivam, are you here? We are not getting voice. हाँ हो गया मैम।
It is audible.
On such an auspicious day. So, and also I'm very, very thankful to Dr. Sheetala Savarkar.
Voice is quite a little bit low.
Giving me this opportunity to be a part of this event. So today I will be
It is audible, but voice is a bit low.
Practical training. By,
And the screen is shared.
No, no, no.
Please share.
We are not able to.
Okay.
Chapter in Sthan of Sushruta Samhita, and here he has explained that how one can enhance the skills regarding the Ashtavid Shastra Karmas. Because surgery is the subject of skills, and without skills you cannot perform it on the patients. So I would like to share my screen. Yes, I hope it is visible to all. So, yoga is a surgical training as per Ayurveda. And the importance of yoga is because you see, Ayurveda has described minutest detail. Though it is an ancient science of life, it has taken care of each and every minutest aspect regarding treatment, whether it is medicinal or surgical. So when we enter the medical school for the first time, so in the first year we have to study dissection, that is Shavachedan, for the to study the normal anatomy of human body. Likewise, when we go in second year, third year, or when we start learning the clinical subjects, we have to understand the theory as well as we have to achieve the practical skills. So a surgeon has to be ubhayagnya, means he should have theoretical as well as practical knowledge. So yoga is a practical training which is essential to achieve the confidence and skill to treat the patients. To achieve the expertise in Snehadishu Karma and Ashtavid Shastra Karma, Sushrutacharya has described various materials similar to the part on which that particular procedure can be applied. Chedan Shastra Karma. We will start the Ashtavid Shastra Karma, which Sushrutacharya has described. So Chedan Shastra Karma, which is surgical excision. So it has been said that Pushpafal Alabu Kalindak Trapuso Sorvaruka Karkaruk Pravrutishu Chedya Visheshana Darshet Utkarta Napakartanani Chopadishet, means it is a method to excise or remove a damaged part by using surgical knife like Mandalagra Shastra, circular knife, Vriddhi Patra, that is scalpel, or a Karapatra, that is bone saw. For this method, different objects like bottle gourd, pumpkin, cucumber, watermelon, etc. are used by Acharya Sushruta. Different excision techniques like Utkartan, Apakartan must be practiced on these items. So while practicing on these items, a person can understand how much pressure is to be applied to excise the organ, or how much pressure should be applied while treating the patient. So these are few materials or objects which Sushrutacharya has described for this purpose, that is bottle gourd, pumpkin and cucumber. And in this way, after practicing, we can apply it in the patients, on the patients. Second is Bhedan Shastra Karma. In Bhedan Shastra Karma, it is said, Druti, Basti, Praseva, Prabhuti, Shudak, Panka Purneshu, Bhedya Yogyam. Bhedan is related with incision, but it is the incision is taken on a part under which there is a cavity. So it is a method to reveal the hidden contents and to expose the structures by using Ardhadhara, single-edged knife, Vriddhipatra, scalpel, etc. For example, proper incision and exploration is useful to treat a case of Pakva Vidradi, that is abscess. So to learn this procedure, incision should be practiced on an earthen pot or urinary bladder of dead animal or a leather bag full of water and mud. Whenever a medical student tends to practice incision over this object, he will feel the exact pressure which is necessary to incise and examine a cavity. So these are few objects which Sushrutaracharya has described, like a leather bag filled with mud and water. It can be used, or a urinary bladder can also be used. So and this is the here on abscess, incision and drainage is being conducted. Lekhan karma or scrapping. So in Lekhan karma, it is said saromni charmanyatate lekhyasya, means scrapping is helpful to remove unwanted tissues like hypergranulations, epithelialized tissues, sequestrum, etc. And it should be performed in anulom direction, means the direction of hairs, in the direction of the hairs on the part of the hairy skin, for clinical experience. So it is very small surgical method, but care should be taken to avoid injury to surrounding structures. So in practice, we can see Lekhan karma or scrapping in corneal scrapping. So this is the skin, hairy skin or Romyukta charma, which Sushrutaracharya has described for the purpose of Lekhan karma. Vyadhan karma or puncturing. Mruta pashu sira sutpalanaleshu cha vedhyasya. This method is used to perforate the superficial veins, epithelial surface, etc. A very fine hand is necessary for this method. So to gain mastery in this method, it should be practiced on the lotus stalks, that is kamal nal, which are smooth and spongy in nature, or on veins of dead animals. So in practice, see here, the Sushrutaracharya has described the objects like kamal nal or mruta pashu sira. And it can be implemented in venipuncture or lumbar puncture and even in Siraved. Ashana karma or probing. Gunopahat kashtha venu nala nali shushka alabu mukheshveshyasya. This method should be practiced on bamboos, hollow bark which is damaged by moths, and opening of dried gourd. Those objects having various holes and passages through which a probe can be passed without any blockage. By this method, new scholars can develop clinical skill to assess the cavities in humans and pathway of sinuses. So this probing, it is also used to measure the depth, length, and direction of wound or sinus, and it is also used to open the blockages. So in practical purpose, we use it in fistula in ano, and it is also used to open the blocked tear duct. So here these are the articles which Sushrutaracharya has described, like Shushka Kashtha, Shushka Labu, and probing. If this probing is done in the fistula in ano. Next is Aharan karma or extraction. So Panasabimbi Bilva Falamajja Mruta Pashudante Aharyasya means taking away or removal of a foreign body by extraction technique is called Aharan karma. This technique can be applied on fruits having seeds like pulp of bilva, jackfruit, or the tooth of dead animal. This technique is useful to remove the foreign body which is impacted, like ficholith, stone, etc. in surgical practice. So these are the fruits, funnels, that is jackfruit or bimbi, and dead animals, extraction of a tooth of a dead animal also helps in enhancing our skin. Visravan or drainage. Madhuchistopalipte shalmali falake visravasya. This technique is used to eliminate the abnormal collection of fluids in body cavities and to reveal the vitiation of blood, that is vitiated rakta dosha. This procedure should be applied on a part of shalmali wound covered with beeswax. The reason behind the selection of beeswax for this procedure being its softness, and to incise this gives the same feeling as of skin incision. Also, there are a lot of fluid substances in bark of shalmali wood which comes out after incision. This method is applicable to remove the fluids from any cavity, example abdominal paracentesis, ascites, thoracocentesis, etc. So this is the figure how Vistravana is carried out. Then Sivan or Suchari. Sukshma ghana vastrantayor mrudu charmantayoscha sivyasya. This technique is holding of cut edges of wound together, which are produced by operative or non-operative process. Anatomical approximation of margins has first importance in surgical practice. This method should be applied on the edges of smooth leather and on the edges of cloth. Various types of sutures like continuous, interrupted, blanket sutures can be practiced on these materials. Nowadays, we have mannequins to practice it. Here we can see a banana is used for the purpose of practicing suturing. Then there is a model and there is a mannequin as well. So nowadays, mannequins are easily available and one can practice on it. Then bandhan karma, bandaging techniques. Pustame purusho anga pratyanga vishesheshu bandhana yogyam. Acharya Sushruta has mentioned 14 bandhanas in Sushrut Samhita according to the nature of disease and season. A proper bandhana supports for advanced healing of lacerated or crushed wound and also to maintain the normal position of the affected part in dislocation or fracture. So that wounded person can be able to walk and sit comfortably and sleep well. The medical practitioners who wants to learn bandhana should apply this procedure on various parts of the dummies prepared of clothes. So here various bandages we can see, and a pustame purush or a mannequin can also be used for this purpose. Kshara and Agni Karma. Mrudu Mons Khandeshva Agni Kshara Yogyam. Kshara and Agni Karma are one of the most important parasurgical tools mentioned in Ayurveda. One who wants to become expert in Agni Karma, that is thermal cautery, and Kshara Karma, that is alkaline therapy or caustic therapy, should apply this procedure on similar models like a soft muscle part, because the signs can be seen better in piece of flesh. Efficiency is needed while applying Kshara and Agni Karma. Hence, one should observe the changes in the color of piece of flesh and check the time required for it so that it can be applied on the patients without hurting the normal tissues. Karna Sandhi Bandhana. Mrudu Charma Mons Peshishu Pal Naleshu Cha Karna Sandhi Bandhan Yogyam. Acharya Sushruta mentioned about Karna Sandhi Bandhan. For practice purpose, he advised soft skin, muscles, and hollow stalk of lily plant for fabricating the ear, reconstructing the severed ear, and bandaging. So these are the items. Here the ear reconstruction can be seen. Then some miscellaneous procedures have been described. उदकपूर्ण घट पार्श्व स्त्रोतस्य अलाभु मुखादिषु च नेत्र प्रणिधान बस्ति व्रण बस्ति पीडन योग्यामिति. Same as to become expert in other miscellaneous techniques like basti karma, vrana prakshalana, new scholars should apply this procedure on the side hole of an earthen pot filled with water or on the mouth of the gourd. So here we can see basti pranidhan and can be carried out by using these items. These are the older things which were used, and today we use readily available these materials for this process. Evam adishu medhavi yogyarheshu yathavidhi dravyeshu yogyam kurvano na pramuhyati karmasu. According to Acharya Sushruta, though a practitioner has fully understood all surgical parameters theoretically, but he cannot be competent without yogya. He will be failed to conduct surgical methods in human. To solve this problem and to acquire knowledge as a surgical scholar, he has explained and demonstrated yogya vidhi in detail. Tasmat kaushalam anvichan shastra ksharagni karmasu yasya yatreha sadharnya tatra yogyam samacharet. Sushruta has clearly explained that an intelligent practitioner can select other suitable objects to gain accurate and precise knowledge in particular method, that is Shastra Karma, Kshara Karma, and Agni Karma. So, take-home messages. Yogya Sutriya Adhyaya is an introductory brainstorming chapter emphasizing new surgical practitioners to grow their surgical capability in a safe and regulated atmosphere. This ancient precious concept of experimental training has been included in present medical education and recommended to gain basic surgical skills outside the operating environment prior to applying techniques on live patients. Various dummies, models, etc. are being used as teaching and learning tools. Thank you for your patient listening. I have an appeal to make. Since anesthesia is one of the important aspects which is related to surgery, so it is my appeal that the post-graduation in Sangyaharan should be implemented again. Thank you for your patient listening. Thank you so much.
Thank you. Thank you very much, ma'am. By following the yoga techniques, a scholar can definitely develop his or her surgical skill in very safe and regulated environment. Very thankful to you, ma'am. Now for further session, I will hand over the mic to Dr. Kiran Mandekar, ma'am. Dr. Kiran Mandekar, ma'am.
Thank you, ma'am.
Yes.
Yeah. I welcome you, Dr. Vinita Tyagi, ma'am. She is a professor and HOD, Department of Shalya Tantra, SKD Government Ayurved College and Hospital, Muzaffarnagar, India. She is having a past experience of overall 20 years in teaching and practice. She passed her MS Shalya Tantra from Shri Ayurvedic College and Hospital, Nagpur in 1997. Her topic of presentation is a physiological study of adharaniya vega with concept in extent of disease manifestation and treatment. I request you, ma'am, to please start your presentation.
Thanks, everyone. I really want to congratulate Dr. Sheetal Asudkar, ma'am, and Dr. Naveen Joshi, sir, for such a good program conduction. Is my screen is available?
Yeah, yes, ma'am. Your screen is visible, ma'am. Yeah.
Okay, it's now visible. Okay, thank you. So, not getting much into other things, I will start my topic. My topic is, as everybody knows, a physiological study of the Adharaniya Veg with concept in extent of disease manifestation and the treatment. As we all know, we are Ayurveda is the science of life, and our body works in a manner that is called as the biorhythm, and what it is really very much important for the healthy functioning. Our body would work in a rhythm. Okay? And we know, as we all know, with the help of its internal clock, our body, it's made up of a biorhythm, and it has an internal clock. And with this clock, it perfectly gives us some natural urges, and these urges are known as the Veg. Okay? And the Veg is a fundamental and the important concept of the Ayurveda. What is the importance to learn the? We need to learn the Vegs. Veg is.
Excuse me, ma'am.
Hello.
Ma'am, your slide is not visible.
Okay.
Ma'am, start your slide sharing.
Slide is not sharing?
Yeah, no, right now it is not.
Your screen is visible, but slide is not sharing.
Slide is not visible here.
It's just a minute. Give me time. Now?
No, ma'am.
I have sent it to Dr. Sheetal. Anyone can?
Yes, ma'am. Yes.
From there?
I coordinate, ma'am.
Just wait, madam.
Now? Now?
No, ma'am.
मैडम ओपन कीजिए उसको, पहले ओपन कीजिए
मैम।
स्क्रीन शेयरिंग के पहले ओपन कीजिए मैम उसको, तो वो ऑप्शन आ जाएगा।
It's showing your screen share. It's showing.
उसका वो जो मेन फाइल है ना मैम, उसको ओपन कीजिए। Just wait, ma'am. हम लोग
Yes, ma'am. Now
Now
it is
visible?
visible. Yeah, yeah, it is visible now.
Okay, okay. So what our aim to study the now we'll start with the हमारा क्या उद्देश्य, हम क्यों इसको देखना चाहते हैं? Because this information is often we all see when we take the history taking, we often miss this information. Is the patient is having this habit of controlling the suppressing of the vega? This we always miss. So this is really important to give focused to be focused on this topic. Okay. Next. That's not moving ahead.
Slide
There
is.
are-
Yes, ma'am.
As we all know, Ayurveda has given focused on ahar and the vihar. We are very much aware about the ahar, but definitely the vihar comes under the neglect part. We never think of the vihara, and this ritucharya, dincharya, satyavat, pathya, patta, this all comes under the vihar, and these vihar comes under the non-pharmacological treatment, non-pharmacological treatment for all these things, for the diseases. Next. Okay. Now what is Veg? As we all know, the Veg means the natural urges, and जो आधारणीय वेग है वो 13 बताए हुए हैं. I have to move fast. Okay. Now come to this. This is now my point of focus is this mainly. First is this is the आधारणीय वेग, and my point of focus is this. क्या ये जो मूत्र वेग है इससे क्या होता है? See, if we are suppressing we have the habit. These are the Mutra Veg, Purish Veg, Shukra Veg, Apana Vayu, Sardi Veg, Shabdu Veg, Udgar Veg, Shambha Veg, and Shudha Veg, Vipasa Veg, Vasho Veg, Nidra Veg, Shramjanya, Nishwas, and 14th one told by the Pagmat, that is the Kas Veg. Here, as we all know, we have a habit. Examples, we suppress the urge of Shavatu when we are in a meeting. What? We suppress the Veg of Shudha when we are doing the work. Suppress the urge to pass while we are watching a favorite movie or a serial, or while we are traveling. We even suppress the urge of defecating when we are traveling. Okay, and even these natural urges, when we suppress, it gives long-term duration. If we are suppressing it again and again and again and again, then it may give the changes in the cardiovascular system, respiratory systems, alimentary canal, urinary systems, and even the nervous system. Now come to the Mutra Vega. I just want to focus on the things. If we go through the single slide, everything is different. We are running short of time, so we can't discuss each and every symptom in detail. So I will only give the summary of these symptoms. Actually, what is happening in this? I will go through these all symptoms. The main Mutra Veg, if we suppress the Mutra Veg, what it's creating? It's congestion. It's creating congestion. It's creating the retrograde pressure, and this due to this retrograde pressure and the congestion, we are getting the pain, Mutrakrach, Shirorija. These all symptoms we are finding the particular patient. Then come to the Purish Veg. Again, we are suppressing the Purish Veg. What we are doing? जो वात का जो main course है, उस वात के main course को we are suppressing, we are holding. That means वात is now normal course पे नहीं चल रहा है, normal course पे नहीं चल रहा है. That means it is in the retrograding, and retrograding होने की वजह से, retrograde होने की वजह से, it causing the symptoms, and in the long duration it will cause the diseases. अगर long duration तक हम उसको suppress किया तो वो diseases करेगा. Now come to the Purish Veg. अगर हम Purish Veg को रोकेंगे तो then it may cause the आटोप, शूल, परिकर्तन. Definitely Purish और संघ, इनका संघ हो जाएगा, और toxins will absorb in the gut, and the toxin will absorb. If there is a ileocecal wall incompetency, then incompetency तो होगा, तो it will come to the mouth. That is will comes as the mukh se mal pravritti. Then next is a urge of the semen. If anyone controls this, it will cause the congestion. ठीक है, congestion होगा, and the congestion will cause the inflammatory pain and the discomfort. Again, this will come to the discomfort. Then next is apan vayu. Apan vayu तो it's called the lots of उदावर्त. उदावर्त बताया हुआ, इसमें क्या होगा? See, if we control apan vayu, it will comes out of the mouth. It may come out of the mouth. Come out of the mouth, it may irritate the nasal mucosa, and it will cause a pratishaya, and which will cause the vidamutmata sangha. आदमान होगा, पेट की फुलावट होगी, distension होगा, then it will cause the shira shula because of the retrograde vayu pravritti. Then come to the next is the chardi way. The main, if you vomiting is a natural phenomena to get rid of the you can say toxins or the wrong things which are getting collected in the guts, animal kadan. If we hold this, the toxins will reabsorb, and mainly the skin rashes, skin problems, relapse, this will appear. Okay, next, come to the next. Next is a shavatu way. See, when we hold the sneezing, it will create a great pressure around the eardrum or around the mouth, and will this, we are holding a pressure will increase, and it will may cause trauma to the ear barotrauma ho sakta hai, that may call the brain hemorrhage, and this brain hemorrhage, it may call the ardit, it may cause the ardhavabhedak, and if there is a eardrum trauma, then there will be the indriya daurbalya. It will going to cause the indriya daurbalya. Okay, and due to the acute suppression, acute and एकदम अचानक से हमने इसको suppress किया, तो it may cause the manyastambh, skin. The next is the udgar wave. Definitely udgar, if you suppress the udgar, means upper जो है वो निकल रहा है वायु और वो नहीं निकल पा रहा है, it cause the irritation of the diaphragm, it may cause the irritation of the diaphragm, and this will result in the hika and the shwas. And there is a hriday urrasa, something feeling like there is a feeling like a heart is, it's a, you can say जकड़ाहट जो heart में होती है वो feeling की उसको आएगी patient को. So all because of the diaphragm irritation. So because of the, then come to the jrambha. Whenever we yawn, we all know the eustachian tubes are open, but when we are suppressing the jrambha, that means eustachian tube will be blocked. The eustachian tube will block, and it will create a pressure, and will create a pressure. It may cause tear in the eardrums. It may cause the tear in the areas. So it will give to the if there is a problem in the eardrum, that will be problem, may cause the convulsions. I mean to say convulsions due to the ear fluid convulsions. It may cause the barotrauma, ear barotrauma, and may cause the nasal bleeding, and there may be the eardrum injuries. All these all sorts, I'm not telling you about the treatment because it will take a long time. Then I come to the Shuddha Veg. As we all know, if we control the Shuddha Veg, means if we avoid the eat on the time, it may cause the ulcer, it may cause the hypoglycemia, it may cause the hypocalcemia, and all because of this there will be the karsha, daurbalya, vavarnya, angamarda, aruchi. Clear? Then come to the pipasa. If we hold the thirst, we do not drink the water, that may be the hypovolemia, and due to the hypovolemia there will be the contested shoshan. And see, everyone knows the ear having a fluid. If regular interval having a patient hypovolemic,
Hello. हेलो विनीता मैम।
आई थिंक वो आउट हो गई है मीटिंग से, ऐसा लग रहा है।
यस मैम।
Her presentation is disrupted. Maybe network issue is there. Please communicate with her, Dr. Kiran.
Yes ma'am, yes.
So till that time, I would like to welcome again all the speakers and audience in this Lady Surgeons Conference, Chapter 2, which is collaboratively organized by the Tameghe Institute of Medical Science Constituent College, Mahatma Gandhi Ayurved College Hospital and Research Center, and Ayush Darpan web portal, the best digital platform, which has emerged as one of the best digital platforms for the Ayurveda, Ayush system of medicine stakeholders. And we welcome you all here from morning 9:30. The sessions are going on. First of all, the inauguration was held, in which there was a part which was attributed to the condolence ceremony of late Honorable Dr. Premvati Tiwari ji ma'am, and later on the virtual inauguration was confirmed, and later on we started with the keynote address of Dr. Sunita Suman ma'am, and which was followed by the speaker presentations. Dr. Nilakshi Pradhan, Dr. Amrita Mishram, Dr. Pradnya Dakhore, Dr. Jayashila Goni, Dr. Kiran, Dr. Nima, everybody has presented their part on various topics relevant to Shalya Tantra, Prasuti Tantra, Stri Rog, then anesthesia in Ayurveda, Sangya Haran, that is we call it as, and the major stakeholder part, that is the ENT, that is Chalakya Tantra department. So all of the speakers, they are highlighting their uniqueness of works with their presentations, and we all are stressing on the need of Sangya Haran in Ayurveda, the post-graduation which has been abruptly stopped by CCIM at the present NCISM, the CCIM which was working at that time. So the mission Sangya Haran restoration also is one of the agendas of Lady Surgeons Conference this year. So I think we are on the 7th or 8th presentation of the day, and Dr. Vinita Tyagi ma'am is presenting her work, but suddenly her presentation was stopped. Maybe some issues were there relevant to technical issues or some network issues. So has she joined now? Yes, I am able to see Vinita Tyagi ma'am.
Yes ma'am, she joined.
Ma'am, will you continue?
Yes ma'am. Ma'am, please share your screen, Vinita ma'am.
Madam, please unmute yourself. Vinita madam. Vinita madam, are you in the meeting? मैडम आपको co-host बना दिया है, आप अनम्यूट कर सकते हैं.
Am I audible now?
Yes ma'am, you're audible.
Let it be screen करने से शायद वो थोड़ा सा नेटवर्क इश्यूज हो रहे हैं, तो I will go through without screen.
Okay fine.
ठीक है मैडम, सम अप कर लीजिएगा मैम.
हाँ सम अप कर लेते हैं. ठीक है. Okay. So Vashveg, I am talking about the Vashveg. Vashveg means ashru, and as I said, the cry is a gift for release attention. Now come to the last point is the Nidra Veg. As we all know, Ahar Nidra Brahmacharya. Nidra is a basic Trayopastambha. So it's really important. Nidra is again very important. And if we hold or we suppress the Veg of sleep, then it will going to cause the Tandra, Shirogaurav, again Shirogaurav, Angamart. These all things are the pressure, congestion, the main retrograde pressure and the congestion. These will cause the diseases in future, or at the time of it causes the symptoms like this. Okay. Then come to the last one, that is Shramaswasa. Shramaswas means if a patient, if a person is want to जो है वो suppress the O2 inhalation, so it's going to cause a can we say कि CO2 की बढ़ जाएगी, that is a hypercapnia, and it will going to cause the headache, confusion, and decrease neural activity and the muscle twinges. Now the last जो मैं कहना चाह रही हूँ, जो मैं बोलना चाह रही हूँ कि that is important कि क्या है, हमें आधारणीय वेग को क्यों समझना है. आधारणीय वेग why important? आधारणीय वेग is important because वेग धारण is not just holding or relieving them from the respective body diameter. It is regarding the respecting your body dynamics and the expressions. ठीक है. Symptoms are interpreted logically depending upon its long-term suppression of body toxins and its reabsorption of the blood circulation and its consequences discussed. What is the conclusion? It is very essential for our good health not to suppress any urges. So do not ignore nature's call, attend it once and when important. ठीक है. And one, I just want to tell you one thing, कि above description we understood that 9 times heart-related symptoms are mentioned in this Adharaniya Veg. And as we know, it's our prime duty is to seriously look at this concept of Ayurveda. Why? Because there is a global cardiac epidemic is ready to break out. As we all know, the very youngsters are also getting the heart attacks. So this Adharaniya Veg is the main symptoms, maybe the main cause behind this. What is the take-home message? These Adharaniya Vegas seems to like to be very small issues, but ignoring or addressing them, we can hire or can prevent majority of the diseases. This is important. Okay. Prevention is always better than cure. Thank you. And I will like to say last one thing. I will like to thank Dr. Sheetal, Dr. Navin Joshi, Vashnesh sir, and all the team members. And I really support the Sangyaharan Muhim. जो हमारे चाह रहे हैं कि हम लोग स्टार्ट हो जाए, तो मैं सपोर्ट करती हूँ उसको और उसको बना रहे, ये चाहती हूँ. Thank you.
Thank you so much, Vinita ma'am, for the excellent presentation on Adharaniya Veg and its practical implementation. Thank you so much once again. Now I would like to welcome our next guest speaker, Dr. Reena Jaiswal ma'am. Dr. Reena Jaiswal Dasar ma'am is Associate Professor, Department of Shalyatantra, Mahatma Gandhi Ayurved College, Salod, Wardha. Her topic of presentation is Critical Review on Management of Partial Prolapse of the Rectum. Ma'am, I would request you to please present your topic.
सबसे पहले नमस्ते सर, वाशनेश सर, बहुत बहुत प्रणाम सर आपको. बहुत दिनों के बाद आज आपके सामने आई हूँ सर. I'm very fortunate enough to present my little clinical work in front of my guru, Dr. Subhash Chandra Vaishnav sir. Namaste sir. Is my screen visible? Is my screen visible?
Yes, this is visible.
Yes, thank you.
Make it full screen.
Yes. So Ayush Darpan Foundation India, in collaboration with Mahatma Gandhi Ayurved College, Hospital and Research Center, constituent unit of Tatamegi Institute of Medical Sciences, deemed to be University, Savangi, Vartha, National Web Conference on occasion of International Women's Day, contribution of female surgeons to Ayurveda surgery, 7 and 8 March 2020. Om Namani Dhanvantari. Respected Dr. Vashne sir, respected Dr. D.N. Pandey sir, respected Dr. Shrikant Kashikar sir, Dr. Kamini Dhiman ma'am, Dr. Veena Patil, Dr. Sunita Suman ma'am, and finally organizing secretary of this event, Dr. Sheetal Asutkar ma'am. I warmly welcoming one and all. Today's topic of presentation is the critical review on management of partial rectal prolapse. Myself, Reena Jaiswal, Devyani Dasar, M.Ed scholar, PhD scholar, Associate Professor, Department of Shalya Tantra from Mahatma Gandhi Ayurved College. So these are the prospects of this today's presentation: introduction, aim, objectives, methodology, followed by discussion and conclusion. So introduction about this one is the rectal prolapse is the exteriorization of the rectal mucosa through anus, occurs at 12 months to 5 years of age and after in old age also, having the causes idiopathic. Acharya Sushruta said about that is the pravahana atisarabhyam nirgacchati gudam bahi ruksha durbala dehasyatam udabramsham adish. So here are the pictorial presentation of that one. Here we can see the normal rectum. Then this is rectal prolapse. In that one, partial thickness mucosal prolapse is only found in the partial rectal prolapse, having the diameter or measurement is 3.75. And here we can see all the layers of that rectum is going to come out, which is beyond the 3.75. Here is also one of the differentials regarding the differences of that presentation. Also, we can see the circumferential presentation of the rectal prolapse, and here we can see the hemorrhoids. So these are the basic differences between the hemorrhoids and the rectal prolapse. So regarding the etiology, there are the two theories of that one: the Broden-Snellman and Alexis Moshkovich. According to the Broden, it is the full thickness rectal intussusception starting about 3 inches above the dentate line. More common in 7th decade, and male as to female ratio is definitely more because of her multiple pregnancies, and also common before 3 years of age group, having opposite ratio with the male as to female. Now, according to the Alexis, it is the sliding herniation of pouch of Douglas through pelvic floor fascia into the anterior aspect of the rectum. Continuation of that one, according to that Broden, constipation with component straining and then diarrhea. Why it going to cause that one is the multiparity and nulliparity. And according to the Alexis, it is a specific anatomical characteristics having the levator animusus, dystasis, redundant sigmoid colon, and loss of the rectal sacral attachment. It happens due to the pudendal nerve damage, obstructitis, then diabetes, and also neoplasty. So these are the types of that rectal prolapse, partial rectal prolapse, and complete one. Here, these are the pictorial presentation, and incomplete, once again, this circumferential and in pouch of that. So symptoms: minimal or spontaneous mass protrusion, then mucus discharge continuously, bleeding per rectum sometimes, difficulty in climbing and descending stairs, especially in old age patients, and bleeding or mucus discharge always in inner clause or the toilet paper. So these are the investigations that we have to carry it out. In our India, we are going to carry out only all these one, but in some major cities, we can go for dephography, sigmoidoscopy. These all also we can do. But in this in such type of cases, there is no need of that one. And diphography, sigmoidoscopy, anal manometry, and pudendal nerve latency studies. So differential diagnosis we've already seen in the previous slides, that thrombosed hemorrhoids, prolapse, and procedentia. So treatment part about this one is, the first is the digital repositioning. That means in child patients, their parents, we are going to instruct the parents about the digital repositioning, submucosal injections with the 5% phenol in the almond oil, and we end up the general anesthesia. Also the surgical cases, in that one, in child cases especially, we are going to keep in him a prone jackknife position, and prone jackknife position, and the retrorectal space is to be entered, and rectum is situated to the sacrum. Afterwards, the Thier stitch, and in adult submucosal injection, rubber band ligation, then excision of rectal mucosa, that is endoluminal stapes. According to the Acharya Sushruta, what the treatment we can do in these cases, Udavransham, Udah Swinnam. Svedana, Sneha Abhyakta, Praveshayeta, means after Svedana, we have to lubricate with the medicated Grita, and we have to keep inside, that is the repositioning. Then Karayeta Gofana Bandham, that means T-bandage, whatever we are going to apply after the post-operative period, this one, Madhyam Chinnam Charmana, Svedayeta Muhur. Means after repositioning of that one, we have to keep a Gofana Bandhan, and this procedure we have to follow daily up to the his comfort. Afterwards, the complete rectal prolapse, reconstruction surgeries, perineal or abdominal approach, rectopexy, Delrom's procedure, Altimier's procedure, and Thier stitch. Here, actually, this one is the Delrom's procedure, how we are going to take a stitch above the dentate line. Then perineal procedures, in that one, Altimier's procedure. Here we are going to see how that rectal mucosa is going to be excised it out. Then complications found in these surgical treatments are injury to hypogastric nerve, so which is going to damage to the other nerves, and so that so many patients will get impotency. Then bladder dysfunction, bleeding from sacral venous plexus, also injury to rectum and sacrum. Definitely after these operative procedures also we will get a recurrence, infection, and constipation. So today in this presentation, this case discussion, total 7 cases, age ranges between 35 to 85 years. I started these operative procedures after seeing my guru's operative procedure, Dr. Varshney sir. Once in 2013, sir did one of the case for rectal partial rectal prolapse, and from that time just I started to do this little one, and up to that whatever the cases I got a very good result, and really I'm thankful to Varshney sir for giving a very nice call from the Ayurveda surgery. Thank you so much, sir. So this patients ranges from 35 to 85 years, having the complaints of partial rectal prolapse with no significant historical aspects, and diabetes mellitus, hypertension, and that, and surgical history also is not so much significant. So this study profile having the aim critical review on management of partial rectal prolapse, having the objective to study this one, selection criteria randomly irrespective of age and gender. So these are the consent brought up, the ethical issues that we have to always keep in our mind for all the rights of patient. These are ethical issues regarding consent and confidentiality of the patient. Now, this is the partial rectal prolapse case. Here, this is the first picture of that one, and this is the picture on the operative table. Here, on in local anesthesia, just this anterior 1.5 mm incision has given. These all procedures I just learned from Varshney sir only. So this is we did the incision, and after that we are going to keep a probe on that area. So here anterior and posterior same. Now afterwards we are going to take out the probe from the outer circumferential area, and after that we are going to keep a thread. So after this all thread and this one, this is a final picture of the thing. So this is the post-operative picture of the patient after 15 days of the operative procedure. So here one of the small surgical video. So here we gave the local anesthesia. Here local anesthesia, small incisions of 0.5 mm. So here is the probe insertion, and finally, second side of that. So here is the taut, not tightening of that one. So the methodology followed for this one is the steer stitch, followed by the Triphala Quath Cyst bath before the procedure, followed by the Changiri Gruta Pichu dressing twice a day, Amal ki Rasayan for 8 weeks, and Triphala Gubul Gandharvaharit ki Churna with the follow for 24 weeks. Having the result is the significant result in reduction of mass protrusion, significant result in reduction of tenderness, pallor, weakness, fatigue, leg cramps, and marked improvement seen in measurement scale. Actually, this thread was kept only for 21 days, and after removing of that, this treatment has carried out. So a discussion about this one is this the tear stitch. It gives the mechanical support, and that support given by the ring resulted in a fibrous tissue deposit locally as a reaction to the ring. So it's going to constrict that ring very nicely. Changiri Kruta have the Amla Kashaya Rasa, Laghuruksha Guna, and Ushnavirya, having the vitamin C, malic acid, tartaric acid, citric acid, and anti-inflammatory, antiseptic, venotonic, and also it nourishes the gastrointestinal mucosa, and where it is very good, enhances the enhances fat-soluble vitamins, also tissue strength. And regarding the studies, when I searched the data about the statistically, so 94 patients have wait for the abdominal surgical treatment, abdominal or perineal, but they are facing the retrograde ejaculation and impotency in 5 male patients. Also in laparoscopic surgeries, 2 meta-analysis studies were done having the sample size of 195 and 688 patients. But there is no significant difference was noted regarding constipation, morbidity, and rehabilitation, and also recurrence is noted. But they have a short hospital stay, longer operative time, and rapid recovery. Actually, these laparoscopy procedures in our India is really carried out in a minimal numbers. Out of India, it is very practicing increase. So conclusion about this one is the really tear stitch. So many students, also for me also, I was thinking tear stitch as actually now no use. But after seeing the Varshney sir's procedure, really when I followed this one, it's got a very good result in old age patient also. And it is a very minimal invasive procedure, and patient have no complaints, and he will too much comfort in daily to follow the daily activities. Also, that Rasayana, Panduta, Tor, Palya, Shira, Shula, Shrama, Gaura, Oruchi, in that one we can give this one. Changiri Gruta effective, found effective in this trial in old age patient. I just in this case also, actually this one of the 85 years of old age patient I got, and just after giving this Changiri Gruta and Rasayana therapy, he got a very good result. Changiri Gruta Pichu application twice a daily with Gandharva Harit ki Churna and Rasayana therapy. I gave him for up to 28 weeks, and he found a very good result regarding that. And it also inhibit this sclerotherapy and further surgical corrections, and also is very easy, cost effective, and very what we can say, a very good technique that we can give to general patients that who do not afford for the economically. So these are the references for my studies. Practice makes perfect, but research makes refined. So let this all refination starts with your all blessings. Thank you so much, sir. Thank you, sir.
Thank you so much, Rita ma'am, for the wonderful presentation and its practical implementation for the very critical cases like prolapse of the rectum. Thank you so much. Yeah, Roshna ma'am. I would like to call upon our next guest speaker, Dr. Roshna Budala ma'am. She is BAMS MS, completed MS from Vidarbha Ayurveda Mahavidyalaya Amravati. She is a PhD scholar pursuing from R.A. Poddar Ayurved College, Mumbai. Ma'am, I will welcome to you. Please start your screen sharing. Yeah. Please make it on a PowerPoint presentation board, ma'am.
Madam, I am audible.
Yes, ma'am, you are audible.
Very good afternoon to all. वाशने सर, आपको मैं प्रणाम करती हूँ. Thanks to Ayush Darpan Foundation Trust and MGC Salud for giving me opportunity for this Lady Surgeons Conference program on International Women's Day. My topic is computer vision syndrome and its management by Ayurveda. My PG guide is Dr. Vidwan sir, PhD guide Dr. Madhukar Lahankar sir. Ayurveda deals with the modification in the lifestyle. In modern lifestyles, every person is getting affected with the radiation, either video display terminal, computer, TV, or mobile. American Optometric Association. Computer vision syndrome is the complex of eye and vision problem related to the near work which are experienced during and related to the or screen use. Incidence of CVS is as high as 50 to 90% amongst the employees of computer occupation. This problem affects productivity by 4 to 19%. In modern method, there is no effective treatment. They use lubricating eye drops only for this treatment. Hence, by using the ancient knowledge of Ayurveda, this integrated type of treatment will be helpful for long period of time. Symptoms of CVS consist of
Ma'am, please make it on a PowerPoint presentation mode.
Symptoms of CVS consist of dry eyes, which is due to decrease in blinking rate, eye strain, which is rarely a tired muscle, sign of inflammatory reaction, burning eyes as a result of dryness, headache of tension type, blurred vision due to inaccurate focusing of image on the retina, watering, which is reflex lacrimation due to irritation in the eye, neck, shoulder pain is posture related symptoms. CVS is caused by our eyes and brain reacting differently on
Ma'am, your slides are not moving. Roshna ma'am.
Okay, madam. I will correct. Okay. Slides moving. Madam, it is now visible. Hello.
It is visible.
It is moving.
No. Can you make a next slide?
Yes, I am making, madam.
No, ma'am, it is not moving.
मूव नहीं हो रही। Take mouse. Madam, now it is moving. It is moving, madam.
No, ma'am, it is not moving.
Not.
No, ma'am, no.
Okay. Now it is moving. Are you able to visualize, madam? Hello. Hello. Hello.
Yes, it is moving, madam.
Now it is moving. Okay. Now, symptoms of CVS consist of, I have read this. CVS is caused by our eye and brain reacting differently to the characters on the screen than they do with the printed character. Our eyes move to the resting point of accommodation and then again focus on the screen. This continuous flexing of eyes creates fatigue and a burning tired eyes feeling. Pathogenesis of CVS is a form of musculoskeletal disorder referred as repeated stress injury, ocular motility, accommodative convergence disorder are problem with neuromuscular control mechanism. Problems. Various research regarding the treatment of CVS are chosen of Trifala arca, but arca as it is, it has a effect. Clinical study of CVS with its management with Mahatrifalakrut Netratarpan and combination of Trifalakrut Netratarpan and ergonomic shows excellent result during the study period and continued improvement. But a problem statement is this: in this treatment of CVS, Netratarpan requires 4 to 5 hours to normalize eye work and daily work gets hampered. So Trifalakrut administered systemically instead of Netratarpan. And other problem is that human blinks approximately 22 times per minute. During computer use, human blinks only 6 to 8 times per minute. So eye exercise has been advised. Objective: provide easily available, efficient medicine for computer users and recommend appropriate quick exercise at appropriate time interval for the extensive computer user. Computer related symptoms and common causes. Symptoms categorized as asthmatic causes, ocular surface related causes, visual causes, and extraocular causes. Asthmatic causes have causative factor, eye strain and sore eyes, binocular vision, accommodation, and ocular surface related also have refractive error and accommodative power. Visual problems are due to presbyopia or binocular vision problem. Extraocular symptoms like neck pain, back pain, and shoulder pain. It is due to the computer screen location. These are the Ayurvedic views of symptoms of computer vision syndrome. These are the symptoms of CVS. These are Ayurvedic terminologies, and this is the variation of doshas according to symptoms. Illustration of Samprapti of CVS. Chakshusha Nidan Sevan. Netrendriya Atiyog by using more computer. Dosha Buddhi and Dosha Dushti.
Dosha Prakop with the predominance of Vata and Pitta dosh, sitting for longer duration in one position causes musculoskeletal problem. Sthana Vaigunya, accommodative stress, astenopic symptoms, Purvar Lakshana, and Vata Pitta dosh Prakop in Akshi portion, ocular surface discomfort. All these three musculoskeletal problem, Purvarup Lakshana and ocular surface discomfort may replace the Netra Roga. These are the Samprapti Ghatak of CVS, management of CVS. Prevention and treatment. Get a computer exam, use proper lighting, minimize glare, adjust the brightness of computer screen, monitor display quality, blink more often, even blink with every click, exercise and stretch eyes, take frequent breaks, modify your workstation, exercise even when sitting. Treatment for ergonomics, eye exercise and Trifalagrut systemically. Ergonomic includes workstation furniture arrangement. This should be the likeness from the eye. Video display terminal should be at the level of 0 degree. Mid part of the video display terminal should be at the 15 degree. Your hand should be at 90 degree. Knee should be at 90 degree and your foot should be at rest. This is the ergonomics for working computer. These are certain eye exercises. Move side to side for 5 times. Up and down movement. This is also down movement. This is diagonal movement upward. This is diagonal movement downward for 5 times. This is circular movement of eye. Near and far focusing of eyes. This is near and far for 15 to 30 centimeter 5 times. Concentrate upward. Massage, squeeze the eyes, and with 2 fingers, slightly wet, rub the eyes, slightly massage, concentration, downward concentration, and this is palming. Palming is done 1 hourly. It is rub your palms and then put on the eyes 3 hourly. And this is 20-20-20 rule. This is WHO accepted rule. It has been also given to the patient. After every 20 minutes, see towards the 20 feet distance for 20 seconds. This is 20-20 rule. All these exercises have been given to the patient. And next treatment is the Trifalagrut. According to Sharangdar Sanhita, Madhyam Khanda Adhyay 9 and 66 Shlok, Trifalagrut has been given systemically. These are the drugs which by which Trifalagrut has been made. This is the Skirmer's test, which is used to do dryness of eyes, to test the dryness of eyes due to computer use. It should be normally 15 to 20, about 20 mm. When it decreases, we call it as a dryness. Drug schedule is given in the eye exercise. Systemically, Trifalagrut 20 gram BD with Koshna gel in morning, before meal and after meal at night for 42 days. Clinical examination duration, all treatment advised for 6 weeks. Before treatment day 0, follow-up were taken on 7th day, 14th day, 21st, 28th day, every weekly up to 48 weeks. And after stopping the treatment, completion of treatment, 180th day, study was done. Follow-up study was done. The sample size was 40 patients. These were the result. Average mean difference among all symptoms is 1.29 and t-value is 3.87, nearly highly significant at the level of 0.01 significant. Percentage of relief is 78% and mean difference is 1.01 at 42 days. After 180 days, after stopping the treatment, this was the data. Mean difference was 0.88 and percentage of relief is 67%. Why trifalagrut according to the Sharandas selected for the eye, selected along with eye exercise? Because Growth is Yogavahi, Rasayan, Snigdha, blood-brain barrier, so reaches up to the ophthalmic tail, Jakshi as a Vatapika Shamak, Brungraj is a Chakshusha, Iclabatin antioxidant, Pimpali, Majjarasani drug, Shweta Chandan is Pitta Shamak, Bala is Ozavartak, Shatavari, Kamala Muleti, Sandheva, Daru Haritra, and Manuka have Rasayan and Balli property. Medasak, Kafavata Shamak, Kamalis Grahi maintain tear film, Vet Kali Mirchi, Sakshusha, Sunti is the Shotagna, Vedana Shamak, Punarnava, Mutral, clears the transforming channels, Haritra is Krumikna, Muleti, glycoprotein, lipids, essential amino acids. Trifalagrut also contains glycoproteins, amino acids, vitamin A, vitamin C, glycerol, lipids, gallic acid, tannin, chebulic acid, and natural forms of steroids. Ajadukta stimulates the mucin secreting gland. Mucin is one of the glycoprotein that lipid maintains normal eye moisture. Chakshusha and Rasayan effect, Trifalagrut also having. Trifalagrut provides strength to the tissues of eye, increases the blinking rate of eye. Trifalagrut is herbo-organic preparation. Conclusion, Trifalagrut is the most effective in the management of eye disorder according to the literature, which is also found helpful for computer vision syndrome. Average result in the symptom, mean difference and percentage of patient relief in patient is 1.01 and 78%. Its p-value is more than 0.01, highly significant at the level of 0.01 after 42 days. All recommended eye exercise can easily be done while computer work along with ergonomics. This is bibliography.
It's good.
Very special thanks to organizing committee to Ladies Surgeons Conference, Dr. Vashne sir and Sheetala Sutkar madam. Thank you.
Thank you so much, Vashna ma'am.
Thank you very much
for your very different presentation, which is the burning, we can say burning problem which we are facing nowadays, computer vision syndrome, and you have very rightly elaborated the Ayurveda treatment modality in the computer vision syndrome. Thank you so much, ma'am. Our last speaker, Dr. Sarita Meena. I think she is not reachable. She is having some internet issues. She is continuously communicating with me. So if she is not able to join right now due to any technical issues, we can postpone her presentation to tomorrow. So moving ahead, so it was a academic feast which began at 9:30 only, and which has almost, we had marathon lectures and we have reached almost 2:18 to 20 it's right now, and all the dignified speakers, they have presented their uniqueness of Ayurveda surgery through their presentations, and at the same time they have highlighted the need of Ayurveda Sangyaharan for the betterment of Ayurveda surgery. And in this way, we have reached the valedictory session. Actually, this is a sum up session of today's presentations. And because there are so many speakers and they are so enthusiastic and they are so they have taken initiative, they are so participative, they are encouraging to each other, and they are very much supportive to each other. So, and we have got the blessings of our Guru, Dr. Subhash Chandra Varshney sir, who is the Mahaguru of surgery today, surgery era in India. And he has been present here since last Lady Surgeons Conference. He is with us. He was with us throughout for the surgery lecture series also, which was conducted on Ayush Darpan last year. So we are very much blessed to have Dr. Subhash Chandra Varshney with us, the Varshney sir with us as the chairperson of today's session, and Dr. D.N. Pandey sir is the guest of honor. Dr. Sangeeta Salvi madam is with us. She is also the guest of honor for this Lady Surgeons Conference. So I would like to request all our respected seniors to join us for valedictory session. सर आप अनम्यूट कर लीजिएगा सर, आपको परमिशन दे दिया है।
कौन, मुझे?
जी सर, जी सर, जी यू आर ऑडिबल सर, यू आर ऑडिबल सर।
ठीक ठीक ठीक, बोलना है क्या भाई?
हाँ जी सर, अभी वैलिडिक्टरी सेशन है, तो आप जैसे हमेशा समअप करते हैं, सब आपके रिमार्क्स सुनने के लिए बेताब है सर।
वाह वाह, धन्यवाद धन्यवाद। तो सर्वप्रथम तो मैं उस पुण्य आत्मा जिसने प्रसूति तंत्र की नींव रखी, ज्यादातर यही कह सकता हूँ, हालांकि कुछ और भी लोग होंगे साथ में, पूना के कुछ लोग हैं उसमें शामिल, लेकिन प्रेमावती का तिवारी जी का नाम अमर रहेगा। और मुझे सौभाग्य है कि मैंने उनके साथ 8 साल काम किया है। हर सैटरडे की सर्जरी ओटी में मैं उनके साथ रहा हूँ और मैंने उनका डिसिप्लिन देखा है, उनकी आर्ट देखी है, तो मुझे बड़ा भाग्यशाली हूँ। और उसके बाद भी मुझे जब कभी मिलती थी तो उनका मातृत्व व्यवहार भी मैंने देखा है, बहुत ही सिंपल एंड ग्रेट। ऐसी महान आत्मा को मैं अपनी तरफ से, आयुष दर्पण की तरफ से, आप सभी की तरफ से श्रद्धांजलि अर्पित करता हूं कि वो जहां भी हो खुश रहे और हम सबको आशीर्वाद वहां से स्वर्ग से देती रहे। ऐसी मैं उनको श्रद्धांजलि अर्पित करता हूँ सबकी तरफ से। फिर आज के इसके ऊपर आते हैं, चर्चा सत्र के ऊपर। तो नाम तो इनका शीतल है वैसे, लेकिन काम में कहीं शीतल नहीं है। ये बड़ा स्ट्रिक्टली, बिल्कुल पद्धति से जिसे बोलना चाहिए, अपना कार्य करती हैं। उसका परिणाम है कि इतने लोग जुड़े आज हमारे साथ में और उनके भाषण हम लोगों ने सुने। कुछ पहले वक्ता ने भी कांटेक्ट किया था, रश्मि ने, वर्षा सक्सेना इत्यादि। तो ये लोग तो नॉन सर्जन है पहले से ही, मंजू है यहाँ की, तो ये लेडी सर्जनों में इनका नाम तो है ही, आशुतकर मैडम वगैरह का, लेकिन नए लोगों को भी प्लेटफॉर्म मिलना चाहिए। तो आज का जो प्रयास है बहुत ही सफल रहा। अपने शल्य, शालाक्य, प्रसूति, संज्ञाहरण, इस सब की तरफ से लोगों को इनवाइट किया और मैं कह सकता हूँ आज का एक बहुत ही सफल आयोजन ये हुआ। सर काशीकर सर इत्यादि, पांडे जी सर, नवीन जोशी सर और धीमान मैडम इत्यादि का यहाँ साथ है, आशीर्वाद है, सालवी मैडम, ये सभी लोगों का आशीर्वाद है और ये आपका बहुत ही सफल आयोजन रहा। इसमें अपने अपने लोगों ने विचार व्यक्त किए। तो शीतल मैडम ने तो पूरा अपना कार्य दिखाया, वो भी प्रशंसनीय है और अभी नए नए कार्य भी उन्होंने किए हैं। मेरा आशीर्वाद है कि वो इसी तरह आगे बढ़ते रहे और संस्था को, आयुष दर्पण को, लेडीज सर्जन को एक एंकरेजमेंट करती रहे, ऐसा मैं शुभकामना व्यक्त करता हूँ उनके प्रति। नीलाक्षी प्रधान मैडम ने बहुत अच्छा अग्निकर्म और विद्या के विषय में बहुत अच्छी बात बोली। सुनीता सुमन मैडम का तो मैं बहुत पुरानी पहचान है मेरी उनसे, बहुत ही सिंपल है। मैंने सबसे बड़ी बात है उनको कभी गुस्से में नहीं देखा है, जब देखा है हंसते हुए देखा है। तो वो वास्तव में उन्होंने अपने डिपार्टमेंट की जो गतिविधियां हैं, वो आयुर्वेद का कंट्रीब्यूशन है और क्या क्या वो लोग करते हैं, सर्जरी में सब करते हैं, ना करने का तो कोई सवाल ही नहीं, ऐसे इंस्टीट्यूट में खड़े हुए हैं वो। तो बहुत ही अच्छा उनका उद्बोधन जो हम लोग सबके प्रति रहा। ये रियली जो है कहना चाहिए, बहुत ही उत्साहवर्धक उनका रहा। निर्मला सावरकर मैडम, इसके अलावा तुम्हारे किरण बेंडसे मैडम, जयशीला गोनी मैडम, ये पारू यूनिवर्सिटी की थी, बहुत ही अच्छा इन सबका वर्णन रहा। अमृता मिश्रा मेरी स्टूडेंट है, बहुत ही अच्छा उन्होंने एविडेंस बेस्ड जो है अपना वर्क दिखाया, वो भी वास्तव में प्रशंसनीय है। रीना जायसवाल, बहुत ही अच्छा उन्होंने प्रेजेंटेशन किया, वो भी बधाई की योग्य है, ये बधाई की पात्र है सबके लिए। और बाकी सभी लोगों ने जिनके नाम, क्योंकि अभी इतना लंबा सेशन हो गया है, मैं अगर 2-2 मिनट भी करूंगा तो आधा घंटा लग जाएगा सबके विषय में बोलने के लिए। मैं यही कहता हूं कि सबका भविष्य बहुत अच्छा है। और सबसे अच्छी बात जो मुझे आज लगी सबके प्रेजेंटेशन से, वो है कमांड, भाषा पे कमांड, सब्जेक्ट के ऊपर कमांड। और मुझे लगता है ये आने वाले समय की बहुत बड़ी आवश्यकता है, और ये लेडीज सर्जन पूरी कर रही हैं, इसमें भी दो राय नहीं है। और मुझे लगता है आगे आने वाले समय में अपने कार्य से और प्रत्यक्ष दर्शन से क्या क्या सर्जरी कर रही हैं, तो हमारा शल्य तंत्र का और ज्यादा विकास हो सकेगा। और सभी ने एक बात बहुत कॉमन, संज्ञा हरण की आवश्यकता के ऊपर जो बोला, वास्तव में प्रशंसनीय है। चोली दामन का साथ है हम लोगों का, संज्ञा हरण के बिना हम अधूरे हैं, हमारे बिना वो अधूरे हैं। हम नहीं रहेंगे तो वो किसको एनेस्थीसिया देंगे, और वो नहीं रहेंगे तो हम एनेस्थीसिया किससे लेंगे। तो एक दूसरे का साथ संवाद संबंध है जो कभी पृथक नहीं किया जा सकता। डीएन पांडे निराश ना हो, के पांडे जी यहाँ बैठे रहे थ्रू आउट, उनको भी मैं नमन करता हूँ। और बाकी जायसवाल जी हैं, बाकी लोग भी संज्ञा हरण के लोग साथ रहे हैं, बहुत पार्टिसिपेंट रहे हैं, थ्रू आउट रहे हैं। मैं समझता हूँ सब थकान का महसूस कर रहे होंगे, तो मैं बहुत ज्यादा ना बोलते हुए अगेन बेस्ट विशेष देता हूँ सभी के लिए, शुभकामनाएं देता हूँ। इसी तरह आप आगे बढ़ते रहे, भगवान आपको तरक्की करता रहे। धन्यवाद मैडम।
थैंक यू सो मच सर, बहुत बहुत धन्यवाद सर। ये सब जो काबिलियत हम लोगों में आई है, ये सब आप जैसे इंस्पिरेशनल फिगर्स को हम फॉलो करते हैं सर, उसके कारण ही ये काबिलियत आ पाई है सर हमारे अंदर। और मैं बहुत प्राउड फील करती हूँ सर कि मैं आपकी स्टूडेंट हूँ और आपके नक्शे कदम पर चलने की कोशिश कर रही हूँ सर। तो ये कोशिश तो सर कुछ हद तक तो सफल हो, यही प्रार्थना है भगवान से। और बहुत बहुत धन्यवाद सर आपका कि आप हमारे साथ जुड़े हुए हैं और आपने बहुत ही सही तरीके से समअप किया है इस सेशन को। थैंक यू सो मच सर। मैं डॉक्टर संगीता साळवी मैडम से भी 2 शब्द कहने के लिए अनुरोध करूंगी।
मैडम मैं हिंदी में बोलूंगी तो सबका एंटरटेनमेंट हो जाएगा। So I'll try to speak in English.
इंग्लिश बोला, हिंदी पण चालेल।
मॅडम ऍक्च्युली मी सगळं सकाळपासून ऐकतेय मी, आणि बेसिकली आज आणि उद्या कॉलेजला सुट्टी टाकली आहे बिकॉज आय डिडंट वॉन्ट टू मिस दिस. सो इट हॅज स्टार्टेड राईट फ्रॉम रिसर्च टिल what we can do today. And the most important part which I felt in all presentations is nobody has taken out the basic concepts of Ayurveda. Sticking to those basic concepts, everyone has highlighted their respective topics, right from Vedhan Karma till the actual surgical procedure. So this is a very important event which we are showing is we are not leaving Ayurveda anywhere behind. We are taking the basics of Ayurveda and going ahead. So nothing can be more successful than this. So it's very nice. All of the speakers were very nice, elaborative, and to the topic. And basically they have tried to show what all they can do. So it's a good future for all of us, and we can do anything, we can do everything. That is what all the lady surgeons are trying to show. We seniors, I don't call myself much senior, but we all seniors are with you, and we can take Ayurveda surgery to heights. So I always say, if there was a Nobel Prize during the time of Sushruta, I think Sushruta would have bagged a Nobel Prize for each and every surgery. The dense topics what he has explained in small sutras is exclusive. And after you become a bit senior, after say 20-25 years of teaching and surgery, you start realizing that Ayurveda has got excellent thoughts, and it's on the basis of Ayurveda what the modern science is taking ahead. So this is a very nice platform, and we are all trying to bring Ayurveda to heights. So this is a very nice. Congratulations to all the speakers, and blessings from Varshney sir. I appreciate one point of him. He is so supportive, and he takes us ahead, and you don't feel bad ki if you have done something, a mistake or something. He is the one who will always take you ahead. Don't worry. Go ahead. चलता है, सब आगे, सबको आगे जाना है. This is what I really appreciate of Ashni sir. It's a real senior guru who has to be like that. And Sheetal madam is, I have no words. So congratulations, Sheetal madam. Congratulations, Naveen Joshi sir, and tomorrow also. So thank you, ma'am. Thank you so much. Thank you, sir.
Thank you so much, ma'am, for your kind words and for the exact representation of the phenomena what is going on in the form of Lady Surgeons Conference. And I really salute you that you have taken leave for today so that you should not miss the phenomena going on. So that's really appreciable, and that's an achievement for me and we all the lady surgeons. Thank you so much, ma'am, for being with us. And please stay with us. Tomorrow also we'll be having the same academic feast what we are experiencing today. Thank you, ma'am. And now I would like to call upon Dr. D.N. Pandey sir. सर जी आपका हमने अनम्यूट कर दिया है सर, आपको प्लीज हमको ज्वाइन कीजिए वैलिडिक्टरी सेशन.
ओके मैडम, थैंक यू. मैंने आज पूरा आपकी सभा का जितने भी लेक्चर्स हुए सबको सुना और रियली आई शुड अप्रिशिएट योर प्लेटफॉर्म विद यू. वार्ष्णेय जी तो खैर आज भी जवान हैं, वो हमेशा जवान ही रहते हैं हर जगह, और उनको हम लोग मुकाबला नहीं कर सकते. उनके काम आज भी उसी समय के हैं जो बीएचयू में स्टूडेंट्स आए के समय वो एक्टिव रहते थे, और उनकी शिष्या होने के नाते मैं देख रहा हूँ कि आप भी उतना ही एक्टिव हैं. और आज के जितने भी स्पीकर्स थे और मैंने देखा सभी लोगों के काम को देखकर बहुत अच्छा लगा कि लेडी सर्जन जो काम कर रही हैं आज वो बिल्कुल आज के अनुरूप है. सुश्रुत के साथ साथ आज का जो भी मॉडर्न कंसेप्ट्स है, मॉडर्न टूल्स हैं, एप्लीकेशंस हैं, वो सबको भी लोगों ने अडॉप्ट किया है. और स्टाइल, रेफरेंसेस, प्रेजेंटेशन, पावर पॉइंट्स के सभी चीजें बहुत अच्छी लगी.
बहुत अच्छी.
और रियली दे आर डूइंग वेरी गुड. बहुत सी इसमें मेरी जान पहचान के भी थे, जैसे पश्मीना जोशी, और जो मेरी स्टूडेंट थी जब मैं जामनगर में था और थोड़े समय जामनगर रहा. मैं संज्ञाहरण के एग्जिस्टेंस के लिए ही वापस लौट गया था संज्ञाहरण को ही वहाँ स्थापित करने. और मेरा ये व्यू था कि संज्ञाहरण जब तक जाएगा नहीं जामनगर और जयपुर तब तक उसको, और रियली वही हुआ. मैंने जो सोचा था, मेरे गुरुजी उस समय मुझे कहने लगे तुम काम नहीं करना चाहते हो, लगता है अब रात में सोना चाहते हो, इसलिए जामनगर जा रहे हो. एसपी पांडे साहब ने मुझे एक कमेंट किया. मैंने कहा गुरुजी मैं जामनगर इसलिए जाना चाहता हूँ कि प्रोफेसर कुलवंत सिंह जी ने मुझे ये ऑफर किया है कि तुम आओगे तो यहाँ भी संज्ञाहरण शुरू हो जाएगा, और इसलिए मैं जामनगर जाना चाहता. गया भी. मैंने शल्य और शालाक के दोनों डिवीजन को वहाँ तीनों संज्ञाहरण का प्लान बनाया था. शल्य शालाक मेरे ही समय वहाँ सेपरेट हुआ, और संज्ञाहरण भी शायद मैं रहता तो वहाँ शुरू हो जाता, लेकिन बीएचयू में मैं अकेले था. यहाँ से लियन पे गया था. ऐसी क्राइसिस हुई कि मुझे थ्रेट किया गया कि संज्ञाहरण फिर से उसी शल्य के अंदर मर्ज कर दिया जाएगा अगर वापस नहीं लौटेंगे तो. और मैं लौट आया, और 2002 में लौट के आया. फिर मैं इस बात पे लगा कि संज्ञाहरण सेक्शन को सेपरेट किया जाए, शल्य से इस प्रेशर से अलग हुआ जाए. और 2005 में सबसे पहले गजट नोटिफिकेशंस में जो हम लोग लगे, एसके शर्मा जी के आशीर्वाद से हुआ, और ये देखिए डिपार्टमेंट भी बन गया. उसके बाद 2016 में वो डिसकंटिन्यूड हो गया 10-11 साल के बाद. तो जो हम लोगों ने एक हमारा विजन था कि जब तक शल्य शाला के सबको एक साथ इक्वली संज्ञाहरण डिपार्टमेंट बन के नहीं सर्विसेज देगा, तब तक आयुर्वेद में सर्जरी का विकास नहीं हो सकता था. इसको कुछ लोगों की नजर लग गई और ये डिसकंटिन्यू हुआ, उसमें हमारे अपने लोग ही हैं, दूसरे को कैसे कहा जा सकता है? जब अपनी काउंसिल में अपने ही लोगों ने उसको बंद किया तो हम दूसरों को दोष नहीं दे सकते हैं। और आज हमारे अपने लोग ही अगर प्रयत्नशील हैं, आज मैंने जैसे देखा चालाक्य से भी, शल्य से भी, प्रसूति से भी, और हर कोने से आवाज उठी है। ऐसी आवाज उठेगी तो हम फिर इसको रिस्टोर जरूर हो जाएगा। और मैं समझता हूँ आप लोगों का प्रयास हम बिल्कुल सफल होगा। तो आज की एक बड़ी उपलब्धि होगी इसे आपके इंटरनेशनल वुमेन्स डे के जिस दिन संज्ञाहरण रीस्टोर हुआ, तो उसमें एक ये फेदर जुड़ेगा कि इसमें इस संस्था का भी बहुत बड़ा कंट्रीब्यूशन है। और जो ये आपका ऑर्गेनाइजेशन है वो भी आयुष दर्पण जो काम कर रहा है आयुर्वेद की दिशा में, उसकी मैं पूरी प्रशंसा करता हूँ। बिना किसी फायदा के हर एंगल में देखता हूँ, काफी यूट्यूब उसका बेसिक प्रिंसिपल्स से लेकर के ट्रीटमेंट से लेकर हर क्षेत्र में उन्होंने इतना अच्छा काम किया है। बिना मतलब मैं समझता हूँ बहुत सारे काम कर रहे हैं लोग ने पैसे के लिए कर रहे हैं, ये किसी बिना पैसे के प्रॉफिट के प्योर एकेडमिक वर्क कर रहे हैं। तो इसलिए मैं इससे जुड़ा भी कि मुझे लगा कि ये प्लेटफॉर्म बिल्कुल निस्वार्थ आयुर्वेद की सेवा कर रहा है और हर दिशा में, चाहे चिकित्सा हो, चाहे शल्य हो, शालाक्य हो, प्रसूति हो, सबके साथ मिलकर काम कर रहा है। तो मैं आयुष दर्पण को भी भाई बहुत ही धन्यवाद करता हूँ, आभार प्रकट करता हूँ आप सभी का, शीतल जी का, और आज के सभी पार्टिसिपेंट्स को बहुत बहुत बधाई देता हूँ कि हम लोग आज इस बड़े ही अच्छे मौके पर जुड़े और कल भी रहेंगे बाकी सब लोग। तो मेरी अग्रिम बधाई इस सफलता के लिए। धन्यवाद शीतल जी, नमस्कार।
थैंक यू सो मच सर। बहुत बहुत शुक्रिया सर आपके अनुभव का, और आपने कथन किया, और आपने जो स्ट्रगल फेस कर रहे हैं आप, उसमें भी हम जितना आपको सपोर्ट कर सकते हैं हम जरूर करेंगे सर। वो तो हमारा प्रयास रहेगा सर कि हम आपके साथ रहे आपके स्ट्रगल में। एंड नाउ आई वुड लाइक टू कॉल अपॉन डॉक्टर श्रीकांत काशीकर सर, वो हमारे साथ जुड़े हुए हैं। सर प्लीज सम अप द इवेंट।
Yeah, thank you very much. I had the honor of listening to most of the speakers, though not all. But then what really surprised me was the command over the subject and the different aspect the ladies presented with aplomb. And that's real, surprise and a great inspiration to the new budding male and female surgeons also. So that is not only for ladies, it is also for the male surgeon. So one-upmanship has to be there, and one learns that way. I would like to specially mention Pradhan Madam for a very distinguished approach. Secondly, Kiran Mendekar gave an excellent view. Pradnya Dakole also gave a different viewpoint altogether. So all in all, it has been a great achievement for the day. And thanks to Naveen sir and Sheetal madam, you have been always there. And Varshne sir, to Varshne sir, what do I need to tell him about that? And I have the great honor that he was my undergraduate examiner, he was my postgraduate examiner. Then we were undergraduate examiners together. Then we were postgraduate examiners together, and then we were PhD examiners. So it has been a great journey with him. So I am really inspired, and he's always at Chodya. So that was the dialogue, Chodya. So you learn to, once you become senior, you learn to let go of things. So that one has to be mature enough, and that only comes with time. And you learn from these stalwarts like Varshne sir. D.N. Pandey sir has always been there. He has been a good teacher, and sir se काफी बार मिल चुके हैं. And yes, sir, we'll definitely will not let you down. We'll try our best for anesthesia, and whatever efforts are required, we'll do it. So with those words, I thank you, ma'am, and we'll join tomorrow also, because this is really an enriching experience for me also. So new ideas come up, you gain something, because it has been like a diamond presentation. So wherever the light falls, that part, that facet shines. So all these ladies who are presented, they have shown the light on one aspect or one facet of the diamond. So by tomorrow evening, I think we should have a complete diamond in front of us and shining in almost all its glory. So thank you very much, ma'am. Asudkar ma'am and Naveen Joshi sir, Vashne sir, pranam. Pandeji, pranam. Anyway, a great venture and a great effort. Thank you very much.
Thank you so much, sir, for the best of words you have used for this Lady Surgeons Conference. It's like a diamond and light falls on every facet and every facet will be enlightened as you said. So we'll try our level best, sir, till tomorrow to highlight the various aspects of Chalya Tantra relevant to Ayurveda in the form of Shalakya Tantra, Prasuti Tantra, Stri Rog Sangyaharan and Chalya Tantra itself. Thank you so much, sir. Thank you for being with us. Always your words, your encouraging words matter a lot, and it's a matter of pride for us that the topmost surgeons from Ayurveda fraternity like Dr. Vashne sir, Dr. Kashikar sir, Dr. Sarvi madam, Dr. Sunita Suman ma'am, Dr. Suman Sharma, Dr. Kamini Dhiman, and all the lady surgeons who are speakers, eminent speakers. So in today's forum, all are here present here on this occasion of International Women's Day celebrations, which have been collaboratively organized by Ayush Darpan Forum Foundation and Mahatma Gandhi Ayurveda College Hospital and Research Center, Salod, which is the constituent college of the Tamega Institute of Medical Sciences, Vardha. And all of us will be joining tomorrow morning at 9:30 sharp. And again, we'll be having an academic feast tomorrow for the whole day. So thank you so much. Thank you so much from the core of my heart to everyone, to the speakers, audience, and to the forum, to Dr. Naveen Joshi ji, who have provided us a very right platform for expressing our uniqueness of Ayurveda surgery in front of the Ayush fraternity, as well as the whole fraternity of Ayurveda. Thank you. Thank you so much.